We'll observe a moment of silent prayer or meditation. Thank you. You may resume your seats. Honorable delegates, I just have one apology for today, and that's from the chairperson who is traveling to Tanzania to participate in the CPA engagements from the 4th to the 9th of June. That's just the one apology that I have. Honorable delegates, I'd like to remind delegates that rules, in particular rules 21, 22, and 23 of Rule 103 would apply. Honorable delegates, before we proceed, I would like to welcome the Honorable Minister of Health for joining us today, together with the Deputy Minister, the Acting Minister for Social Development, who will join us, the Deputy Minister of Social Development, all permanent delegates, MECs, and all special delegates and SALGA representatives who are in the House, and those that would be on the virtual platform. And I would like to also welcome the visitors in our gallery and wish them a pleasant stay in the NCOP. Honorable delegates, I've been informed that there'll be no notices of motions or motions without notice. We shall now proceed to the first order of the day, and that is a policy debate on Budget Vote 18 on Health Appropriation Bill B4 of 2026, which is a Section 77 bill. And I now have the pleasure to call upon the Honorable Dr. A.P. Motsoaledi, the Minister of Health, to open the debate for 20 minutes. Honorable Minister.
Honorable Chairperson in the NCOP, my colleagues, the Minister of Social Development, and my colleague, Deputy Minister of Health, Dr. Joe Pasha, Chairperson of the Select Committee on Social Services, Ms. Desiree Fennis, and members of your committee, MECs for Health present in the House and on the platform. I see in the House MEC for Eastern Cape and Western Cape. Welcome, honorable members. Members of the NCOP, distinguished guests, ladies and gentlemen, it is a privilege to present to you the 2026-27 budget for the National Department of Health and to outline our plans for the new financial year and even beyond. In the State of the Nation address by President Ramaphosa in February this year, he announced 3 very important programs of the Department of Health which must unfold this year. I wish to quote him. He said, open quotes, "We are working to build a healthy nation. As part of preparation for the National Health Insurance, we are investing in health facilities, personnel, and systems to improve access to quality care. We will be undertaking substantial investment in health infrastructure, prioritizing the construction and revitalization of academic hospitals." On a recent visit to George Mukhari Hospital in Garankuwa, I witnessed the dire effects of inadequate health infrastructure. Starting with George Mukhari Hospital, we will be working with various public and private financing institutions to finance the building and revitalization of healthcare facilities, close quotes. The department wasted no time, honorable members, to bring this presidential pronouncement to life. I must emphasize, however, that we are not starting from ground zero. A lot of strategic health infrastructure is already under construction in different provinces, but at various stages of development. We have got Limpopo Academic Hospital with 488 beds, it's 43% at completion. Siloam Hospital in Limpopo, 24 beds, is at 92% completion. The Klabeng Regional Hospital in Bethlehem in the Free State is at 57% completion. Babizani Hospital, District Hospital in the Eastern Cape, 69% completion. Bupilon Psychiatric Hospital, Northwest at 38%. Mapulianeng Hospital in Mpumalanga at 92%. And Middleburg Hospital in Mpumalanga.
Sorry about that, Honorable Minister. Please continue.
Middleburg Hospital in Mpumalanga, we're just waiting for the date for the president to open it officially. Anytime he gives us the date, we'll make an announcement. In February this year, during the budget speech, the Minister of Finance announced an increase in capacity of budget facility for infrastructure, an instrument for managing large public infrastructure. Last week, the Minister of Finance allocated a dedicated person to assist our department with these complex applications. The department has already started working with this dedicated person. Treasury has pronounced 4 bid windows in this regard, and for any infrastructure project that will cost more than 1 billion rand. We as health, we have sent 11 bids, which will, the bids will start in July this year. And we have sent in a bid for Dr. George Mukhari Academic Hospital in Gauteng, Victoria Mklenge, who used to be called King Edward, in KwaZulu-Natal, Nelson Mandela in the Eastern Cape, Chilizini Regional Hospital in Mpumalanga. This is a replacement of a totally dilapidated and aged facility. Also, Elim Hospital in Limpopo, another replacement of a completely aged facility. Then we've also sent in a bid for Soshanguve District Hospital in Gauteng, Dipslo District Hospital in Gauteng, Tabang Hospital in Dobsonville in Gauteng, Eldoret Park Hospital in Gauteng, Holomisa Hospital in Holomisa Informal Settlement in West Honoria in Gauteng, Mpumalanga Mental Health Hospital in Mpumalanga. I'm sure honorable members are going to raise the issue why so many facilities are in Gauteng. It is because of the growth of that province dramatically, from 6 million in 1994 to about 16 million there. Everybody is going Gauteng, and the facilities there are just overwhelmed. The other facilities which we are going to send are 6 community health centers, which will be announced in due course. The second announcement that the president made in February during the State of the Nation, and I quote him, "In support of our program to prevent and ultimately eliminate HIV/AIDS, we'll be undertaking a massive rollout of lenacapavir, a 6-monthly injection that has proven highly effective in preventing transmission of HIV. I can announce here today, honorable members, that tomorrow, the 5th of June, the president is launching this lenacapavir in Secunda, in Mpumalanga. Many international partners in the fight against HIV and AIDS have confirmed that they will be in Mpumalanga to attend to this event. I want honorable members to understand this. We have got 6.2 million people on ARVs. Those are HIV positive. The people who are going to put on lenacapavir are only those who are HIV negative, so that they remain negative forever. We need to understand that difference, which means everybody, before you get an injection of lenacapavir, you must submit yourself to be tested. If you are positive, then we put you on ARVs. If you are negative, we put you on lenacapavir to remain negative. That is the main difference. That's why we call it the game changer. As I'm speaking to you, honorable members, lenacapavir has been delivered 99% in 99% of 360 facilities in high burden district in 6 provinces as a start. We're starting with only 3 provinces, but 360 facilities. We have already supplied lenacapavir there. So when the president launches tomorrow, it must be in those facilities. We have specifically targeted the following categories of the population for prioritization. 1, we have targeted adolescent girls and young women up to the age of 24 years. 2, we have targeted pregnant and breastfeeding mothers. 3, we have targeted female sex workers. And 4, we are targeting men having sex with men, transgender people, and injecting drug users. Those are the 4 people targeted. It does not mean any other person can get lenacapavir. But after sitting with all the stakeholders, we agreed that these are priorities. Honorable members, we are actually in a position to dare say we can eliminate HIV/AIDS as a public health threat, at least by 2030 or so. All we have to do is to work hard, and we know what happens when we work hard. Remember that in 2010, we have launched the World biggest HIV counseling, testing, and treatment program. And what have we achieved? We achieved a dramatic rise in life expectancy from 66.9 years by 2025, which was as low as 54 years in 2010. We have reduced maternal mortality to 89 deaths per 100 live births by 2020, from a high of 240 deaths per 100,000 in 2010, before we started this program. We have also reduced under 5 mortality and reduced incidence of TB. We achieved all this by taming the scourge of HIV and AIDS. So imagine what we can achieve if we work together once more on lenacapavir. The third and last announcement that the president made on that day was elimination of cervical cancer. That is cancer of the womb. I quote the president once more. Open quotes, we are also working to end cervical cancer in our country by mobilizing society to ensure that every young girl between the ages of 9 and 15 years received an HPV vaccine, that's human papillomavirus vaccine. Honorable Chair, cervical cancer is the second biggest killer of women after breast cancer, but we do not have a mechanism of eliminating breast cancer, but we do have a mechanism of eliminating cervical cancer. Without any doubt, honorable members, cancer is now becoming our new HIV/AIDS pandemic. The sooner we do something about it, yes, the better. It is spreading at a rate perhaps as fast as HIV/AIDS used to spread. Scientific advances have now put us in a position where at least it's possible to eliminate one of them, cervical cancer, to help women. The World Health Organization has delivered a formula called 90-70-90. I'm sure many of you know the formula of eliminating HIV, which is 95-95-95. 90-70-90 means the following, that the first 90, that young girls between the ages of 9 and 15 years, at least 90% of them must receive this vaccine. I want to inform the House that we are lucky as a country because somehow we started this HPV vaccine in 2014. As I'm speaking in front of you here, we have vaccinated 6 million girls in our country. And we're only vaccinating in public schools because we thought parents in private schools are well-to-do, they can do it on their own. Now, the World Health Organization has just informed us that 1 dose is enough. We used to give 2 doses in February and October. That 1 dose is enough. So we have decided because of that, we are now extending our campaign even to private schools. The second, the middle 70, means that 70% of women aged between 35 years and 45 years need to be screened with a new DNA-based technology. I'm sure many women here will know something called a pap smear, which many have been doing. We are now replacing a pap smear with a better technique that is DNA-based. Now, while the World Organization has defined the years of 35 to 45, because of our unique, unfortunately unique but unwanted problem of HIV and AIDS, we have somehow amended this World Health Organization formula because in our country, 65% of all women diagnosed with cervical cancer are actually HIV positive. For this reason, we have amended this formula to 10 years earlier and 10 years later, meaning instead of 35 and 45 years, we have done 45 and 55 years. Because we need to work harder than all the other countries. The last 90, honorable members, is that 90% of women with advanced cancer, that means those who are at stage 3 and 4, need to be put on treatment. I want to make it clear in front of you. That's where we don't want to go. Because it means chemotherapy, it means radiation, and other demanding and very expensive techniques with very highly trained oncologists, which many of whom we do not have. And clearly, honorable members, there is no woman anywhere in the world who will want to find herself in a position where they've got advanced cancer, which means all of us is in our interest to work very hard so that the first 90 and the 70 are actually achieved to avoid the last 90. Honorable members, we have also undertaken to screen 5 million people for TB on an annual basis. This project was launched on World TB Day last year by the Honorable Deputy President. We shall be using modern digital X-ray machines to do so. 2 weeks ago, I received 2 digital portable X-ray machines from the ambassador of South Korea. This portable X-ray equipment can be carried on your back into the mountains and far rural areas, so there's no issue about roads and all that. It is also designed to work on artificial intelligence, which means it can analyze an X-ray within 1 minute. What it means is that you don't need a highly trained, qualified radiologist to read what is on your X-ray in the far rural areas where we don't have such radiologists. So this is a very, very big development for us. At the moment, we have 4 of these portable units in the country, and we shall announce in due course where we are going to start utilizing them. We are already putting a plan to start launching. Honorable Chair, health has suffered austerity measures for over a long period of time, a decade of austerity. And last year, after discussing with the Minister of Finance, he decided to start the first steps, just the first steps, to take us out of austerity. He gave us a sum of 6.7 billion rand. We decided, honorable members, at the National Health Council, Minister and all MECs sitting together with SALGA and South African Military Health Services, we decided that this amount of money is not what we wanted. We wanted much more than that, but at least it's better than nothing. We decided, what must we do with this money that will make an impact on public health? We said we must hire 1,200 post-community health doctors. We must hire 27,000 community health workers. We must acquire 1.4 million articles worth 1.3 billion to spice up public hospitals in the form of new beds, bassinets, mattresses, etc., etc. And lastly, to pay whatever accumulated money we owe to service providers. Today, I wish to give you an account of how far we have gone in executing these 4 projects. 1, out of the 1,200 doctors, from January to March, I could not yet get the figures from provinces for now, but from January to March, in that period of 3 months, we had hired 933 post-community service doctors. I want you to understand, it's not all doctors. Doctors who are doing internship, more than 2,000, we have long hired them. By October last year, we gave them letters of appointment. Doctors who had to do community service, more than 2,700, we have also given them their letters last year. These ones are the post-community service doctors who have completed internship and community service. 933 are on the jobs, and the adverts are still being filled. On the hiring of 27,000 community health workers, by the end of March, we have hired 22,856 with matric, whose matric has been verified. On acquiring linen, beds, and other articles, I can confirm that 25,589 new beds have already been purchased. 83,333 new mattresses have already been purchased, and 73,748 new pieces of linen have been procured by the end of March. On the accruals, we have paid 1.4 billion rand by the end of March and still continue. This is the money specifically from Treasury. Provinces are encouraged to use their own resources to pay for more accruals. It's not that National is paying for them. We're just trying to boost them. Honorable House Chair, I wish to thank the Acting Director General, Professor Nicholas Cripps, and the team is leading with the hard work they are doing. I wish to thank my colleagues, the Deputy Minister of Health, Honorable Dr. Pasha, for a very good working relationship such that we are able to log these successes. Honorable House Chair and honorable members of the House, I hereby wish to present to this House the budget of the National Health Department of 64,807,200,000. Sometimes people get confused. This is the budget of the national department because I represent that department. Each province have got their own budgets, which they will mention here in this house, which are not part of this 67 billion. Honorable members, thank you very much. I'm left with 2 minutes deliberately. You'll give it to me, I hope. Thank you.
Thank you very much, Honorable Minister. I've noted your 2 minutes, so I shall add that at your end of your debate. Thank you very much. Now we move on to the Chairperson of the Select Committee on Social Services, the Honorable Finis, for 15 minutes.
Thank you, Deputy Chair, Honorable Deputy Chairperson, Honorable Members, Honorable Ministers of Health and Social Development, Honorable Deputy Minister, esteemed guests, ladies and gentlemen. As the Chairperson of the Select Committee on Social Services, it is not merely a privilege, but a profound and urgent calling to address this August House today during the budget vote of the Department of Health. Our debate on strengthening health systems to advance universal health coverage is not a sterile academic exercise. It is a fierce commitment to the very heart and soul of every South African, a pledge to their fundamental right to health and well-being. From the dawn of our democracy, the African National Congress has been unwavering, unyielding, and absolutely resolute in its commitment to utterly transform the entrenched legacies of the two-tiered health system. This deeply unjust system, born of apartheid's cruelty, has for far too long forged a gaping wound between those who can afford quality health care and those who are cruelty denied it. Let us be explicitly clear. The apartheid health system was designed for inequality. It was a brutal built on racial segregation where access to care, quality of facilities, and even the very pathways of medical training were rigidly determined by race. White South Africans, a privileged minority, enjoyed access to world-class facilities, highly trained staff, and ample resources, often benefiting from a well-resourced private sector. Meanwhile, Black South Africans, the vast majority of our population, were deliberately, systematically relegated to a severely underfunded, overcrowded, and understaffed hospitals and clinics, often in the Bantustans receiving vastly inferior care. The very concept of universal health coverage was abhorrent to that regime. Access to health was a cruel privilege tied to race and economic status, not a fundamental human right. This historical context is not just a footnote. It is the very bedrock upon which our current struggles and aspirations are built. The stark, searing realities exposed by the health market inquiry and the Section 59 report are not just dry statistics to be filled away, Honorable Billy. They are blistering indictments of a system that, while no longer legally segregated, still bears the deep, painful scars of its oppressive past. These reports bravely lay bare the exorbitant cost, the crippling fragmentation, and the profound inequalities that continue to plague our health landscape. They reveal a landscape where economic inequality too often mirrors the racial disparities of the past, where the burden of disease falls disproportionately on the poor, and where access to specialized care remains a luxury for too many. These findings serve as a thunderous call to action, a powerful, unambiguous reminder of the urgent, immediate, and non-negotiable need for fundamental revolutionary change. We cannot and we will not rest until these legacies are fully dismantled. Honorable Mokai. It is in this crucible of historical injustice and present day challenge that we explicitly affirm with every fiber of our well-being the National Health Insurance, the NHI, Honorable Badenhorst, as the central, indispensable pathway to achieving universal health coverage. The NHI is not some fleeting ideological not a hasty, ill-conceived plan. It is a carefully considered, meticulously crafted, evidence-based strategy to dismantle atom by atom the fragmentations and inequities that define our current system. It is about utterly transforming healthcare from a commodity into a fundamental human right. It is about ensuring that access to quality healthcare is a sacred right, not a cynical privilege. Cruelty determined by one's ability to pay. It's about pooling our collective strength, our shared resources, uniting our nation's health budget, strengthening our public facilities with unwavering resolve, and ultimately forging a healthier, more equitable, more just nation. The NHI is our commitment to a South Africa where no one is left behind due to the cost of care. However, honorable members, the journey of the NHI is not without its formidable challenges, and we must fast track with relentless urgency. Critical preparations, reforms to support its phase implementation. This includes, but is not limited to, fortifying the very foundations of the Office of the Health Standards Compliance to ensure uncompromising, consistent quality across all facilities, public and private alike. We must accelerate with passionate zeal infrastructure revitalization, building new clinics, upgrading hospitals, and ensuring that our health facilities are not just fit for purpose, but beacons of hope and healing. In every community, improved governance across the health sector is not an option. It is an absolute, categorical, non-negotiable imperative. Without robust, transparent, and accountable governance at every level, from national to local, even the best intentioned policies will crumble into dust. We must root out inefficiency and embrace best practice in health administration. In the 21st century, digital health systems are no longer a mere luxury, but an absolute necessity, a lifeline for dramatically improving health outcomes and the quality of care. From electronic health records to telehealth services, from remote diagnostics to real-time data analysis, technical offers immense transformative potential to streamline processes, enhance diagnostics, improve patient management, and empower both patients and practitioners. Yet, we must acknowledge and address the imperative, the burning need of closing the slow and uneven implementation across all provinces. The digital divide within our health system must not be allowed to widen. Every province must be equipped and empowered to leverage these technologies, ensuring that the benefits of digital transformation reach every citizen, regardless of their location or socioeconomic status. This is not just about efficiency, it's about equity in access to modern care. Honorable members, we cannot, will not shy away from acknowledging the persistent governance failures that continue to undermine, sabotage, and betray our transformation agenda. Corruption, mismanagement, and a shocking lack of accountability erode public trust like a corrosive asset, and divert precious resources away from where they are most desperately needed. This committee calls for robust, unwavering parliamentary oversight and relentless accountability from the executive. We must ensure that those entrusted with public health resources are held to the highest, most unyielding standards, and that consequences for failure are swift, decisive, and uncompromising. We owe it to the people we serve to ensure that every rand is spent wisely and ethically, directly contributing to better health outcomes. Furthermore, this committee expressed concern over the budget in real terms for the Department of Health. The implication of this underfunding of key programs from our vital TB initiatives, which have saved countless lives, to maternal and child health, which lays the foundation of future generations, are profound, devastating, and deeply worrying. We dare not compromise on the health of our nation. We call for the unwavering prioritization of the social wage in defending and advancing our democratic gains. Investing in health is not an expense, it is an investment in our very future, our human capital, in our productivity, and in the enduring prosperity of our beloved nation. A healthy nation is a productive nation. A resilient nation, a nation capable of achieving its full potential. Finally, we must emphasize that the public confidence in our health system is paramount, sacred, and absolutely essential. This confidence is earned through tangible, undeniable improvements, reduce waiting times, demonstrate improved patient care, better management of complaints, and unwavering accountability from the department and all its entities. Every citizen deserves to be treated with dignity and respect, to receive timely and effective care, and to have their concerns addressed with urgency and empathy. It is our collective sacred responsibility to ensure that our health system truly serves the people it is meant to protect, with passion, with dedication, and with unwavering commitment. Let us therefore unite with fierce determination in our commitment to build a health system that is equitable, efficient, and accessible to all. Let us work tirelessly, relentlessly, and with every ounce of our being to ensure that the promise of universal health coverage becomes a lived, vibrant, and undeniable reality for every single South African. I thank you, and may our collective efforts forge a healthier, brighter future for all by improving the budget of the Department of Health. I thank you, Deputy Chair.
Thank you very much, Honorable Finis. The next participant in the debate is Honorable Du Plessis for 7 minutes.
Honourable Deputy Chair, Minister, MECs, and fellow South Africans, healthcare comes with a duty of care that ensures the dignity of every patient is regarded as top priority. This duty of care is a shared responsibility, and in public healthcare, this responsibility includes every person in the ecosystem of public healthcare. In South Africa, as I've often mentioned, the duty of care is encapsulated in the Bottomela principles that each clinic and hospital in public healthcare needs to implement. These principles are world-renowned and respected. They comply with various policies of the World Health Organization, and they point to a world-class benchmark. Why then do we not have a world-class healthcare system? No matter the political spin, no matter the rhetoric that will be used in today's debate, the fact is that Batopele principles are not implemented effectively and efficiently, and this cannot be discounted. No one can argue that Tembisa Hospital is labeled by independent organizations as the most dangerous facility as a result of disproportionately high levels of medical negligence, adverse events, severe infrastructure collapse, and let us not forget the murder of a whistleblower. Neither can anyone argue that Charlotte Maxeke Hospital in Johannesburg is remotely world-class, with high rates of patient infections, long backlogs, and famously infrastructure issues, including the incomplete rebuilding after the 2021 fire. Finetown Clinic in Lenasia and surrounds, Jubilee Hospital, Chris Hani Baragwanath Hospital, none of these have focused on the Batopele principles. Outside of Gauteng, hospitals in the Eastern Cape, like Mthatha General Hospital, are known for poor hygiene, lack of basic linen, and staff negligence. And in KwaZulu-Natal, RK Khan Hospital made headlines for deteriorating conditions, rodent infections, and severe lapses in patient care. The list of clinics and hospitals that have not fulfilled their duty of care throughout South Africa is endless. However, let me give credit where credit is due. Mamelodi Clinic has turned around with strategic and focused interventions. Khayelitsha Clinic is continuously improving and offering service through public-private partnerships and utilizing AI-enabled retinal scanning, showing the benefits of all forms of e-health. The Harry Komai Hospital in George is regarded as one of the top TB treatment hospitals in the world. The list is there, however, much shorter than the list of those who do not fulfill their duty of care. The frustration felt by patients can be understood when billions have been spent on the ecosystem of healthcare over years, yet they experience a system that is overwhelmingly not implementing Batopele principles. People will be angry, people will be disillusioned by those who have been entrusted to ensure access to adequate healthcare. On looking at the APPs, there are various goals that will address the shortfalls in the healthcare ecosystem. However, historically, many of these goals have not been adequately achieved, which is a concern for future achievement. In the 2030 goals, life expectancy at birth needs to be 70 by 2030. In 2024, it was 66.5, and it increased to 66.9 in 2025. At this trajectory, 70 will only be achieved 3 years after the goal date of 2030. However, the decrease in TB incidences show great promise, again showing that there are things to celebrate, but there are areas of deep concern. It is further of concern that the difference between universal healthcare coverage and national health insurance is not understood by the department. Simply stated, universal healthcare coverage is the goal. It is the goal that we support as a UN SDG. It is a goal that we strive for where we govern as the Democratic Alliance. It is a goal that addresses the basic principles of the Constitution of South Africa to protect the vulnerable in society. However, universal health insurance cannot happen in a broken ecosystem. It cannot happen when more money budgeted for healthcare finds creative ways through conditional grants to the pockets of the corrupt than to the ecosystem of health. NHI is not UHC. NHI is flawed how the department is suggesting we'll be able to implement universal healthcare. The money bill, further taxing the people of South Africa to pay for the corruption and fraud of the past 30 years. There are other funding models that need to be discussed before another slush fund for the greedy is created. The first funding model is what happens in the Western Cape. Stop corruption and spend money budgeted for healthcare, for the healthcare ecosystem, on the maintenance and improvement of health services. There are more solutions, and we are open to discussion. But let's start with stopping corruption and see how well the healthcare ecosystem is able to fulfill the duty of care based on the Batapele principles. I thank you.
Thank you very much, Honorable Duplessis. Honorable members, the temperature in the chamber is being addressed. I've asked the staff to attend to it. The temperature was fine all this time. I don't know why suddenly somebody switched it on and made it so cold. I know we got many doctors in the house today. Even the Minister of Health is here, but we don't want to get sick. So please attend to it. Thank you very much. The next participant in the debate is the Honorable MEC from the Eastern Cape, MEC for Health, Honorable Kapa, for 10 minutes.
Honorable Deputy Chair of the NCOP, the Honorable Minister, the Honorable Deputy Minister, Honorable MECs, Honorable Members, ladies and gentlemen, good afternoon. It is a privilege to participate in this public debate on budget vote for 18 health during the year in which South Africa marks 3 decades of constitutional democracy. Former President Nelson Mandela reminded us that a nation should not be judged by how it treats the highest citizens, but its lowest ones. That principle continues to define the moral test of our health system. South Africa continues to operate within a deeply unequal, two-tier health system, where a small minority access private healthcare, while the overwhelming majority rely on an overstretched public sector. Nowhere in this reality more than evident in the Eastern Cape, where poverty, rurality, and the vast distance continue to shape access across the 777 primary healthcare facilities, 42 community health centers, and 65 district hospitals, often requiring commuters to travel long distances across to access services. We have strengthened institutional leadership across the health system, and we are embarking on appointing 24 chief executive officers. To date, permanent CEOs have already been appointed at Frere Hospital, Frontier Regional Hospital, reinforcing stability, accountability, and effective governance. Recruitment are underway for Livingstone Hospital, Nelson Mandela Academic Central Hospital, Madwaleni Hospital, St. Elizabeth, and Mpilisweni. Our workforce remain our backbone of health delivery. During the financial year, the department appointed 282 medical officers, 156 medical officers for community service, 21 medical specialists, and 20 registrars, bringing a total of 479. Some were appointed through the ministerial allocation, as it was mentioned here by the minister. A total of 1,874 community health workers have been permanently employed by the department, supported through the allocation of 450 million. Lay councillors to be supported through an allocation of 112 million. We have further strengthened emergency medical services by appointing 248 emergency care officers, 4 paramedics. We further prioritize rebuilding a non-clinical support system by recruiting 1,000 general workers together with the additional administration personnel to strengthen infection control, patient flow, and overall quality of care. We have also bought 31 emergency vehicles, and another 61 will be delivered by the end of July. Primary healthcare remains the further foundation of our system. Through a ward-based primary healthcare outreach teams, the province conducted more than 1.4 million house visits across the province. We have also implemented 84 integrated outreach programs where we conducted across the province, including a program in OR Tambo district, which will reach more than 10,000 community members in partnership with the Department of Social Development as well as Department of Defense in the country under the Project OE2. We are also making significant progress in the digital transformation. The HMS2 billing system and electronic medical record platform have now been implemented across the 49 facilities and EMS bases. This module has contributed to a 66% increase in the revenue emanating from the medical aid claims, rising from 19.2 million to 32.4 million. In the 7th administration, we are also addressing the medical legal pressures through an integrated strategy. New cases have declined from 124 to 91. At the same time, centers of excellence for cerebral palsy are being established at Doranginza, Cecilia Makiwane, and Frey Hospital, shifting the system from litigation towards prevention and improved clinical care. Working with the Office of the Premier and Provincial Treasury, we are strengthening the management of medical legal matters and safeguarding the increase of children through the dedicated public health defense. Prevention remains central in our work. Births among the girls aged 10 to 14 has declined. The longer-term trend shows a reduction from 553 deliveries in 2022-2023 to 395 in 2023-2024, 396 in 2024-2025, and 292 in 2025-2026, a 7% reduction from the baseline of 2022-2023 financial year. For the 15 to 19 years age group, the annual trend continues to decline, with the deliveries decreasing from 17,064 in 2022-2023 to 15,000 in 2023-2024, 14,903 in 2024 and 2025 to 13,916 in 2025-2026, 18% decrease from the baseline. We are also expanding the HPV vaccination in the 2025-2026 financial year. 59,916 learners across the district public and special schools were vaccinated, achieving 93% school coverage and the 98% grade 5 first dose coverage. The department achieved its target for the maternal mortality in our facility ratio during the 2025-2026 financial year, reporting 105 maternal deaths per 100,000 live births against the target of 120. Crime has increasingly became a health issue, especially in the Gqeberha area. In response to this, the department is implementing excessive security upgrades across facilities, including perimeter fencing, CCTV systems, biometric access controls, and centralized monitoring. This system has already been piloted in Nelson Mandela Bay District and will be rolled out across the province. The long-term objective remains the expansion of the safe, fully functional 24-hour community health centers across the province. Because in Gqeberha, as we speak, we've got about 9 facilities that are not working 24 hours because of the issues of crime. That is why we're prioritizing. And again, we have, as a department, invested 416 million on oncology unit under construction at Nelson Mandela Academic Central Hospital. It will include 68 beds and house 2 state-of-the-art linear machines valued at 42 million, as well as the biometric machine valued at 26 million. For the first time, the patients will be able to access chemotherapy, radiography, and follow-up services closer to their home. As we speak, the patients from the eastern part of the province, they travel 4 days to access that service. But we are promising that as of 18 July, we'll be commissioning that facility. Earlier this year, we have also launched the Eastern Cape First Public IVF Clinic, making the province only the 4th in South Africa to offer a public fertility service. Major investments are also underway as at St. Elizabeth Hospital, Greenville Hospital. The construction of Elundini CHC has been prioritized in the current financial year. The project is estimated at 60 million and projected to be advertised in the last quarter of the financial year. Indwe CHC is also taking shape in Krisani district. The project is also estimated at 120 million. This includes the project is not merely a building, they are investment in human dignity, healthcare access, and employment and provincial development. Last week, Department officially introduced a contractor in the far-flung areas of the Eastern Cape in Mozahil local municipality, where we handed over a Good Hope clinic. The significance about this clinic is that there's been a dispute about the site, and the communities fought about it, and houses were burnt, but we can safely say we've managed to resolve that, and we've handed over a contractor. The Eastern Cape Department of Health has been allocated a total budget of 32,983 million for the 2026-2027 financial year. The largest allocation remains compensation of employees at 22,409 million, including an additional 242 million to support the employment of medical professionals, 269 million dedicated to strengthening and upgrading community health worker program. A further 1.7 billion has been allocated to health infrastructure, including 880 million to the health facility revitalization grant for upgrades, additional and refurbishment across the province. The investment is supporting major projects such as 560 million for Emadwaleni Hospital, and combined with 1.6 billion investment in the upgrading of Bambisani and Zitulele Hospital. We further continue to appeal for support in addressing the historical debt burdens and for greater investment in strengthening clinical service.
Thank you, Honorable MEC. Your time has expired.
Thank you very much.
Thank you. Honorable delegates, I now have the pleasure to call on the Deputy Minister of Health, the Honorable Dr. M.J. Phahla, for 15 minutes.
Thank you very much, Honorable Chair of the session, the Deputy Chair of the NCOP. Let me also recognize my colleague, the Minister of Health, Dr. Motsoaledi, Minister of Social Development, just taken leave. Any other ministers, deputy ministers, MECs, MEC for Western Cape and the Eastern Cape, and other MECs online. The Honorable Chair of the committee, Mayor Desiree Ferris, we also greet you, and the members of the Social Services Committee, and all the members of the NCOP present, distinguished guests, ladies and gentlemen, good afternoon. I indeed feel very much privileged and honored to participate in this debate today of our health budget vote 18 of 2026-27. This is made more significant by the fact that we have just started Youth Month in a year where we also commemorate 50 years of the 1976 Youth and Student Uprising. Also 70 years of the Women's March to the Union Building, and of course 30 years as we also celebrate the Democratic Constitution. It may be of interest to members of the House, and I hope you don't take out your calculators and start estimating our age, that myself and Minister Motsoaledi did our matric in this year of 1976. And it was in this year that on the Monday morning in the month of November, we sat down for our paper one English paper in this very difficult year, very tense, but you know, we had to soldier on. So I want to take this opportunity to dedicate this budget vote to the brave youth of 1976, and also to the prosperity and good health of the youth of today. Honorable members, we are again reminded that we are only 4 years to the attainment of our goals of the strategic development goals as set out by the United Nations and our own NDP targets of 2030. It is in this regard that on 25 September 2025, heads of states gathered in New York at the UN high-level meeting to commit again to accelerate action against non-communicable diseases and achieve the UN targets of 2030. Subsequent to that, a political declaration addressing dealing with cancer, diabetes,
heart disease, and also mental health was adopted by the UN General Assembly on the 15th of December last year. Here in our country, as we push for elimination of infectious disease with a major focus on HIV and AIDS, TB, malaria, and children's infections, we also continue to see a rapid rise in non-communicable diseases, those which are listed by the United Nations, but also including chronic lung disease. We therefore launched our National Strategic Plan for Prevention of these non-communicable diseases in the 6th administration, and thanks to all the MECs in the 6th and also in the 7th administration for embracing this program and rolling out the prevention of NCDs in all provinces. Just a few months ago, I was in Limpopo province in the Giani district, where we had a very good turnout by community leaders and community structures embracing the campaign against a campaign for the prevention of non-communicable diseases. Our campaign entails providing health education, focusing on prevention, screening for early detection, and initiation on treatment where necessary. Our integrated approach means that every time when there are major events such as the World TB Day, World AIDS Day, including, as a minister has indicated, that tomorrow will be on a major campaign to launch the lenacapavir injection for prevention of HIV. There will also be screening for non-communicable diseases and also some of the infectious diseases such as HIV and TB. We provide these comprehensive services to provide healthy living and to do screening for both NCDs and communicable disease. We've also improved our media campaigns, such as through the radio, social media, and also billboards. We extended our screening coverage by also training traditional healers to also be able to, because we know many of our people start when they have ailments, they start with traditional healers. So we have trained them to be able to measure blood pressure. They have blood pressure machines, those who have been trained. They also are able to do urine sugar to see if their clients have raised sugar levels in their blood. And I was quite impressed some few months ago when we were in the Northwest Province at the Muruleng with Khoshi Pilane, where the traditional healers were demonstrating their expertise in taking blood pressure and also in measuring urine sugar. So this is to make sure that nobody is left behind. As a result of this, in the 2025-26 year, we managed to conduct a total of over 39 million blood pressure screening and the same number for urine sugar and blood sugar, actually. Another major non-communicable disease explosion, which Minister Mutwalidi referred to, specifically as far as cervical cancer is overall cancer, it's an increasing threat to the health of South Africans, as it is so in other parts of the world. Leading cancers such as breast cancer and cervical cancer for women, prostate cancer for men, and colon and lung cancer amongst men are also rising rapidly. The mainstay again of this remains prevention through healthy living, healthy diet, non-smoking, and minimal use of alcohol, and also exercise, very important. Secondary intervention is, of course, early detection, as mentioned with cervical cancer. In many of these cancers as well, they can be, you can prevent and also detect early. Other cancers can be detected early through screenings and even self-examination in as far as breast cancer is concerned. If all that fail, we make sure that we can treat early, which is becoming very paramount. So we're working with the provinces to increase oncology services. The MEC for Eastern Cape has already alluded to the program which has been rolled out in Mthatha at the Nelson Mandela Academic Hospital. Now, Honorable Du Plessis, I think, very misinformed about conditional grants. The very program of making sure that all provinces can be assisted over and above their normal budgets is through these conditional grants, because we are then targeting areas where there is an inequality in the country. And that's why, for instance, Eastern Cape is being assisted to develop not just chemotherapy, but also radiotherapy to make sure that cancer treatment can be available all over, even in the rural provinces. We support the provinces through maintenance of radiotherapy infrastructure, first of all, installing those infrastructure and then maintaining them, expansion of diagnostic imaging, and also pathology services, also recruitment and retention of highly qualified staff, such as oncologists and also specialists, including in the rural areas. Mental health is a major area of pressure of our health system. Over and above other social conditions which trigger mental illness, such as anxiety and depression, the explosion of substance abuse amongst our young people is putting a lot of pressure on our health facilities, from district level right up to central hospitals, where casualty departments have to deal with many young people, especially young men, who consume lethal substances such as crystal meth. It is therefore of great worry for us, honorable members, when we hear of incidences where law enforcement officers are alleged to be involved in aiding and abetting criminal syndicates who are pushing narcotics amongst our youth and children. This is not just a health hazard, but it's also is a social problem which all of society must rise up and fight against. In order to increase access to mental health services, we have integrated mental health into our primary health services, with 75% of our community health centers having at least one mental health practitioner. That is either a psychiatrist doctor, a psychiatric nurse, a psychologist, or a registered counselor. Honorable members, we are also expanding our services in a situation where a high burden of disease, both communicable and non-communicable, have to keep on innovating. And one of the innovations which we have brought, which has been rolled out and increasing, is the central chronic medicine dispensing and distribution. Through this innovative program, patients who are stable on treatment can obtain their treatment closer to home, whether it's in terms of chronic infections such as HIV and TB. They can receive their medication if they are stable at pharmacists, at GPs, community centers, and even traditional authority offices, so that they can relieve pressure on the health facilities, but also relieve their spending in terms of on transport. We currently have 2 service providers who receive scripts from more than 3,000 health facilities. As by the end of 2026, just over 3.6 million patients have already been currently participating in this program. Patients can now receive up to 3 months of package of treatment at the time, which reduce frequency of traveling. More than 2 million of these are those who are on ART. But we are also working to make sure that we can, as patients are more stable and our systems are also stable, we can even provide treatments with some have even started on 4 months and even want to go up to 6 months. Honorable members, no nation can improve its health if it does not look after its children. And therefore, our integrated school health program, which was started in 2012 in collaboration with the Department of Basic Education, has been growing in leaps and bounds, providing screening for vision, hearing, oral health, and also providing immunization at schools. Those who need more services are referred accordingly. Over the last 16 years, more than 10 million children have benefited from the integrated school health program. Outside of school, we continue to provide youth-friendly services at our primary health services, where we have established youth zones where young people feel safe, even from sometimes the pressure of parents. They can receive counseling, receive services, including in as far as family planning and various other support. We remain concerned about the persistent high rise of HIV infections amongst young people, especially young girls, adolescent girls, and young women. Even more concerning is the persistence of child pregnancy and teenage pregnancy. We're happy to get feedback, including what the MEC of the Eastern Cape has reported, significant improvement in this regard. We remain highly concerned about the increase of usage amongst young people of novel smoking products such as e-cigarettes and vaping. These have been proven. There's clear evidence that these products are very dangerous to the lungs and cardiovascular systems and even brains of young people. Evidence shows that in some instances, this has led to fatalities amongst very young teenagers. These products have been recognized as health threats, not just by our own clinical specialists, but also internationally under the World Health Organization. So we are hoping that we've got a bill in the National Assembly, which we are hoping that those who are still obstructing will relent so that it can be passed and come to you so that we can be able to protect our children. Honorable members, while the COVID-19 pandemic is behind us, we have been warned by scientists that future pandemics are still a threat. We also have to be ready to deal with regional outbreaks such as Ebola, cholera, mpox, and even children's infections have not disappeared, such as measles and diphtheria. We have therefore commenced with the implementation of an integrated disease surveillance and response system under the WHO. Recently, there was concern about the hantavirus, which was detected in a cruise ship, but we want to assure again that South Africans are safe. We want to say also that our system enables us to detect these hazards very early. And so we want to assure honorable members and the South Africans that even the current outbreak of Ebola in the Eastern DRC, in the part of the DRC, we are monitoring that, and our scientists, our National Institute of Communicable Disease, working with our surveillance center, are working very hard to make sure that our people and community are safe. Honorable members, Honorable Chair, I want to join the Minister in tabling our 2026-2027 budget vote, and I hope that all honorable members and provinces will support our budget. Thank you.
Thank you very much, Honorable Deputy Minister Pasla. We now move to the next contributor to the debate, and that's the MEC from the Free State, and that is the Honorable Malatsi for 10 minutes on the virtual platform. Honorable MEC. Honorable Malatsi, are you on the virtual platform?
Yes, I am, Honorable Chair. Am I audible?
Yes, you're audible. Thank you. You may continue for 10 minutes.
Honorable Chair, let me acknowledge you. Thank you very much. Honorable Deputy Chairperson of the NCOP, House Chairperson of House Chairperson Committees, and House Chairperson Member Support, Chief Whip of the National Council of Provinces, Programming Whip, Honorable Minister of Health, Deputy Minister of Health, esteemed members of the NCOP, my colleagues, the MECs for Health. I rise today to support the health budget vote. A budget that is more than just a collection of numbers. It symbolizes our dedication to safeguarding lives, enhancing well-being, fortifying our healthcare system, and guaranteeing that all citizens have access to high-quality healthcare services, irrespective of their income, location, or background. Health is one of the most fundamental human rights as contained in our Constitution. A productive economy, flourishing communities, and a prosperous nation are all predicated on a healthy population. Children learn more effectively, laborers are more productive, businesses expand, and communities thrive when our people are in good health. Consequently, the investment in health is not an expense, it is an investment in the future of our nation. The health budget was presented at a critical juncture. Healthcare systems worldwide are currently grappling with the significant challenges, including population growth, the emergence of new diseases, the escalating cost of healthcare, the challenges associated with climate change, and the growing demand for high-quality services. Bold leadership, strategic investment, and sensible financial management are necessary to address these challenges. The health budget vote is designed to confront the challenges by implementing targeted interventions that are designed to enhance the delivery of healthcare, expand access to services, improve infrastructure, enhance human resources for health, and promote preventative healthcare. Honorable Chair, the enhancements of fundamental healthcare services is one of the budget's primary objectives. The initial point of contact between health system and citizens is primary health care. It is the location where immunizations are administered, maternal and child health services are provided, chronic ailments are managed, and preventative health interventions are implemented. By investing in primary health care, we alleviate the burden on hospitals, enhance health outcomes, and bring healthcare closer to communities. This budget allocates resources to enhance clinics, equip community health centers, and guarantee the availability of essential medical supplies and medications. We acknowledge that a significant number of citizens, particularly those residing in rural and underserved communities, continue to encounter obstacles in obtaining healthcare. Construction, renovation, and modernization of health facilities are therefore prioritized to ensure access. It is imperative to have a contemporary healthcare infrastructure in order to guarantee patient safety and provide high-quality services. The allocation for health infrastructure development will facilitate the acquisition of modern medical apparatus, the maintenance of critical facilities, the expansion of clinic networks, and upgrading of hospitals. These investments will contribute to the improvement of diagnostic capabilities and the reduction of waiting times and the enhancement of overall patient experience. Honorable Chair, healthcare personnel are essential for the efficient operation of any healthcare system. The foundation of our healthcare system is comprised of physicians, nurses, pharmacists, laboratory, emergency personnel, community health workers, and others. It is for this reason that we recently celebrated our nurses in the Free State province. We celebrated the excellent service that they are providing to our communities. Healthcare professionals have exhibited remarkable resilience, dedication, and courage in recent years. In order to safeguard public health and provide patient care, they've worked extended hours in challenging conditions. This budget acknowledges their invaluable contribution by allocating resources to workforce development, recruiting, training, and retention. We are dedicated to establishing an environment that provides healthcare professionals with the necessary resources, support, and opportunities to provide high-quality care. Honorable Chair, preventative healthcare continues to be one of the most cost-effective investments that we can make. Long-term healthcare costs are reduced and lives are saved through prevention. This budget enhances initiatives that prioritizes health promotion, disease prevention, vaccination campaigns, nutrition, education, and screening services, while simultaneously addressing the increasing burden of non-communicable diseases plus one, including diabetes, hypertension, cardiovascular diseases, and cancer. It also supports initiatives to combat communicable diseases. Another critical area that is receiving attention within this budget is mental health. Individual families, workplaces, and communities are all impacted by mental health challenges. The budget contains provisions that aim to enhance the accessibility of mental health, raise awareness, and integrate mental health care into primary health systems. Honorable Chair, maternal and infant health continues to be a national priority. I believe that every mother deserves a safe pregnancy and childbirth services, and every infant deserves a healthy start in life. This budget enhances nutritional interventions, neonatal services, maternal health care programs, and child immunization initiatives. These investments have a direct impact on the reduction of maternal mortality, the reduction of neonatal mortality, the enhancement of long-term health outcomes. Honorable Chair, healthcare delivery continues to be revolutionized by technology and innovation. Digital health solutions have the potential to enhance patient management, expand access, improve efficiency, and strengthen health system accountability. Investment in health information systems, electrical medical records, telemedicine, and data-driven decision-making tools are supported by this budget. By adopting innovation, we can optimize the utilization of available resources and enhance service delivery. Additionally, the budget enhances the capacity to respond to emergencies and prepare for them. The significance of resilient health systems that are capable of responding promptly to the disease outbreaks, natural disasters, and other public health emergencies has been underscored by recent global experiences. In addition to commemorating these investments, it is imperative that we prioritize accountability. Health sector is responsible for the efficient, transparent, and responsible management of all public resources. Results are anticipated by citizens. They anticipate the availability of medication, the efficient operation of facilities, of the support of healthcare personnel, and the delivery of services with professionalism and dignity. Consequently, we advocate for implementation of robust financial controls, robust supervision, mechanism, and ongoing monitoring and evaluation to guarantee that the intended outcomes of the allocated funds are achieved. Health is a collective obligation. Government, healthcare professionals, civil society, the private sector, communities, and individual citizens all have significant responsibility in the promotion, protection of public health. This budget is testament to our shared dedication to the development of a healthcare system that is sustainable, resilient, accessible, and equitable. It illustrates our commitment to guaranteeing that quality healthcare is accessible to all citizens and that no one is left behind. Consequently, I implore all honorable members to endorse this health budget vote. Let us all collaborate to invest in a brighter future for all, stronger health system, and healthier communities. Honorable Chair, I thank you.
Thank you very much indeed, MEC. Good afternoon, honorable members, ladies and gentlemen. And let's continue with the debate. We move on to the province of Gauteng, just north of where we've just been. The MEC for Health in Gauteng is the Honorable Faith Mazibuko, who has 10 minutes. Honorable Mazibuko.
Thank you very much, Honorable House Chair, and greetings to all the honorable members of the NCOP. Greetings to the Minister, the Deputy Minister, and my colleagues from other provinces. Honorable House Chair, it is an honor to be speaking to this budget vote of health today, which is a debate that actually brings light to the types of work that we do in order to service our people. This budget vote speaks directly to the lived realities of our people who depend on the public healthcare system that must function every day with consistency, care, and dignity. It is about a grandmother who arrives early at a clinic to collect a chronic medication so she can manage her health and continue supporting her family. It is about a young mother attending antenatal care with a hope for a safe delivery. It is about a child screened early through school health services so that conditions can be detected and treated on time. Lokhu kusho ukuthi sisebenza ngqo ezimpilweni zabantu, sibanakekela futhi sibalalela njengoba bedinga usizo lwezempilo. Honorable members and House Chair, it is from this reality that we continue to strengthen a health system that is more accessible, more efficient, and more responsive to the needs of our people. We're on course and we continue to move forward with steady progress in expanding access and improving service delivery. One of the most important shifts we are making here in Gauteng is to strengthen preventative and community-based healthcare so that services reach people where they live, and we're not limiting healthcare to only hospitals alone. We're also taking services into communities, schools, local spaces where people can access them and be able to have more care earlier and quicker. Through 14 mobile clinics working with district school health teams, we have screened more than 200,000 young learners. This intervention allows us to detect health conditions early and ensure timely referral and treatment where necessary. In the same way, our HPV vaccine program continues to expand, strengthening long-term protection against cervical cancer and safeguarding future generations. In addition, the wellness programs implemented across 180 townships have reached more than 250,000 people, and these programs focus on screening, health education, and awareness, empowering our communities to take charge of their health before illnesses become severe. This reflects a clear commitment to prevention and early intervention as the foundation of a stronger healthcare system. At the same time, we are steadily modernizing our healthcare system through digitized transformation. This is essential if we want a health system that is efficient, accurate, and responsive to patients that are in need. We currently have 3 hospitals with fully integrated health information systems, while 15 hospitals are transitioning from paper-based records through the e-digitization program. This shift is improving the way patient information is recorded, accessed, and used in clinical decision-making. It also strengthens coordination of the care across facilities and reduces inefficiencies in service delivery. Honorable House Chair, we are building a healthcare system that is more connected, more modern, and better equipped to serve our people. The strength of any health system is also measured by how it protects its mothers and children. Our maternal mortality ratio currently stands at 110.6 per 100,000 live births, while under 5 mortality is recorded at 1.7. These figures guide our continued focus on strengthening antenatal care, improving high-risk pregnancy management, and ensuring that emergency obstetric services are always available when needed. We're also strengthening immunization and nutrition programs so that children not only survive but grow up healthy and strong. Honorable House Chair and honorable members, every improvement in this space represents a life protected and a future secured. Honorable members, we continue to make progress in our response to HIV and AIDS and TB through sustained and community-based intervention. Adult viral load suppression currently stands at 81.5%, which is above target, and we continue to strengthen adherence support and improve outcomes for children, ensuring that progress is sustained across all age groups. Through 1 million ART campaign, we have traced and re-engaged patients who had defaulted, ensuring that they return to life-saving, they return back to life-saving treatment. Honorable House Chair, this is important work because treatment only succeeds when people remain in care. On TB, we are strengthening early detection, improving treatment adherence, and working closely with communities to ensure that patients complete their treatment. TB remains both preventable and treatable, and our interventions continue to reduce its impact across communities. A strong health system depends on people, the healthcare workers who show up every day to serve others, while investing in building a skilled and capable workforce that can deliver quality care across all levels of the system. We are currently having 117 emergency medical care students that are currently training and 1,917 nurses that are also preparing to enter the system. In addition, more than 920 employees are supported through bursaries to strengthen their qualifications and skills. Through the ZIVEZ campaign, we are aligning staffing structures with approved organizational posts to improve stability and efficiency across facilities. We are also recognizing and value the critical role that infrastructure plays in delivering quality healthcare services with dignity. Healthcare infrastructure remains a key foundation for effective service delivery. We have completed almost 7 major maintenance refurbishments across key hospitals that Minister has already spoken about. And these upgrades include essential systems such as water supply, heating, cooling, and energy infrastructure that ensures hospitals remain operational and reliable. This means patients are treated in environments that are safe, functional, and dignified. Honorable House Chair, we're building more than a healthcare system. We are rebuilding hope in every clinic, every ward, and every community we serve. A mother in Soweto must be able to walk into a clinic and be received with dignity without fear of being turned away. A child in Tembisa must receive care on time, not when it is too late. An elderly patient in Sebokeng must feel seen, heard, and cared for in their moment of vulnerability. This is the Gauteng we're working towards, where care is not delayed, but delivered with compassion and agency. Step by step, we're restoring trust between our people and the healthcare system. And as we do, we carry one promise: no one will be left behind. This budget vote speaks directly to this commitment because the provision of services, especially at primary healthcare level, remains the foundation of a responsive and equitable health system. And it is at this level where our people first enter the system, where illnesses are detected early, where prevention takes place, and where many conditions are managed before they become life-threatening. We are therefore not only investing in facilities and services, but also investing in dignity, in access, and in the right of every person to receive care close to where they live. A health system that works at primary healthcare level is a system that protects lives before crisis, not only when people are already critically ill. This is the direction of our transformation, a system that is closer, faster, and more human. I thank you very much, Honorable House Chair.
Thank you very much, Honorable MEC Mazibuko. Honorable delegates, before we take the next speaker, I'd just like to, as always, welcome everybody in the gallery, and particularly today we have Rudy Williams, who is the wife of the Honorable Billy in the chamber. So welcome to you, and thank you for sharing time with us today. Let's move on. Honorable delegates, we have the next participant in the debate from Umkhonto weSizwe, participating online, and it's the Honorable Mhlongo.
Good afternoon, Chair. Chair, can I please switch off my video as my network is compromised here?
Yes, you may. Thank you. Please proceed with your speech. 8 minutes.
Thank you, Chair. Ngibingelele bahlonishwa, ngibingelele Chair, ngibingelele my fellow South Africans. Umkhonto weSizwe Party rejects vote 18. We reject this budget because it does not meet the healthcare needs of the people of South Africa. It does not meet the obligations of the Constitution. It does not meet the ambition of the National Development Plan, and it certainly does not meet the realities facing poor and working class communities who rely entirely on the public health system. The Department of Health receives 66.9 billion for the 2026-27 financial year. Government presents this as an increase, but once inflation is taken into account, this budget declines by 1.8 in real terms. In simple language, the department has less spending power than it had last year. Yet, department expects South Africans to believe that declining spending power will somehow produce better healthcare somehow. The contradictions becomes even clearer when we examine the money in where the money is allocated. Program 3, responsible for HIV, AIDS, TB, and maternal, child, and women's health, receives 26.5 billion, but declines in real terms. Program 5, hospital systems, receives 26.2 billion, but also declines in real terms. These two programs account almost 79% of the department's budget. They are the front line of public health. They are where lives are saved. They are where poor South Africans depend on government, yet both programs lose purchasing power. How do we reduce TB deaths with less real funding? How do we improve maternal health care with less real funding? How do we strengthen hospitals with less real funding? Chairperson, South Africans remain homes to approximately 8 million people living with HIV. The department reports 96% know their status, yet 78% are receiving treatment. This leaves approximately 1.1 million people outside treatment programs. Tuberculosis remains the leading cause of death in South Africa and continues to claim approximately 54,000 lives every year. At the same time, the withdrawal of PEPFAR supported programs has placed additional pressure on the public health services. Government knew these risks existed. Government should have planned for them. Instead, communities are now expected to absorb the consequences of reduced funding and inadequate preparation. Chairperson, the condition of public health care facilities tells its own story. Patients continue to spend entire days in clinic queues. Hospitals continue to struggle with overcrowding, equipment failures, medicine shortages and staff shortages. Emergency medical services remain under severe pressure. In many rural communities, ambulances arrive late or fail or never arrive at all. For a woman in labor, a heart attack victim, or a critically ill child, those delays can mean the difference between life and death. Yet this budget offers no convincing response to these realities. Chairperson, capital expenditure declines from 2.5 billion to 1.8 billion. This is happening while hospitals require maintenance, clinics require upgrades, and equipment replacement backlogs continue to grow. Government speaks endlessly about national health insurance, but NHI cannot be built on crumbling infrastructure. NHI cannot succeed while hospitals struggle to produce basic services. NHI cannot succeed while healthcare facilities remain under-resourced. Before government promised a new healthcare system, it must first fix the one that already exists. Honorable Chairperson, the healthcare workforce crisis remains one of the greatest failures of government. Healthcare facilities tell us they need nurses. Patients, they tell us there are not enough doctors. Communities tell us clinics are understaffed. Yet thousands of qualified healthcare professionals remain unemployed. We have unemployed nurses while clinics need nurses. We have unemployed doctors while hospitals need doctors. We have unemployed pharmacists while medicine management remains under pressure. That is not a skill shortage. That is failure in planning, that is failure in budgeting, that is failure in leadership. This budget also exposes government misplaced priorities. More than 609 million is allocated to contractors. More than 250 million is allocated to consultants and advisory services. More than 110 million is allocated to travel and substance. South Africans do not need more consultants. They need doctors, they need nurses, they need pharmacists, they need ambulance, they need medicine. Those are the priorities of the people. Honorable Chairperson, healthcare cannot be separated from the conditions under which our people live. Communities continue to live under sewage spills. Many households lack reliable access to clean water. Waterborne disease continue to threaten vulnerable communities. Healthcare begins with clean water. Healthcare begins with sanitation. Healthcare begins with dignity. A government that fails to provide these basic necessities cannot claim to be protecting the health of our people. Provincial Health Department continues to face financial instability, accrual, procurement, failure, and medical legal claims worth billions of rands. Resources that should have been spent on clinics, equipment, and healthcare workers are increasingly diverted to deal with the consequences of poor management. Chairperson, one of the most disappointing omissions in the budget is the continued neglect of indigenous medicine. Long before colonial healthcare systems arrived in Africa, our people had developed sophisticated systems of healing, prevention, and wellness. Millions of South Africans continue to rely on traditional healers and indigenous medicine, particularly in the rural communities. For many citizens, indigenous medicines remains their first point of healthcare access. Yet there's little meaningful investment on indigenous medical research. There is a little support on developing African country products. There is a little effort to integrate indigenous healthcare knowledge into broader health planning. We cannot build healthcare sovereignty while remaining dependent on imported solutions and neglecting our own heritage. The Constitution guarantees healthcare. The National Development Plan promises improved healthcare outcomes. The Department AP promises universal healthcare. People cannot be healed on promises. They need functioning hospitals. They need medicines. They need a government that takes a constitutional obligation seriously. A budget that does not rise to that challenge it falls short of the Constitution. It falls short of the National Development Plan. It falls short of the needs of the people. For these reasons, Umkhonto weSizwe rejects Vote 18 its entirety. Thank you.
Thank you very much, Honourable Mhlongo. Honourable delegates, we move on now to the Economic Freedom Fighters. Honourable Kennedy, who's also participating online for 14 minutes. Honourable Kennedy.
Honourable Chairperson, honourable members of the NCOP, the Economic
freedom fighters strongly opposes
Honorable
this.
Kennedy, just a moment, please. We have a point of order.
Thank you, Honorable Gaida. Kindly caution Honorable Kennedy that there's somebody in the meeting behind her on the video.
Thank you very much. Yes, Honorable Manani. So, Honorable Kennedy, if we can just make sure that you are the one who's presenting the speech, and yeah,
Thank
that's much
you.
better. Thank you very much. You can proceed. Thank you.
Greeting to the House. Greeting to the ministers. Members in the virtual meeting. The economic freedom fighters strongly opposes this 2026-27 health budget. We reject this budget that staffs public health facilities of necessary funding while catering to the privileges. The EFF rejects this health budget as it fails short of resolving the crumbling healthcare crisis because it does not have that sufficient funding for infrastructure maintenance, fails to match inflation with frontline service investment, and under-allocates resources for the growing non-communicable disease epidemic. The infrastructure crisis is growing and stagnant, while the 64 billion national allocation focuses modestly on large capital projects through the budget facility of infrastructure grants for smaller everyday facilities have not kept up with inflation, causing localized clinics conditions to further deteriorate. This budget seems to be isolating and ignoring the chronic disease realities. The budget fails to align the financial planning with epidemiological realities, neglecting the rapidly growing diabetes and hypertension epidemics. This lack of funding normalizes avoidable amputations and stroke. It puts a burden on provinces as the division of revenue shifts significantly responsibility to provinces, where historical debts are ballooning, wage bills frequently results in underspending and a lack of dedicated funding for critical frontline health posts. Despite the increases in overall nominal allocations, the state lacks the in-house technical capacity, project readiness, and consequence management required to ensure every rent translates into actual service delivery improvements. This health budget disproportionately impacts rural health environments where already strained primary facilities are left to absorb the shortfall of underfunded mandates. Without proportional increases for local clinics, rural population face catastrophic out-of-pocket costs for transport to distant facilities and deteriorating preventative care. At a primary healthcare clinic in the, for an example, rural Mopani district, serving villages like Mamayoha, Taulume, and Sofroke, security and budget concerns forced the Limpopo Department Health to slash operations from 24-hour down to 12-hour shifts. Patients face a 64-kilometer journey to nearest 24-hour hospital for after-hours emergency. And the health facility revitalization grants saw minimal nominal increases because this lags behind inflation. It translates to a real-term funding out. Rural clinics will continue to suffer from maintenance backlogs, water shortages, and inadequate equipment, which severely
degrade the quality of care. This while villages like Muswana in Vembe district and Baula in Mopani district have been waiting decades for a permanent clinic to be built. Residents risk bad road conditions to travel hours just for basic services. When local rural clinics reduce services or close after hours due to budget constraints, patients are forced to travel much longer distances to secondary or tertiary hospitals. The cost of private transport forces vulnerable rural families to sacrifice other essential needs. Rural areas rely heavily on community outreach programs, but this stalled support and funding gaps, compounded by the reduction of external donor funding, means that mobile testing units and rural community-based disease prevention initiatives will remain stalled. Whilst the National Department has brought on thousands of post community service doctors and permanent community health workers, the broader financial constraints of provincial health budget risks pulling operational capacity away from rural areas, forcing rural hospitals to bear surgical and specialist backlog without adequate staffing. Chairperson, the EFF advocates for the immediate implementation of 24-hour clinics operating 7 days a week in marginalized and working-class communities. Funding must therefore be redirected away from administrative bloat and redirected toward hiring more medical staff, opening clinics, and keeping them fully stocked. Budget reduction prevent the employment of adequate doctors and nurses, leading to turnout, extended waiting times in maternity wards. Understaffed conditions mean expectant mothers are sometimes transferred or redirected due to the lack of midwives. Clinics frequently suffer from inadequate water supply. Without safe running water and constant electricity, staff are forced to turn away patients, cancel maternal deliveries, and hold basic hygienic practices. Unbudgeted expenditures result in deteriorating, dilapidated buildings, broken medical equipment such as blood pressure monitors, and stockouts of needy medication. A lack of funded posts for newly graduated health professionals risks driving skilled young doctors and nurses into private sector or out of the country. Chairperson, the Auditor General of South Africa reported that up to nine out of 10 provincial health departments have liabilities exceeding their assets, billions in irregular expenditures, and unpaid accruals roll over annually, significantly draining resources. Escalating medical claims totaling over 125 billion nationally divert crucial funds away from frontline service delivery and maintenance. Most provincial departments fail to achieve even 60% of their set service delivery targets. This is heavily exacerbated by prolonged staff shortages, with approximately 80% of doctors operating in the private sector despite serving only 20% of the population. As the EFF, we once again would like to reiterate that we advocate for the setting up of a state-owned pharmaceutical and healthcare equipment manufacturing to drastically reduce the cost of medicines and supplies hospital reliably. We see the NHI as an admission of government failure that merely outsource care to private providers rather than fixing and dignifying public hospitals directly. It is obvious that South Africa's medical institutions are experiencing major financial shocks in medicine due to both domestic budget limits and international donor funding freezes. This threatens the country's ability to conduct localized trials and manage future health emergencies. Recently, we lost a member of our community in Seshego, who was admitted in Seshego hospitals on Monday of the 25th. On Tuesday, the patient was still fine as we left her the previous day. No medication, no eating, no drip. On Wednesday, she was moved to high care, where we had that hope that something will be done to help her. But she was just left there in the same situation. The nursing sister said there's nothing she can do because they have only one doctor and one nurse. When the children confront the doctor told them that he was not aware that their mother is hit by a double stroke. Otherwise, he could have transferred her to a provincial hospital. On Thursday and Friday, they found her with a drip which was not moving. The very same drip which was put on the previous 2 days. Saturday, when they visit her, they found her with the same drip which never served its purpose as she was no longer in this world. She passed on. This is a very painful, unfortunate situation who was never supposed to have happened in that way in a so-called high care of the hospital. These are the results of the budget, which even fails to employ sufficient doctors and nurses in our South African hospitals. The cascading effects of the shortage impacts both the operational capacity of facilities and the well-being of the individual seeking care. Remaining doctors and nurses are forced to work longer hours with heavier patient loads, accelerating burnout and causing higher rates of staff resignation. Thus, the budget ridicules the objective and intention of better health care for all. This inadequate budget severely compromises our health care services and system. Therefore, the EFF reject this budget. I thank you.
Thank you very much, Honourable Member. We are fortunately back in the House now, and we call to the podium for the African National Congress, the Honourable Masumpa.
Greetings to the House Chairperson, to the ministers, deputy ministers, MECs, and all members in the House and those that are on the virtual platform, and all our visitors and media. Minister, as I'm representing the ANC from the Western Cape, this budget speaks directly to the people, abampofu, those that were disadvantaged from kwanokuthula kwanonqaba emandleni koseKhayelitsha crossroads naseGugulethu naseKhayelitsha. This budget will balance our services of health, strengthening integrated response to combating communicable and non-communicable diseases. South Africa is faced with the duty to protect broader population, strengthening existing system, and ensure intergovernmental coordination of data. It has considerable burden of diseases, illness, and violence. Non-communicable diseases account for the highest proportion and are leading the cause of death in our country. This is said closely followed by the communicable diseases, yet there is a sustainable developmental goal to reduce premature mortality from non-communicable diseases by 1/3 by 2030. Is this possible? Even the National Development Plan sets a target to reduce the prevalence of cardiovascular disease, diabetes, cancer, and chronic respiratory disease by 28% in 2030. Since 2030 is about 4 years away, the question still remains, what will it take for South Africa to reduce the burden of disease? A simple answer is yes, it can be done. As articulated by the Department of Health, the goal can be met through prevention and treatment of illness and promotion of health and mental well-being. Using primary care package, standardized APHC, that includes vaccination, ANC, antenatal care, PNC, pro-retina when necessary. We have all heard they say, prevention is better than cure. This is an old proverb that still rings true today. It calls for re-engineering and strengthening of primary health care. The only way it will be possible to help care assess prescribed is prescribed in our beloved Constitution we found in 1996. One way to strengthen primary health care is introduction of lenacapavir 9595 in our country. It's a twice yearly injectable drug that has been approved by the South African Health Products Regulation Authority as a high effective form of pro-exposure prophylaxis PrEP. Its purpose is to reduce the risk of getting the human immunodeficiency virus among people who are HIV negatives. It gives people a good chance to a living well. Additionally, rollouts of ground drug is distinct in high incidence cases aligned with joint united programs on HIV and AIDS. Gone are the days of shaming people living with communicable and non-communicable disease or just condition one won't understand. The same is educating our resources, is to educating ourselves about our resources made available by the National Department of Health and organizations such as South African National AIDS Council. The shame is not supporting initiatives such as Close the Gap campaign, arising awareness in our communities. Indeed, the Department of Health and SANAC should be recommended for these public health initiatives aimed at reaching and re-engaging over 1 million people with HIV status to start or to continue with antiretroviral therapy. We cannot progress as a society when we do not apply Ubuntu in our daily life. It starts with us, homes, communities, wards, and provinces. We know it's less like to go to healthcare facility. We need to learn and understand how we can educate and support each other for initiatives as such to close the gap. Undoubtedly, we can achieve it. We advocate and recognize a value for quality primary health care. We can encourage our communities to go for screening because this allows early detection of illness and prevention of diseases. We have to be proactive and recognize the value of early detection. Let us all be influenced by making healthcare our responsibility. Let us be influenced in recognizing that health is wealth. Health is wealth. Screenings are important in households as part of school health programs. Screening also important in ward outreach. Let's support a core world societal approach to promote health and lifestyle choices and eradicate communicable and non-communicable disease. So yes, to regular health checkups. When we live in different time, from the time we grew up, things have changed. Young people are exposed to the internet, and that's so much social media at their fingertips. Access to social media does not always translate to access to a correct source of information.
Therefore, members of society, we have a responsibility to provide young people, youth with accurate information in ways that appeal to them. We can make sure that we promote healthcare services to young people through multi-sectoral approach, innovations, using youth zones, and recognizing that the access to sexual and reproductive health is a right and not a promotion of promiscuity or passport for young person to experiment with risk sexual behavior. This means recognizing that sexual reproduction health are essential in education and forming young people about health risk, dispelling myths and misconceptions, enabling them to make an informed decisions. Yes, parents and guidance, they are the first point of call. But health practitioners at our local clinic, they'll give guidance to these young people. As responsible adults, we cannot fold arms and wait for Department of Health and Basic Education to deal with the work. Makusetyenzwe. Let's deal with the challenge. Lastly, so let's applaud the Department of Health for considering this as their plan. Beyond that, we have to ensure that those plans translate to practice. We have to move beyond considering policies and reach to a point of seeing the health practitioner and health users know their policies and apply them on their day-to-day life. And they deliver the expected outcomes. Let us learn from the other countries. When we're facing a day-to-day reality, we need solutions that are sustainable. We can only make progress when we remember that at the core, we cannot combat communicable and non-communicable diseases without strengthening the provision of access to health, which is grounded in the principles of Ubuntu. As we engage in this debate, let us keep in mind a shared humanity and interconnections. Ultimately, our goal is to live in a healthier South Africa, not just for ourselves, but also for our children and future generations to come. We cannot afford any delay. I endorse the strengthening of coordination and initiatives to address communicable and non-communicable diseases. Therefore, I endorse the budget of the Department of Health that can be able to assist people that are out there. They are looking forward for these services. Thank you.
Thank you very much, Honourable Masumpa. Honourable delegates, we will now receive inputs from South African Local Government Association, and representing them today is Councillor Marakalala.
Honorable Chairperson of the session, the Deputy Chairperson, Honorable Minister and Deputy
Councillor.
Minister of Health, Honorable Chief Whip of
Councillor, if I can interrupt you, please.
Honorable MECs, Honorable members present here, I greet you all.
Councillor Marakalala, your
Yes.
signal is failing you. If I can suggest that you turn your video off and try to proceed with your speech.
Thanks very much, Honorable Deputy Chairperson. On behalf of SALGA, I rise to acknowledge the bold and ambitious vision set out by the Minister in this budget vote. We commend the Department of Health for its continued commitment to improving health outcomes, especially through infrastructure investment, HIV prevention, and cancer screening. Honorable Chair, we commend the department for the rollout of strategic infrastructure, some of which is already under construction in different parts of the country. This will go a long way in reducing long queues and preventing the diminishing sins of frustrated health services seekers. Honorable Chair, it is worth noting that municipalities are responsible for critical enablers of health infrastructure in the form of water, sanitation, electricity, waste management, and road access, without which no hospital can function effectively. We therefore call for intergovernmental protocols between the Department of Health and municipalities where new health facilities are to be built to improve the coordination of the necessary municipal infrastructure. Furthermore, we call upon national and provincial government to support municipalities' provision of this basic infrastructure, especially in townships and informal settlements like Holomisa and Deep Slot in Gauteng. Some of our municipalities are struggling to fund this critical infrastructure as they are owed hundreds of millions by provincial and national departments. We welcome the announcement of the Lenacapavir rollout. This indeed is an indication of the department's commitment towards eliminating HIV and AIDS as a public health threat. We therefore support the prioritization of the identified population, particularly the key population, and believe this will go a long way in curbing the spread of HIV. This, together with the rollout of HPV vaccine for cervical cancer annual basis, is an important step towards improving health outcomes. Honorable Chair, we further welcome the appointment of many essential healthcare workers and the procurement of beds, linen, and other articles from 6.7 billion allocated to health. We believe that the distribution of these professionals and articles is done in a manner that considers where the most backlog is, including in rural communities where the most vulnerable people are found. This will go along winning back people's trust towards the public health system. Honorable Chair, while we acknowledge the investment towards strengthening our public health system, we wish to emphasize that municipal health services such as food control, water quality monitoring, waste management, port health, vendor control are essential public health functions that prevent diseases in our communities, resulting in fewer people going to our health facilities. We therefore call upon national government and in particular the Department of Health to support local government in addressing the challenges confronting the delivery of municipal health services, particularly the shortage of environmental health practitioners. Government must therefore strike a better balance between expenditure on curative health and investment in preventing health. A health system that is heavily weighted towards treatment along with will remain costly and overburdened, whereas stronger prevention and municipal health services can reduce diseases outbreaks, lower patient numbers at clinics and hospitals, and ease pressure on the very expensive curative health system. Municipalities are, however, under-resourced to adequately fund municipal health services despite being at the front line of prevention. The Department of Health will therefore do well to allocate a portion of its budget to support municipalities so that preventive health interventions can be strengthened and the overall cost of health can reduce over time. Honorable Chair, we therefore support this budget vote. I thank you.
Thank you very much, Councillor Marakalala. Back in the chamber, honourable delegates. The next speaker is from the Freedom Front Plus, and it's Honourable Breert for 5 minutes.
Honourable Mananeso, I must talk Vrystaat. House Chairperson, laat ek begin deur die LER van Gesondheid in die Vrystaat te bedank vir sy bereidwilligheid om in te gryp daar waar die gesondheidstelsel onder druk verkeer. Ons erken die pogings wat aangewend word om uitdagings aan te spreek, maar eerlikheid vereis ook dat ons sê, daar is steeds baie ruimte vir verbetering. Earlier this year, the Select Committee on Social Services visited facilities in the Mateo district. And what we saw was deeply concerning. Healthcare workers are expected to deliver quality care with severely limited resources. Buildings are deteriorating, equipment is failing, and shortages continue to affect service delivery. And behind every statistic is a human story. Ek het onlangs is ek gebel deur 'n bekommerde familielid in Pretoria. 'n Pasiënt is op 'n Vrydag hospitaal toegeneem nadat 'n ambulans nie opgedaag het nie, deur die buurtwag nogal. Sy het vir ure by toelatings gelê voordat sy uiteindelik die volgende dag na 'n saal geneem is. Die familie moes hulle eie linne en beddegoed neem, want daar was niks nie. Daardie Sondag het die familie gaan kuier, maar sy was weg. Niemand kon kry waar sy is nie, en die familie moes selfs die SAPD kontak. Eers na 'n skofwisseling kon 'n verpleegster vir die familie bevestig dat sy na ander familie toe oorgeplaas is. Voorsitter, dit behoort nie te gebeur nie, en ek moes noodgedwonge vir Ali Ermaglatsi kontak, and I thank you that you resolved this matter, but this is unacceptable. And every member in this House probably has a similar story in their own province, because these are not isolated incidents. These are symptoms of a healthcare system under immense strain. During a constituency visit to Parys Hospital, I witnessed similar challenges. There's only one audiologist serving a community of more than 10 towns. Hearing aids are unavailable. There are shortages in optometry and orthopedic services. Only one theatre is operational in the hospital, and the oxygen system is faulty. They have to duct tape it. Roofs are leaking. Pharmacy infrastructure is inadequate. Yet, in spite of all of this, the staff continue to serve with dedication and professionalism. Aan hulle wil ek vandag hulde bring. Hulle hou die stelsel aan die gang ten spyte van die uitdagings rondom hulle. But dedication alone cannot sustain a healthcare system. Every year we hear about medicine shortages, procurement failures, information system problems, and delayed maintenance. But these are not new challenges. They are recurring failures that demand accountability. En dit is juis waarom die VF+ van mening is dat die fokus eers op die herstel van bestaande gesondheidsdienste moet wees, voordat daar nog beheer in 'n sentrale stelsel soos die NGV gekonsentreer word. Ons kan nie 'n nuwe dak op 'n huis bou terwyl die fondasie besig is om te kraak nie. We must first ensure that our hospitals are functioning, that ambulances arrive, that medicine is available, and that equipment works, that healthcare professionals are supported. Nor can we ignore reports from provinces, and Honourable Minister, this is specifically the Northwest, that are experiencing critical shortages of TB medicine and vaccinations for children. Preventative healthcare remains one of our most important responsibilities, and we need to look after that. Nelson Mandela said, "A nation should not be judged by how it treats its highest citizen, but how it treats its lowest." A true measure of our healthcare system is not found in policies and budget. It is found in the experiences of everyday citizens. Dit is tyd dat ons minder fokus op beloftes het en meer op resultate. Dit is tyd dat ons die waarde van elke pasiënt eerste stel. Dit is tyd om verantwoordbaarheid te eis. En dit is tyd om 'n gesondheidsdiens weer funksioneel te maak. Dis ons tyd om Suid-Afrikaners eerste te stel. It is our time. Ek dankie.
Thank you, Honourable Brett. Honourable colleagues, we move now to KwaZulu-Natal. The MEC for Health there is the Honourable Simelane, who will be our next speaker for 10 minutes.
Thank you very much, Honourable Chair. Good afternoon to you, to the Honourable Minister, Deputy Minister, and all the members. Chair, we welcome as the province the opportunity to participate in this important debate on the future of healthcare in South Africa. One of the important truths that must always be uppermost in our minds in all that we do is the fact that access to healthcare is not a privilege, but a constitutional right. In the Freedom Charter, which was officially adopted on the 26th of June, 1955, envisioned a South Africa in which all people would share in the country's wealth and opportunities, including access to healthcare. Our constitution, which was established exactly 30 years ago, gives effect to that vision by guaranteeing every citizen the right to access healthcare services. Furthermore, the National Health Insurance, which our government continues to champion, seeks to make this promise a reality by ensuring that quality healthcare is available in all South Africa, to all South Africans, regardless of where they live or how they earn. Chair, I wish to congratulate the Honorable Minister of Health, Dr. Aaron Motsoaledi, on the historic launch of Lenacapavir, which will be hosted tomorrow in Mpumalanga province. This Lenacapavir is a long-acting HIV prevention injection, as Minister indicated, and the launch therefore represents one of the most significant milestones in the fight against HIV and AIDS since the rollout of the ARVs. KZN, as a province that is adversely affected by HIV and AIDS, openly and happily welcomes these developments. For a country that continues to carry one of the highest HIV burdens in the world, this breakthrough has potential to transform HIV prevention efforts, as the minister indicated. I'm also sure that the minister will give an elaborate presentation tomorrow on the benefits, but he also indicated in this meeting on the benefits of this particular drug. But as the province of KwaZulu-Natal, I can confirm that we are ready to support the successful rollout of this groundbreaking intervention. We believe future generations may look back on this moment as a turning point in the fight against HIV and AIDS. Honorable members, we are of the view that universal health coverage cannot be achieved without investing in health infrastructure. We therefore warmly welcome and appreciate plans by the National Department of Health to put forward Victoria Mxenge as one of the 11 hospitals that are meant to bid for the revitalization or for the investment in the revitalization program. We appreciate that very much because at least it puts the province of KwaZulu-Natal on the map, and we are hoping that we will be one of the 4 hospitals that will be chosen. Victoria Mxenge, which was previously known as King Edward Hospital, is one of KwaZulu-Natal's oldest and most historically significant healthcare institutions. During apartheid, when access to healthcare was deeply segregated, it was among the few major hospitals that provided services to Black South Africans who had been excluded from many other facilities within the province. Generations of families have passed through its doors in search of care, healing, and hope, making it an institution that is deeply woven into the social fabric and history of our province. Despite this rich heritage and continued importance, the hospital's infrastructure has deteriorated significantly over the years. Aging buildings and a growing maintenance backlog place immense strain on both healthcare workers and patients, underscoring the urgent need for major refurbishment and investment. Something that as a province we have been aware of and been worried. We have been trying over the years to budget for the revamping of this facility, but because of the number of or the amount of work that needs to be done has been unaffordable to the province. So this investment will really assist very much. The hospital is also a critical academic and teaching platform, playing an indispensable role in the training of medical students, interns, and community service doctors and other healthcare professionals. At a time when South Africa is working to strengthen its health workforce, it is imperative that we preserve and enhance one of the institutions that helps produce the doctors and specialists that our healthcare system so greatly depend on. It is therefore only fitting that Victoria Mxenge Hospital be prioritized for this funding. Such an investment would not only restore a historic institution and improve the quality of care for thousands of patients, but it would also honor the legacy of Victoria Mxenge herself, who dedicated her life to the struggle for dignity, justice, and equality. By renewing this institution, we would ensure that a hospital which has served generations of South Africans continues to heal, teach, and inspire for generations to come. Members, a healthcare system is only as strong as the people who serve it. We therefore welcome the recent decision by the National Department of Health to absorb community health workers into the healthcare system. In KwaZulu-Natal, more than 5,000 community health workers benefited from this decision of permanent employment, while just above 4,000 were given the added incentive where those who did not qualify to be absorbed. And as we speak, they are all hard at work. These healthcare workers are the backbone of primary healthcare. They are one of the main players in our provincial strategy of strengthening primary healthcare in KwaZulu-Natal. They provide health promotion, support treatment adherence, and conduct health screenings. Yes. They also trace patients who have defaulted on treatment and connect communities with healthcare services. Their work helps us move healthcare beyond the walls of hospitals and clinics and into communities where people live. Chairperson, despite significant financial pressures, KwaZulu-Natal continues to make progress in strengthening healthcare delivery. We remain at the forefront of the fight against HIV, TB, and AIDS. We also continue to expand access to cervical cancer screening and HPV vaccination programs. Despite limited resources, we have also strengthened our community outreach programs through a number of programs, which include various school health and youth development initiatives. Honorable members, one of the greatest challenges facing the healthcare sector is also the unequal contribution of specialist healthcare services. Rural communities deserve the same access to specialist care as urban communities. It is this reason that the province of KwaZulu-Natal started a process of reconfiguring selected hospitals from district to regional status in order to improve access to specialist healthcare. These are Vryheid, Dundee, Bethesda, and Christ the King hospitals. While this reconfiguration process has been delayed by certain administrative challenges, its long-term success will depend on specialists being willing to serve in rural and underserved communities. We are of the view that healthcare equity cannot be achieved if specialist services remain concentrated in a few urban centers. That is why, Chair, we make a call that our specialists must be willing to attend to as far-flung areas as possible, so that we are able to provide the service that is much needed in those communities. In conclusion, Chair, I do want to say that as a province of KwaZulu-Natal, we indeed have been struggling very much with our finances because of the cutting to the baseline, but I want to appreciate the allocation that we received from the National Department of Health in the past financial year. It really assisted in ensuring that where there were gaps of employing doctors and nurses, we are able to plug out those gaps. Of course, we have not been able to address all the challenges, but the amount that we received in the last financial year did indeed assist towards ensuring that healthcare is provided properly within the province. Thank you very much, Chair.
Thank you very much, Honourable Similani. Honourable delegates, next at the podium is the Honourable Adrianza for the Democratic Alliance.
Honourable House Chairperson, Honourable Minister, Honourable Deputy Minister, Honourable Members and fellow South Africans, good day. Section 27 of our Constitution guarantees every South African the right to access healthcare services. For millions of our people, healthcare remains not a constitution reality, but a daily struggle for survival. The department's annual performance plan speaks of the NHI, improved life expectancy, improved hospitals, and better health outcomes. These are absolutely worthy aspirations, but aspirations do not save lives. Accountability does, and especially service delivery does. Unfortunately, this APP contains warning signs that this House cannot afford to ignore. The first concern is funding. Although the department's budget has increased by 66.9 billion, in real terms, when inflation is taken into account, it has actually declined by 1.8%. Even more concerning is that the two programs carrying the greatest burden of healthcare delivery both suffer real-time reductions. Hospital systems declines by 3%, while HIV, AIDS, TB, maternal and child health declines by 1.6%. At a time when hospitals are overwhelmed Clinics are under pressure and communities are demanding better health care. This sends precisely the wrong message. Across South Africa, patients wait for months for an operation, for specialists, and families spend hours in overcrowded clinics. Ambulances arrive too late, if at all. The committee has raised these concerns about emergency medical services, ambulance fleet functionality, maintenance backlogs, and response times. These are not only administrative shortcomings, these are matters of life and death. The second concern is infrastructure, and also mentioned by the Minister. The APP speaks proudly about preparing for the NHI and buildings and refurbishment, yet health facilities infrastructure management suffers a real-term reduction of 9.3%. How can a government build an NHI system while reducing investment in the very hospitals and clinics expected to deliver that care? Before creating new systems, government must first fix collapsing hospitals, replace broken equipment, address maintenance backlogs, and modernize failing patient record systems across the country. You cannot build a world-class healthcare system on a foundation that is crumbling. But wait, there's more. There's a third concern, and that is corruption and governance. South Africans are being asked to place their faith in an ambitious healthcare system, yet they have every reason to be skeptical. They remember the PPE looting. They remember the procurement scandal. They remember the Auditor General's relentless findings of waste, weak controls, and poor financial management. This is still fresh in everyone's minds. Accountability is not just a technical detail of healthcare reform. It is its foundation. Without it, no amount of funding will ever be enough and will ever deliver quality healthcare. The challenge facing healthcare is not merely a shortage of money. It is a shortage of accountability. We welcome progress in HIV diagnosis and especially the new treatment and prevention program. But the APP acknowledges that approximately 1.1 million people living with HIV still need to be traced, initiated on a treatment, and retained in care. At the same time, recent reports of poliovirus traces detected in Cape Town wastewater remind us that strong vaccination programs are essential. Disease surveillance and public health preparedness are to be imminent. Diseases we thought were behind us can quickly return when vaccinations and vigilance declines. Let me be clear. The Democratic Alliance supports a healthcare system that delivers quality care, protects the vulnerable, and expands access to services. But support can never mean silence. Governments must not be judged by what it spends, but by what it delivers. South Africans are not asking for miracles. They are asking for a healthcare system that works. A budget is not judged by promises, but by delivery. A healthcare that provides dignity instead of despair and hope instead of disappointment. I thank you.
Thank you, Honorable Andrianse, for your input. And then the next speaker on the podium is going to be Honorable M. Venga, the MEC for Health in the Western Cape. Over to me.
Thank you, Chair, Honourable Minister, MECs, members of the NCOP, fellow South Africans. The governance and delivery of healthcare to every resident of South Africa is both one of the most complex responsibilities and one of the greatest privileges entrusted to government. As a concurrent function shared between the national and provincial governments, healthcare succeeds only when all spheres of government work together towards a common purpose, ensuring that every person can access quality care where and when they need it. This debate on Vote 18 therefore provides an opportunity not only to consider budgets and programs, but also to reflect honestly on the challenges facing our health system. It also allows us to recognise the extraordinary commitment of healthcare workers across the country and demonstrate how these investments will help us improve health outcomes for all South Africans. Our health system has faced an extraordinary combination of pressures over recent years. The lingering effects of the COVID-19 pandemic, prolonged fiscal austerity, restrictions on workforce growth, and reductions in donor funding have all placed significant strain on services. Yet throughout this period, healthcare workers across South Africa have continued to serve their communities with remarkable resilience and dedication. Thanks to additional funding provided to the healthcare sector recently, we are now beginning to see encouraging signs of recovery. Through disciplined financial management, innovation, and a commitment to patient-centered care, we are moving from crisis management towards long-term rebuilding and reform. The increase in healthcare funding was sorely needed and is warmly welcomed. The additional funding in the 25-26 adjustment budget and now in the main appropriation is giving us more resources needed to respond to immediate pressures while also investing in long-term sustainability of the health system. For the Western Cape, it enables us to continue investing in critical infrastructure while addressing persistent pressures within our goods and services budget. It allows the department to stabilize specific service points that have experienced the most pressure over the last 2 to 3 years, like emergency centres. As a department, our 5-year strategic plan is built around our commitment to walk a life journey with every resident in the province. We want our children to start well, our communities to live well, and our residents to age well with dignity and support. This life course approach recognizes that health outcomes are shaped throughout a person's life and that every stage requires targeted interventions supported by a responsive, integrated, and sustainable health system. It's also guided by a belief that every person should be able to access quality healthcare regardless of where they live and to be able to live a life that they value. Universal healthcare is about ensuring that services are accessible and responsive to the communities that rely on them. In the Western Cape, we have a Western Cape model for UHC. We have been working closely with the private sector, academia, and civil society through our Universal Healthcare think tank to identify practical ways of strengthening our healthcare ecosystem and expanding access to care. We believe that the delivery of quality healthcare to every South African will take the combined efforts of the entire sector. Across the province, there are already hundreds of partnerships helping us bring services closer to communities and improving patient experiences. For example, in the Garden Route, you can collect your state chronic medication from a private pharmacy close to home. Or in Optieberg in the Cape Winelands, a rural farming community where distance and geography create significant barriers to accessing healthcare. Here, a farm which is home to more than 200 families has teamed up with the provincial government to provide a doctor, nurses, and medication to support the health and well-being of farm workers and their families. Together, this partnership is bringing healthcare closer to where people live and work, ensuring that residents can receive the right care at the right time without having to travel very long distances. This is what universal healthcare looks like in practice. Government, communities, and partners working together to expand access, strengthen services, and improve health outcomes. And it's through these kinds of partnerships that we continue to build a stronger, decentralized, and more inclusive health system. That commitment to prevention, early intervention, and access is reflected across all our programs. One example is our continued effort to tackle TB. This year, the Western Cape was honored to host the National World TB Day event in Caledon. During February, the Western Cape Department of Health and Wellness recorded its highest ever monthly TB testing figures, with almost 40,000 people tested. Between 2023 and 2025, the number of annual TB tests conducted in the province increased by 70%. There's almost 150,000 additional tests in just 2 years, and reflects our determination to find and treat TB earlier. We are equally committed to strengthening HIV prevention and treatment services. With the national launch tomorrow, the province will roll out lenacapavir at 22 sites across the Western Cape in communities with the highest HIV burden from Monday. This is an important milestone in South Africa's fight against HIV and offers renewed hope that we can continue driving down new infection numbers. We're also working to improve immunization coverage and strengthen our response to vaccine-preventable diseases. During the 25-26 financial year, measles immunization coverage for children under 1 reached 97% in the Western Cape. Measles vaccination continues to form part of routine immunization services and is supported through ongoing outreach and facility-based services and school health programs. Through these specific campaigns, 40,000 individuals have been vaccinated. And to ensure reach, we have 63 brand new mobile clinics for our rural districts. These were co-designed by our nurses and are fitted out with fridges, basins, solar panels, examination beds, eye testing facilities, and folder storage, and they're helping us to care for rural communities. Our health workers in Nkqubela have set up Thursday nighttime mobile clinics for those that cannot access services during the day. Chair, as the Western Cape population continues to increase, the demand on healthcare rises, and the investment in infrastructure is critical to enable the delivery of services. Over the last financial year, our department has more than 40 infrastructure projects underway. These range from routine maintenance and upgrades to major capital works and construction of entirely new facilities. They include new or replacement facilities in Saldanha, Knysna, Philippi, and Ravensmead. Also, the 255 million rand emergency centre expansion at Groote Schuur Hospital, the 150 million rand rehabilitation of wards at Alexandra and Lentje, the 42 million rand upgrade of Montague Hospital, and critical repairs and upgrades at theatres in New Somerset, Tygerberg, and Caledon hospitals. Many of these investments will come into service during the current financial year. We are also responding to growing demand for mental health services. This year, 3 new acute psychiatric units at Eerste River, New Somerset, and Khayelitsha hospitals will come online, adding 90 additional mental health beds to the provincial platform. These APUs are helping to create a healthcare system that is more accessible and better equipped to meet the needs of the residents we serve. Honourable members, one of the devastating challenges that South Africa is facing are the high rates of gender-based violence and femicide in our country. The President recognized the destructive impact of gender-based violence when he declared it a national disaster last year. All organs of state were mandated to respond. The Commission for Gender Equality noted that 1 in 3 women report having experienced physical or sexual violence during their lifetime. These figures demand urgency from all of us. I therefore wish to acknowledge the important oversight work undertaken by my colleague in this House, Honourable Godsell, and other members of Parliament, which have highlighted shortages of rape evidence collection kits at police stations, including several on the Cape Flats. As our contribution to the fight against GBV, we will be rolling out a forensic nurse qualification at our College of Nursing. This qualification is critical to enabling nurses to conduct forensic exams, collect evidence, and testify in court, and ensure that survivors receive both care and justice. I'd like to thank the National Health Council for its support in addressing the long delays in the accreditation of this diploma. Chair, while there are many challenges facing the healthcare system, there's also reason for hope. By focusing on prevention and expanding access, investing in infrastructure, and embracing partnerships, we can build a healthcare system that delivers better outcomes for all. Because ultimately, healthcare is a team effort. And when we work together, we can ensure that South Africans have the opportunity to live healthier, more dignified, and more fulfilling lives. I thank you.
Thank you, Honorable MEC Vega. The next speaker is on the virtual platform is Honorable DM Masiho, the MEC for Health from Limpopo Province. Over to you.
Thank you very much, Honorable Chairperson of the session, Honorable Minister of Health, Dr. Aaron Mutsoaledi, Deputy Minister, Honorable Members, fellow MECs, distinguished guests, ladies and gentlemen, good afternoon. It is an honor to participate in this important policy debate on Budget Vote 18 on behalf of the people of Limpopo and the African National Congress. This debate takes place at a critical moment in our country's democratic journey. We gather under the leadership of the ANC-led government of national unity, committed to building a developmental state that advances social justice, economic transformation, and improved quality of life for all our people. The Constitution places health at the center of human dignity and social development. Section 27 affirms the right of everyone to have access to healthcare services. As government, we remain committed to progressively realizing this right despite fiscal constraints and increasing demands on the public healthcare system. Honorable Chairperson, we support Budget Vote 18 because it seeks to strengthen the health system, improve access to quality healthcare, reduce inequalities, and advance the implementation of national health insurance as a vehicle for universal health coverage. The budget reflects government's determination to protect the gains of our democracy while responding to the evolving healthcare needs of our population. In Limpopo, we continue to align our provincial priorities with the National Health Sector Strategic Plan and the Medium-Term Development Plan. Our focus remains on strengthening primary health care, improving infrastructure, addressing human resource challenges, enhancing governance, and ensuring that every citizen receives quality health care closer to where they live. Honorable Chairperson, one of the most important pillars of our health system is primary health care. We have consistently maintained that healthcare must be people-centered and community-based. We therefore welcome the continued investment in clinics, community health workers, and district health services. Primary health care remains the foundation of our health system and the first point of contact for the majority of our people. Across the province, we currently have a total of 476 primary healthcare facilities, of which 204 are already providing 24-hour services. Through the rollout of the 24-hour service, we once again demonstrate a province that is not only expanding access, but doing so in a structured and measurable manner aligned to service demand and population distribution. In a predominantly rural province such as Limpopo, primary health care remains the first point of contact for millions of citizens. Our provincial government continues to invest in outreach programs, ward-based primary health care teams, and community health interventions aimed at prevention and early detection of disease. We are encouraged by the national commitment to strengthening healthcare services in underserved communities, particularly those located far from urban centers. Honorable Chair, human resource remain the backbone of healthcare delivery. We acknowledge the concerns raised regarding shortages of healthcare professionals across the country. The reality is that healthcare workers continue to carry enormous responsibilities under difficult conditions. We therefore support efforts by the National Department to strengthen workforce planning, improve retention strategies, and expand training opportunity for health professionals. In Limpopo, we continue to prioritize the recruitment of doctors, nurses, pharmacists, and allied health professionals within available resources. We are also investing in the training of young healthcare professionals and supporting initiatives that place skilled personnel in rural and underserved communities. We have also strengthened management capacity at facility level through the appointment of 87 operational managers at primary healthcare facilities. This intervention has improved oversight, coordination and accountability within facilities, ensuring that service delivery is better managed and more responsive to community needs. Community-based services remain a critical pillar of primary health care. We therefore welcome the support from the National Department of Health that enabled us to permanently appoint 2,932 community health workers with matric qualifications, while continuing to support 3,931 community health workers without matric through stipends. Honorable Chair, infrastructure development remains central to the healthcare transformation. The condition of healthcare facility directly affects patient experience, staff morale, and service quality. We welcome investments aimed at revitalizing health infrastructure, modernizing facilities, and ensuring that hospitals and clinics are properly equipped. We are pleased with the progress of the Limpopo Central Hospital and Siloam Hospital. We also have several infrastructure projects that are being implemented to improve service delivery and expand access to healthcare. These interventions include upgrading clinics, maintaining existing facilities, and strengthening emergency medical services infrastructure. Our objective is clear. Every citizen must have access to safe, functional, and dignified health facilities. Honorable members, mental health remains a critical priority within the health system, requiring a response that is both structured and sustained. In the previous financial year, we ensured that all 5 district mental health review boards were fully functional. These boards continue to play a central role in safeguarding the rights and the dignity of mental health care users, overseeing assisted and involuntary admissions, and ensuring compliance with legal and clinical standards in line with the Mental Health Care Act. Through regular sittings and case reviews across all districts, these structures have strengthened accountability, improved governance, and ensured that mental health services are delivered within a framework that prioritizes human rights and ethical care. Honorable Chairperson, the implementation of the National Health Insurance remains one of the most significant policy reforms in democratic South Africa. We remain unwaveringly in our commitment to universal health coverage. NHI is fundamentally about equity. It seeks to ensure that access to healthcare is determined not by one's income, race, geographic location, or social status, but by need. While challenges remain, we believe that the phased implementation of NHI provides an opportunity to address historical inequalities and strengthen the public healthcare system. As a province, we stand ready to continue working with the National Department to prepare our systems, strengthen governance, and improve service quality in support of the NHI implementation. Honorable Chairperson, the fight against HIV, TB, and non-communicable diseases remains a priority. South Africa has made a significant progress in reducing HIV-related deaths and expanding access to treatment. However, much work remains to be done. Our response to HIV, TB, and other communicable diseases continue to show measurable progress, reflecting a health system that is increasingly proactive, coordinated, and outcomes-driven. We strengthened HIV prevention and treatment intervention through a combination of innovation, scale, and targeted community engagement. The introduction of HIV self-screening as a service that is available across public health facilities has expanded access to HIV services significantly. In the fight against tuberculosis, the province has also maintained a strong performance. Facility-based screening has consistently exceeded 100% coverage, while TB testing increased by 75.3% compared to the previous financial year. Treatment initiation reached 99.2%, exceeding the national target of 95%, and treatment success rates met the provincial target of 81%. We support continued investment in prevention, treatment, and community-based intervention. Equally important is the growing burden of hypertension, diabetes, cancer, and mental health conditions. These diseases require integrated responses that combine prevention, early diagnosis, and effective treatment. Our healthcare system must increasingly focus on wellness and prevention if we are to reduce long-term healthcare costs and improve health outcomes. The Sepedi proverb says, "Thibela bolwetsi, iphala kalafi," meaning prevention is better than cure. We have made measurable progress in improving maternal and women's health outcomes, reflecting strengthened clinical services and preventative interventions. Specialist recruitment has strengthened services, with 26 specialists now serving across our district hospital, improving the management of high-risk pregnancies. The HPV vaccination program continues to perform strongly, achieving 96% coverage, the highest in the country. Cervical screening has improved through targeted interventions, including procurement of 8 additional colposcopy machines, ensuring all 37 hospitals offering acute services are equipped. In the 2026-27 financial year, we will strengthen the antenatal care, improve monitoring of high-risk pregnancies, and sustain high immunization.
Honorable MEC, unfortunately, your time has expired. Thank you for your input.
Thank you very much, Chair. Thank you.
The next delegate to come to present to us is Honorable Farmer from the Western Cape.
Honorable Chairperson, Honorable Deputy Minister, honorable members, I greet you in the name of Jesus Christ, our Lord and Savior. Chairperson, health is not just another department. Health is life. Health is dignity. Health is whether a mother receives help when a child is sick, whether a pensioner receives medication on time, whether an ambulance arrives, when a family is in crisis, and whether a patient is treated as a human being and not as a number in a queue. Chairperson, South Africa does not only have a health funding challenge, we have a health delivery challenge. Too many people wait too long, clinics are overcrowded, hospitals are under pressure, too many frontline workers are exhausted. Too many communities still experience healthcare as frustration instead of care. Let us be clear, poor people must never be forced to accept poor healthcare. A person's dignity must not depend on whether they can afford private medical aid. Public healthcare must be safe, clean, professional, and compassionate. Honourable members, we welcome continued investment in national health priorities, including HIV and TB, medical research, public health programs, and preparation for national health insurance. But NHI cannot be built on weak foundations. If a clinic has no medicine, NHI will not fix that by name alone. If a hospital has no staff, NHI will not fix that by policy alone. If procurement systems are corrupt, NHI will not fix that by promise alone. The Patriotic Alliance believes in universal access to healthcare. We believe every South African deserves quality care, but we also believe that any reform must be practical, transparent, properly costed, and corruption-proof. Chairperson, before we can speak about the future system, we must fix the system people are using today. Because healthcare is not delivered in speeches, it is delivered at the bedside. Honourable members, we must also speak about our health workers, doctors, nurses, emergency workers, cleaners, porters, pharmacists, and community health workers carry the system every day. Many work under extreme pressure. Many face overcrowded wards, trauma cases, staff shortages, and emotional exhaustion. And yet, at the same time, we have qualified health professionals who remain unemployed while hospitals and clinics are understaffed. That cannot make sense. The Patriotic Alliance calls for a practical staffing plan that matches funded posts to real service delivery needs. Where posts are vacant, they must be filled. Where professionals are trained, they must be placed. Where rural communities are underserved, incentives must be strengthened. We cannot preach care while neglecting the carers. Chairperson, infrastructure is another urgent issue. A broken clinic building is not just an infrastructure problem, it is a health risk. When roofs leak, when toilets do not work, when waiting areas are overcrowded, when generators fail, when equipment is broken, patients suffer. A health budget must build and maintain facilities that are fit for purpose. Honourable members, we must also protect the integrity of health procurement. Corruption in health is not ordinary corruption. When money meant for health is stolen, people suffer directly. Honourable members, having been diagnosed with the exact same disease that took my father's life, I realized what the difference means of having access to medical aid. Today I am a cancer survivor and my dad is in his grave, simply because mine could be early detected thanks to having medical aid, whereas he could not afford it. Honourable Minister, NHI is urgently needed. From the Grand Mine Ocean View here in Western Cape to the young girl in Musina and Limpopo, all deserve the same dignity when they enter the public health system. In closing, fellow citizens, the Patriotic Alliance supports this budget vote because no responsible party can oppose money meant to keep South Africans alive. Parties have opposed this budget simply as a blanket political approach, whilst in the same breath wish to propagate their concern for the poor. Without a budget, even the little that comes your way won't be possible. This proves that talk is cheap and compassion for the poor can ride on everyone's lips, only to realize it's just another attempt to bring the Guptas back. This budget, however, should not only fund the health system, but also heal the health system. Muni Baizani, salute.
Thank you, Honorable Farmer. The next speaker is going to be, let me see. The next speaker is going to be the MEC of Mpumalanga, the province of the Rising Sun, Honorable S.J. Manzini. Over to you.
Thank you, Honorable Chairperson. Let me take this opportunity and greet honorable members, the Minister, Deputy Minister, MSCs. Honorable Chair, allow me to begin my debate by stating that we fully support the budget vote as it is driven by the desire and willingness to continue to provide adequate health care to the people of South Africa, regardless of their age, class, race, socio-economic status, or any other categorization. Before I dwell much in my presentation, let me evoke the profound word of former United Nations Secretary General Kofi Annan, who once said, "Health is a human right. Investing in health is not only a moral imperative, it is the foundation upon which prosperous, equitable, and resilient societies are built." Close quote. These words resonate deeply with our constitutional commitment to ensure that every South African has access to quality healthcare services, irrespective of their socio-economic status or geographic location. As we gather here today during the month that embrace and celebrate the youth, we are reminded that the future of our nation is intrinsically linked to the health and well-being of its young people. To this end, government remains steadfast in prioritizing youth health through comprehensive programs that address sexual and reproductive health, mental health support, HIV prevention, substance abuse intervention, immunization campaigns, nutrition campaign, and youth-friendly healthcare services. The youth of South Africa are not merely beneficiaries of healthcare service, they are the future workforce, innovators, entrepreneurs, and leaders who will drive our country's developmental state. In investing in their health today is investing in the prosperity of tomorrow. Honorable Chair, the Mpumalanga Department of Health continues to accelerate service delivery despite prevailing fiscal constraints and growing healthcare demands. We are guided by the principle that quality healthcare must be accessible to all our people, particularly the most vulnerable communities. In his SONA debate earlier this year,
Premier Mandla reflected that the factual report released by Oxfam, which stated boldly that approximately 89.8% of Mpumalanga's population depends on the public health care system. This reality places a profound responsibility on government to strengthen public health care infrastructure, expand access to quality services, increasing human resource for health, and ensuring that no citizen is left behind. As part of embracing the fourth industrial revolution, we have introduced the single electronic patient medical record system, which will transform healthcare delivery by ensuring continuity of care, reducing duplication of services, and enhancing patient management throughout the healthcare system, working with the National Department of Health. This initiative is currently piloted in Steve Tshwete municipality in Kangala district, and we are in the process of rolling out to other districts, including Govenbeek local municipality and in Gert city of and in Gert and Mbombela in Ehlanzeni. Our readiness for the implementation of the national health insurance is demonstrated by the fact that our district hospital achieved 100% on ideal facility framework, while our primary healthcare facility are at 98.2%. This achievement reflects the significant progress we have made in improving governance, patient safety, infrastructure, and service delivery. The NHI remain one of the most transformative policies in democratic South Africa. It seeks to eliminate the inequality that continue to characterize healthcare access and outcome. It is a bold step towards ensuring that quality healthcare is determined by need and not by one's ability to pay. To this end, we are accelerating the employment of health professionals, strengthening primary healthcare services. We recently appointed 25 medical doctors and deployed them to community health centers across Mpumalanga. And as a result, 36 community health centers now have full-time doctors stationed permanently, while an additional 10 healthcare are supported by contracted doctors. That brings up to 77% coverage. Honorable members, our commitment to strengthening healthcare infrastructure remains unwavering. During the current financial year, we will complete 7 clinics and commence the construction of 4 new clinics to improve access to healthcare services, particularly in underserved communities. We have also completed the Technological Advanced Middelburg Regional Hospital, a world-class health care facility that is fully operational and ready to serve the people of Mpumalanga. We eagerly await its official opening by the President Cyril Ramaphosa. Furthermore, the state-of-the-art Mapulani Hospital is scheduled for a practical competition next year once completed, and it will significantly strengthen specialized healthcare services in the province and improve patient outcome. Honorable Chairperson, the fight against HIV and AIDS remain one of the foremost priorities. Mpumalanga continues to play a leading role in advancing scientific innovation and public health intervention aimed at ending HIV as a public threat. We welcome the projected launch of the Lela Kabavir tomorrow, Minister. We are waiting for you in Mpumalanga, Gersibande district. And this groundbreaking initiative places our province at the forefront of global efforts in eliminating HIV. This initiative complement and our comprehensive HIV response strategy, which include widespread HIV testing, treatment program, prevention campaign, voluntary medical male circumcision, and pre-exposure prophylaxis, vertical transmission prevention, and community awareness campaign program. Through this intervention, we continue to move closer to achieving epidemic control and protecting future generational from HIV and AIDS. Honorable members, the success of our healthcare service system depends on bringing service directly to the people. This is an essence of Cheka Impilo campaign, which speaks to proactively identifying health conditions before they become severe and costly to treat. Through this campaign, healthcare teams visit communities, workplaces, schools, and public places to conduct health screening and hypertension, diabetes, and tuberculosis, HIV, cervical cancer, and other chronic conditions. The campaign promotes a culture of prevention, early detection, and early intervention, thereby improving health outcome and reducing pressure on healthcare facilities. Similar to Ezempilo Ebantwini program, reflect government commitment that we have launched in the province to placing people at the center of healthcare services. Through this program, healthcare leadership engage directly with communities to access service delivery challenges, strengthen accountability, and implement practical solutions that improve patient experience and healthcare outcome. Ezempilo Ebantwini is more than a program. It is demonstration of government determination to ensure that healthcare services are responsive, accessible, and people-centered. Honorable Chair, the progress we have achieved will not be possible without the dedication, resilience, and sacrifice of our healthcare workers. Every day, doctors, nurses, pharmacists, emergency personnel, community healthcare workers, and support staff continue to provide quality healthcare service under often challenging circumstances. Their commitment embodies the spirit of public service and demonstrate what can be achieved when professional are driven by compassion and a genuine desire to improve the lives of our people. As government, we acknowledge the challenges that remain. We recognize the pressure posed by population growth, disease burden, resource constraint, and infrastructure demand. However, we remain confident that through innovation, strategic partnership, and sound governance, unwavering commitment, we will continue to strengthen our healthcare services. In conclusion, let me remember the words of our beloved statesman Nelson Mandela, who said, "I open quote, the nation should be judged by how it treats its highest citizen, but its lowest ones." Close quote. The pursuit of universal health coverage is ultimately about dignity, equality, and social justice. It is about ensuring that every child, every young person, every woman, every man can access quality healthcare service when they need them the most. Mpumalanga stands ready to contribute meaningfully to the national endeavor. We stand ready for the implementation of the national health insurance. We stand ready to deepen healthcare transformation. Most importantly, we stand ready to ensure that quality healthcare reaches every corner of our province. I thank you, Honorable Chairperson.
Thank you, Honorable Manzini. The next speaker is here in the House is Honorable Peter from the Home of the Legends.
Sihlalo wendlu mandibulise kuwe nakuminister naku-deputy minister bakhoyo apha nakumalungu lendlu ahloniphekile mandikhahlele mhlali ngaphambili. Okokuqala mhlali ngaphambili kule budget mandizokwenza umbulelo kuqala omkhulu kaDr. Khoshentsho Ramokgopa xa bendikhala izolo ngeelali eziyi-11 ezingenambane almost a week. Today ziyalight ezo lali. Mandibulele kakhulu, mandibulele minister. Ndiphinde ndibulele Nelson Mandela Metro. Kukho ward 55 bendikhala ngaye. Nase-Alexandria uye wathatha inkcukacha uminister kuyalayithwa nje bandithetha nawe nje. Asikwazi ke sihlalo singalenzi ilizwi lombulelo ngoba asikho apha for politics only. Sikho apha for uthetha nenyaniso. Mandingene kuminister ke ngokukhoyo wezempilo. Minister, phaya eMdantsane kukho ifamily yakwaNgalo ngo-2011 yayobeleka umntana phaya eSiciliya Makhewane. Bamparalyzer up to now. Bamthembisa nge-4.5 million. Zange bamnika since 2011. It's 2026, 15 years. Ikhona yonke information nezithembiso babezenzile kuye. Ndinazo bandithumelele nje bandihlela kulaa ndawo. Zange bamncede. Sicela ungenelele minister. Ndigqithe lo mama ke uhlala eNdevane eKingulame minister. Ndigqithe ndiye kwicandelo lo-doctor. Deputy minister, oodoctor abekho ezibhedlela. Andiyazi noba i-monitoring niyayenza na mphathiswa. Isibhedlela ubusuku bonke sinogqirha omnye. Mandikwenzele typical example ngeDora Nginza. Dora Nginza apho ndihlala khona eBhayi. IDora Nginza minister wenze i-maternity ward enhle pha wafaka i-equipment. Up to today ayikasebenzi. Umbuzo umile niyazimonitorisha na minister ezi zibhedlele. Ndigqithe minister ndikunike ezi zibhedlele zine. Nikhe niye kuthafa lofefe pha kuCentane. Nikhe niyenze i-monitoring pha. Awakho amayeza minister. Nikhe niye eNompumelelo ePhedi. Imesi pha. Nikhe niye eJoe Slovo Clinic kwa Ward 41 kwaPha eBhayi. awuzange akhona amayeza ikliniki elixhoba minister eqhekezwa mhla nezolo ngorhunta Bandigqibelisa imthatha hospital yenye inyikitya minister ndithetha ngephondo lam yenye inyikitya enzeke imthatha awuyazi kwenzeka ntoni abantu abayazi noba bangakhalaza phi ngoba isibhedlele sigutyungelwe zezopolitiko umbuzo umile minister ingaba niyaya na nenze i-monitoring xa ndidlula minister andingemdanga minister CUDM sixhalabile ngoba amathemba ethu akuni sixhalabile yonke into ebanjwa zizandla zenu iyaphunguka khani sihlangule minister eli lizwe lisajonge kuni nathi sikho for ukunixhasa ngako oko le budget ndiyayisapota enkosi minister
Thank you, Honorable Peter, for your input and for the acknowledgement of the work done by the Ministry of Electricity and Energy. The next speaker is on the visual platform is Honorable Ashley Harry, the MEC from the Northwest, Bukoni Bipurim. Over to you. Honorable Harry? Is he on the platform? Table staff? Is he on the platform? No, he's not on the platform, so I will come back to him later if he's available. The next speaker is here in the house is Honorable Billy. I think he experienced one of our hospitals not so long ago. I think he'll give testimony what he experienced.
House Chair, honorable members, fellow South Africans, as this debate draws to a close, one thing is clear. The minister will no doubt dismiss much of what has been said today as criticism, in particular criticism from the DA. But honorable minister, that would be a mistake, because our criticism does not come from a desire to see government fail. It comes from a desire to see public health care succeed for those who desperately need it. The DA wants a public health care system that works. We want hospitals that heal people, not buildings that make headlines for neglect. We want clinics that provide dignity, not frustration. We want healthcare workers to be empowered, to be supported, to be equipped to do the jobs they entered the profession to do. We want doctors to be employed, Honorable Minister. Yet, whenever these failures are raised, government resorts to a familiar tactic, shift the conversation to the NHI. And it is some grand savior, as if it is some grand savior for years of ANC failure. South Africans are repeatedly told that anyone who questions the NHI is opposed to universal health care. And that is simply not true. The DA supports universal health care. We support the constitutional principle that every South African deserves access to quality health care, regardless of their income or status in society. What we do reject, Honorable Minister, is the notion that a broken health care system can be fixed simply by creating a new funding mechanism. Universal health coverage is the goal. NHI is merely one proposed vehicle, and no vehicle can reach its destination if the engine is broken. The department's own plans speak about improving the quality of healthcare, strengthening hospitals, maintaining infrastructure, improving governance, filling critical posts, and reducing maternal and child mortality. Those are worthy objectives, Honorable Minister. But the question is whether the question is not whether the targets are correct. The question is whether this government can be trusted to achieve them after decades of failure. Minister, the simple question is, why is the same passion you demonstrate when defending the NHI not directed towards fixing what already exists? directed energy towards rooting out corruption, directed towards ending procurement abuse, directed towards ensuring that money allocated to healthcare reaches patients rather than politically connected contractors. Minister, South Africans haven't forgotten the digital vibes. Directed towards fixing broken hospitals, replacing failing equipment, ensuring medicines are available when patients need them. Because for millions of South Africans, healthcare is not a policy debate. It is a matter of life and death. It is the mother waiting for treatment. It is the pensioner standing in a queue before sunrise. Just a few days ago, Honorable Minister, my own grandmother was sick, but I could not dare take her to Holy Cross Hospital in the Eastern Cape because that hospital is notorious for neglecting desperate and poor people from the rural Eastern Cape. I'm disappointed that the MEC of Health in the Eastern Cape has left. It is the cancer patient waiting for months for care. It is the nurse trying to save lives without the tools required to do so. And sadly, examples of waste and mismanagement continue under your watch, Minister. At Pixligaseme Hospital in Durban, expensive orthopedic traction beds were purchased, but have never been operational because essential components were not procured. Minister, this is what you are presiding over. This is why South Africans are losing faith. Not because they oppose healthcare reforms, but because they have watched billions of rands flow into the health system while basic service continue to deteriorate. Chairperson, healthcare does not fail because we lack policies. Healthcare fails when accountability disappears, Honorable Finis. Healthcare fails when corruption is tolerated by the ANC. Healthcare fails when leadership refuses to confront uncomfortable truth. And the real test of this budget would not be the speeches delivered in this House today, Honorable Minister. The real test is whether an ordinary South African walking into a public clinic or hospital tomorrow experiences better care, greater dignity, and improved service. And until that happens, Minister, no amount of rhetoric, no amount of slogans, and no amount of political spin will convince the public that things are improving. The DA will continue to support every effort that genuinely improves healthcare outcomes. But we will also continue to expose waste, to corruption and mismanagement wherever it occurs, because patients deserve better, healthcare workers deserve better, and South Africans deserve better. I thank you.
Yeah.
Thank you, Honorable Billy. The next speaker is Honorable Lihari, the MEC for Northwest in the Health Department. Over to you, sir. He said that he's back online. Is he still back online? Honorable Lihari.
Thank you very much.
All right, just show your face and then you can close your camera after that, your video after that.
Yes. Thank you very much. Thank you, Chairperson of the House, Minister of Health, Dr. Aaron Muthaledi, the Deputy Minister of Health, Dr. Joe Phatla, Minister of Social Development, Ministers, Deputy Ministers present, fellow MECs present, Salga, Head of the Department of Health entities, or members of the House. Thank you very much. It is both a privilege and honor to rise in support of the National Department of Health budget vote and policy speech for the 2026-27 financial year, presented by the Honorable Minister Health, Dr. Aaron.
Point of order.
Honorable Hari, there's a point of order in the House on
The
authorizing Honorable Hari. Honorable Hari, there's a point of order in the House.
The health sector is
Honorable Hari, there's a point of order in the House. Over to you.
That's my point of order, Chair. Please, Chair, can you put him out of his misery and put us out of our misery?
Honorable Hari, can you get a new position where you can be more audible? Hey, you know, Northwest even yesterday it was just like that. Yeah, I think that we must improve the infrastructure there. Honorable Hari, are you getting a new position? No, I think it's bad. So you are forfeiting your opportunity. Now I'll go to the last speaker, which is going to be on the House here, Honorable.
Am I audible now? Hello, am I audible?
Honorable Hari, you have.
I can hear you. I can hear you.
All right, Honorable Hari.
I'm in the House. I can hear you.
There's one presiding officer here. Honorable Hari, are you audible now? Are you in a better position?
Yes.
Will you please try? Aye. Honorable Hari, it shows that you've got a problem. I'll request.
No, I'm on. Can you hear me?
All right. Thank you, Honorable Hari. We're having now Honorable Mukwilo on the podium. Over to Honorable Mukwilo.
Thank you, House Chairperson of the Council.
Point of order, Chair.
On what are you rising, Honorable Paternost?
Rule 51, Chair.
Yes.
Can you please rule against yourself for irrelevance and repeating yourself the whole time? Thank you, Chair.
You're out of order. Your order is not sustained. Over to you, Honorable Mukwilo.
Hey, no. Thanks very much, Chairperson of the Council, House Chair, members of this House, Minister, Deputy Minister, distinguished guests, most importantly, what we talk about duty ba Africa Borwa, ba re ba emelago ka botswerere. House Chair, today as we deliberate on Budget Vote 18, Health, under the theme Building the People-Centered Healthcare System, we are reminded that our Constitution is not a static document. It is a living expression of the Freedom Charter, a promise that the people shall share in the country's wealth and that there shall be houses, security, and comfort. In health, this means that every South African, regardless of geography or circumstances, must have access to quality and dignified care. House Chair, the President, in the 2026 State of the Nation address, reaffirmed that health is the heartbeat of our development state. He reminded us that without healthy population, our ambition for growth, innovation, and social injustice cannot be realized. This budget, therefore, is not just numbers on paper, Chair. It is a moral commitment to the people. House Chairperson, the Constitution enshrines the right to health care services, including reproductive health care. This right is not an aspirational, it is an actionable. By aligning our health system with the transformative vision of the Freedom Charter, we ensure that health care is not a privilege for a few, but guarantee for all. A people-centered system means listening to the communities, like we did there at Northwest House Chair, respecting cultural contexts and ensuring that the dignity of patient is always at the center of care. Honorable members, The World Health Organization identifies 6 building blocks of the well-functioning health system: service delivery, health workforce, information system, medical product and technologies, financing, governance, and leadership. This budget affirms our commitment to each of these pillars. By supporting it, honorable members, we are not only strengthening our domestic health system, but we are also aligning ourselves with global best practices, which I will share with you at the later stage, honorable members. This is how we build resilience, efficiency, and equity. Fellow South African, we all know that quality healthcare is not measured only in statistics, but in a lively experience. It is the mother there from Limpopo in Skinot who received timely intentional care. The child there in Khayelitsha here in Cape Town who vaccinated against preventable diseases, and the elderly man in Kimberley who received chronic medication without delay. When we care is safe, timely, and patient-centered, and outcome improves, and mortality decreases, and life expectancy always rises. Communities thrive. This is the true dividend of investing in health. That is what the African National Congress, we live it, we don't just say it. We cannot speak of transformation without addressing infrastructure. Too many of our facilities remain under-resourced, overcrowded, and outdated. But this budget prioritizes ideal clinics, climate-resilient hospital, and investment in renewable energy to ensure continuity of care during a load shedding or climate shocks. Equally important is technology. The move towards a single electronic health record will integrate our system, reduce duplication, and ensure that whether a patient is in Umtata or in Polokwane, their medical history is accessible and secure. This is a modernization with a human face. Honorable members, our doctors, nurses, community health workers, and specialists are the backbone of our sector. Yet too often they are overburdened, they are under-resourced, and unevenly distributed. Urban centers attract talent while rural areas are struggling. This budget make provision, like as the minister was indicating, this budget make provision for continued investment to absorb practitioners at all levels and ensuring fair distribution. We must honor their sacrifice by creating conditions that allow them not only to serve, but to strive. Chairperson, one of the gravest threats to our sector is the rise of bogus and fake doctors, Minister, particularly in a small town, rural areas, and township. And this imposes exploit desperation, endanger life, and undermine trust in the system. Let me go back to whereby we are learning a good practice to other countries. Honorable members and fellow South Africans, as the Select Committee on Health, we had an opportunity to visit one of the wealthiest countries in the world, Switzerland, just a few weeks ago, where they also having the same problem or the same challenges we are having, Minister, like us in South Africa. But what we have learned from them, Minister, is that when they source doctors or professionals from other countries, they make sure that they screen them in their country and even put them under a specific training. That is, I think that as South Africa, we can also learn from Switzerland so that we avoid these bogus and fake doctors, which indeed we really need them. We must strengthen regulation, Minister, and enhance community awareness and ensure that law enforcement acts decisively. Healthcare is too scared to be left vulnerable to fraud. The COVID-19 pandemic taught us that preparedness is not optional. Emerging threat now, as we have indicated, Minister, such as hantavirus and other zoonotic diseases, remind us that vigilance is essential. This budget continues in continuous investment in surveillance system, laboratory capacity and rapid response mechanism. Diseases has no borders, preparedness, and must be national, regional, and global. In his SONA address, President Matamela Ramaphosa declared that we will not rest until every South African can walk in the clinic or hospital and know that they will be treated with dignity, efficiency, and compassion. That is why, honorable members, primary health care for the African National Congress is the cornerstone of what will never compromise. This budget, honorable members, this budget is the pathway to what vision? It is a bridge between constitutional promise and live reality. It is a statement that health is not a cost but an investment in human capital, social cohesion, and national prosperity. Honorable members, before I conclude, I just want to try to conscientize honorable members. In fact, the last one that has been speaking, trying to protect and saying that when the DA is criticizing, is not trying to come up with the scapegoat. Honorable Billy, you come on this podium instead of providing solution, as you normally say that you represent the people, you come up and complain and not giving us solution. I've been warning you, honorable members. I know it's not only you, even honorable Adrias and even honorable that you always come here and tell South African about corruption. As the ANC, let me remind you again, we don't come here and grandstand about corruption. When there is corruption, we act and arrest, irrespective as who is involved on corruption. My friend, the minister was just here because the problem with you honorable members, when the speaker they are on the podium, you are not listening. You are not listening. The minister was here indicating that they've just recently introduced the machine that can be operated by anyone. But you come here and say that you don't see any improvement. So we must learn to listen, not always come here and talk as if you don't want to say. Honorable members, fellow South African, as the African National Congress, the reason why we are saying that we will support this budget vote. This budget vote is the people-centered health system. It is not just a slogan. We are not just coming here and talk. We always we are here even fixing honorable Bananos, the things that has been done by your good self. You must, in fact, the DA mustn't say anything. By supporting this budget vote, we affirm our collective responsibility to the people of South Africa. We affirm that health is the solution of the freedom, dignity, and development. Honorable members, let me make the last appeal for you. Let us therefore rise above this partisanship, Honorable Billy, and unite behind this budget. For in health, the stake is not political, honorable members. They are human. We must learn that we mustn't come when we talk of health and start to politics and do whatever. We must understand that this thing, it must always unite us as the people of South Africa. Let me finalize. In fact, I thought that I won't entertain those other two parties because the EFF and MKP party, always they come here. They come
before the podium complaining, not telling us anything. They don't tell us anything. But at the end of the day, you will hear them saying that we reject. They just come here just to reject anything without even, they don't even listening that what the budget is entail. So I want to make an appeal to South Africans that they must stop wasting their votes. In particular, with the EFF and the MKP part. Because you come here, you come all the time, you don't even know, you are like a person who ran out of ideas. So by so soon, as the African National Congress, we are supporting this budget. We are saying, Minister, cover and make sure that people of South Africa get a decent health. Thank you.
Thank you, Honorable Mukwili. Thank you, Honorable Mukwili, for your input. Honorable Telekesi, the minister has saved 2 minutes in his opening remarks, so they'll be added at the end when he responds now. Over to you, Honorable Minister Mukwili.
So I've got 7 minutes. Okay. Thank you very much, Honorable Chair. Honorable Bill, I am not here to respond to criticism of DA.
Point of order, Chair.
That is not really my job.
Yes. On what are you raising?
Chair, thank you very much. Rule 68.
Yes.
Rights of delegates to speak, Chair. There was a ruling in this House last week by the Deputy Chair of this House to say that you cannot add time on at the end of somebody's sweep.
Right.
There was a ruling, so now you are changing that ruling. So what happened to conventions?
All right, thank you, Chair. Thank you, Honorable Badenhorst. Your point of order is not sustained because this minute is coming from the minister himself. It's not taken from another member. It is from his own speech. He reserved that. That's why when Honorable Steenhuisen was speaking here during his budget vote debate, he had 15 minutes before and then had 10 minutes at the end. It was his time because the ministry is provided for 25 minutes, so it is within his rights. Over to Minister.
Yeah, I'm not here to respond to any criticism by DA. It's not necessary to do so. But I am here to clarify when people are going wrong and misleading the public. Yeah, firstly, we do not push the debate to NHI. We are pushing it to equity in healthcare. And in that case, we are not apologetic. Equity in healthcare. The concept of universal health coverage was not brought about by ANC. It's a concept brought by the World Health Organization and adopted by United Nations. I don't remember any country on earth when the debate took place at the United Nations to adopt universal health coverage. I don't remember any country standing against that. That is why the 12th has always been chosen, the 12th of December, as Universal Health Coverage Day. Now, many people in our country, including yourself, sir, have adopted their own definition of universal health coverage. They define what it is and how it should work, not what the originators meant. The originators of universal health coverage, which is the World Health Organization, did not just dream about a new type of healthcare system. It was out of many years' experience of observing how healthcare systems are run around the world. One of their major experiences was that whenever human beings on this planet access healthcare, whatever healthcare is available, when they access it, they usually suffer financial hardships. And the World Health Organization has got figures, not in millions, but billions, of people who, in terms of the poverty data line, were not classified as poor, but they got poor because somebody in the family got sick and needed health care, and they are suddenly very poor. And this observation was made over many decades, and they found that is because not all people on this planet are covered objectively in terms of universal health coverage. Now, Honorable Duplessis, you came up with two concepts that are different. You mixed them in one. You were talking, you said everybody or yourself, you support universal care coverage. There's no such a concept. There is no concept called universal health coverage. These are two different concepts. There is universal health care, abbreviated as UHCare. Then there's universal health coverage, abbreviated as UHC. They might be related, but they are different. Universal health care is a system that delivers medical services to people, regardless of what type of medical services are there, how to receive them. As long as you deliver medical services, that's universal health care. But universal health coverage specifically speaks about money from each individual. Its goal is that when everybody access quality health care, they don't suffer hardships financially, and so fall below the poverty data line. It answers three questions, universal health coverage. Who is covered? We know in South Africa, only 14% of the population is covered in universal health coverage. It is us with medical aids in the population. And in this population, where 14% are covered, when you divide it, and that's where our biggest problem is, only 10% of the Black population is covered, but 72% of the white population is covered. And yet we must leave that system as it is. It can't be fair. It can't be fair. And we can't be apologetic when we attack that type of system, that it must change. And again, which services are covered? If you go to medical aids, they'll tell you of PMBs, as if people choose what disease they have. When you've got the PMB, the medical aid will pay in full. If your disease is not a PMB, then they don't pay. Who calls for a disease? Who decides that I want to have a PMB now because I want to be paid for in full? Diseases just come. You get diabetes, you get cancer, you get HIV, nobody chooses. So it can't be that we only cover certain diseases and leave others. Then the issue of what proportion is covered. We are running a healthcare system here. All of us here have got medical aids who don't usually cover vaccines. They don't usually cover diseases of prevention, like we're doing with Lena Kabava tomorrow. And I've been talking to medical aids about this. Even the HP vaccine, which we are going to launch later, they don't pay for it. When we launch the HPV vaccine, which is what we're going to do under NHI, when you launch it in 2014, when we launch it in 2014, I want to give you the figures and not wrong ones. That vaccine was costing 613 rand per child. 613 rand. Only people with medical aid could access this vaccine. We went to the company and said, we are giving you the whole population. That's what we are going to be under universal health coverage, NHI. We said we are going to give you the whole population of young girls. That's why there are 6 million today. And the company sold the vaccine for 157 rand, not 613. Which is what is happening when you don't have a system of universal health coverage. Because you know the economy of numbers is very important. So the health system we want must be preventative, must be promotional, must cover the whole population, not individuals. Because the present system covers individuals, it covers them maybe more or less well, because they are comfortable. But what about the whole population? It does not reduce, it only increases life expectancy if you cover few people in the population. Everybody must be covered because we are all equal. Lastly, I heard your leader, your new leader, and I'm sending you to him, saying DA is going to put up a healthcare system where we don't punish people who worked very hard for their medical aid. Meaning people who don't have medical aid never worked hard. That is 90% of the black population, they never worked hard. You don't have a medical aid because you worked any harder.
Honorable
You were just
Minister,
privileged.
Honorable Minister, on that note of working hard.
Thank you very
time
much.
Expired.
Thank you very much.
Honorable delegates, I think that as this chamber, we must appreciate the team health because the participation of the various MECs into this debate was very encouraging. So it means that it shows the minister that you are leading a very solid team. Thank you for the job well done. Honorable delegates, we will now proceed to the second order of the day, the policy debate on budget vote 19, social development. Can we have the change of guard before we start? Honorable delegates, as I said a minute ago, that we are proceeding to the second order, the policy debate on budget vote 19, social development appropriation bill. I now call upon Honorable S. Chikunga, Acting Minister for Social Development, to open the debate. Over to you, ma'am.
Honorable House Chairperson, Honorable Desiree Finis, and members of the Select Committee on Social Services, Deputy Minister of Social Development, Mr. Hanif Hendricks, MECs for Social Development here present, and those who have joined us online, Acting DG Advocate Goku Timane, and all managers and staff of social development, and of course our state-owned agencies, distinguished guests, fellow South Africans, our partners. Honorable Chairperson, I'm deeply honored to rise before the National Council of Provinces in my capacity as Acting Minister of Social Development to table budget vote 19 of the Department of Social Development for the 2026-27 financial year. From the onset, I wish to reiterate that I fully recognize the immense responsibility that comes with the role of acting as Minister of Social Development, a portfolio whose effective governance and delivery is inextricably linked to the well-being and developmental prospects of the most vulnerable among us. For as long as I'm entrusted with this responsibility, I pledge to carry it with utmost diligence and integrity. I'm deeply honored by the trust bestowed upon me by His Excellency President Cyril Ramaphosa, and I pledge to work with everyone in the sector in delivering on this critical Department of Social Development mandate. It is against this background that I wish to lead with the words most often attributed to Hubert Humphrey, who said, and I quote, "The moral test of a government is how that government treats those who are in the dawn of life, that is children, those who are in the twilight of life, the elderly, and those who are in the shadows of life, the sick, the needy, and those living with disabilities," unquote. And the words of President Mandela, he said, "There can be no keener revelation of a society's soul than the way in which it treats its children." And these words should bind us all.
Honorable Chairperson, social development is a concurrent national and provincial function. Achieving its strategic priorities as contained in this budget vote will therefore require that, in the true spirit of Batupili, we deepen that cooperation across all spheres of government. To this end, 2 days ago, I held my first meet and greet special meeting with MECs responsible for social development. We agreed on the urgent need to strengthen cooperation and to ensure that the 3 strategic priorities of this administration find clear expression in our work. During this meeting, MECs proposed a number of priority items for the MINMEC agenda, the first of which with our ministry is taking place in June. Chairperson, it is befitting that we begin by paying homage to the women who came before us, the women of 1956 on whose broad shoulders we stand. The year 2026 marks a platinum jubilee, that is 70 years since 1956, when our mothers took the apartheid regime head on and paved the way for all of us, both men and women. We honor their demand for development to be women-led and for substantive representation in all spheres where decisions are made and power is exercised. Through their activism, our society has made serious headways in eradicating the exclusion of women from leadership and decision-making structures, from property rights, and from educational opportunities. Today, ours is to take active measures to ensure that women are found in all spaces where power is exercised and economic hierarchies are disrupted. As we table this budget vote in the month of June, we celebrate 50 years, a golden jubilee, since the young person took the bull by its horn and defeated the tyranny of Bantu education. On this 30th anniversary of our Constitution and Bill of Rights, we honor those who laid the ground for a compassionate, caring, and more human society. We're also celebrating the 20th anniversary of the South African Social Security Agency, SASSA, during which we are honoring a legacy and foundation built by the late former Minister Dr. Zola Skweyiya. For 2 decades, SASSA has stood as a constitutional promise kept to shield millions of vulnerable communities from the indignity of poverty through the expansion of our social protection safety net. Honorable members, despite a drop in violent crime rates, we remain deeply concerned about child sexual exploitation, driven both online and offline, and rising cases of statutory rape recorded on the National Child Protection Register. This year, alongside the Child Protection Month program currently underway, we are working to shine the spotlight on these twin challenges confronting our nation. The official closing ceremony is scheduled for 7 June at Ezibeleni under Enoch Mgijima Local Municipality, Eastern Cape Province, one of the hotspot areas. We've been rallying society beyond the Child Protection Month as part of the 368 Days Child Protection Program of Action. Protecting children is a shared national responsibility. In isiZulu, we say, umntwana wakho ngumntwana wam. Your child is my child, and my child is your child. Against this backdrop, I wish to recognize and honor the indispensable role of our social service professionals, child and youth care workers, all of whom provide critical professional and support services to our country's most vulnerable groups. In the coming days, I will be meeting both the South African Council for Social Service Professions and the South African Social Workers Association in order to lay a solid foundation for serving the marginalized. Without our social services professionals, our work is incomplete. Honorable members, with only 4 years left to realize the ambitious vision of the National Development Plan, our budget takes its cue from President Cyril Ramaphosa's State of the Nation address under the theme, A Nation That Works for All, and sets out a clear course of action on how the Department of Social Development portfolio will contribute to the medium-term development plan's 3 strategic priorities. House Chair, this financial year, the Department of Social Development is allocated a budget of 302 billion rand to fund the annual performance plans that align with the medium-term development plan priorities. Of this amount, 293 billion rand, which constitute 96.7% of the DSD budget allocation, is allocated to social assistance program for direct monthly transfers to children, older persons, and of course, persons with disabilities. 36.4 billion rand for the continuation of the COVID-19 social relief of distress until the end of March 2027. 300 million rand allocated to SASSA to provide for the increased cost of administration for COVID-19 SRD. 225 million rand to the National Development Agency. An additional amount of 58.4 million rand for SASSA for costs related to the incentivized early retirement and voluntary exit programs for 134 employees. 54.7 million rand to support 25 national councils and 9.9 million rand reprioritized from the department's baseline to improve the operational efficiency of the Central Drug Authority. An additional allocation of 8.9 million rand to the department's budget for costs related to incentivized early retirement and voluntary exit programs for 12 employees. Chairperson, we will build on SASSA's successes of the previous financial year as we aggressively root out ineligible beneficiaries through the implementation of the grants review process and the enhancement of fraud detection systems. In this regard, an earmarked amount of 77 million rand is allocated to SASSA for fraud investigation. Our focus this year is to make SASSA more efficient and more responsive than ever before. Key amongst others, the agency will expand its digital footprint and expedite lifestyle audits for SASSA officials in grant administration, finance, ICT, and procurement. Working jointly with key service delivery departments such as the Department of Health, Home Affairs, and South Africa's Police Service, we will conduct 70 integrated community registration outreach programs, ICROPs, with particular focus on areas identified as high risk for child malnutrition. Honorable members, as mentioned earlier, the transfer to SASSA for social grant administration has been increased by an amount of 300 million rand to provide for the increased cost of administration of the COVID-19 SRD. This provision currently benefits approximately 8 million working age persons every month who are unable to support themselves and their families. We will continue to intensify the implementation of data cross-referencing with the National Population Register and banks to eliminate any fraudulent beneficiaries from this provision. With regard to basic income support, we are finalizing consultation processes with key departments as directed by the Cabinet. We intend to retable the revised policy proposals, inclusive of cost implications and linkages to economic opportunities, in the second quarter of this financial year. Chairperson, we intend to scale up the Generating Better Livelihoods initiative to all provinces this financial year. The pilot phase of this initiative, which we implement in collaboration with the Finmark Trust and BRAC, was piloted in Free State, Gauteng, and KZN, and it is working. Honorable Chairperson, the National Development Agency has supported the establishment of a community-owned enterprises in all 9 provinces across the country. To augment its budget allocation of 225 million rand, the National Development Agency has set itself an ambitious target of raising over 40 million rand this financial year. Last month, I had an opportunity to visit one of the NDA-supported and youth-led initiatives called Source of Foundation Trust at Vrygrond here in the Western Cape. Here I saw thriving young entrepreneurs in the areas of food and catering, beauty and personal care, clothing and creative industries, and renewable energy solutions. The agency will continue to prioritize similar high-impact initiatives. An amount of 9.9 million rand has been reprioritized from the department's baseline to improve the operational efficiency of the Central Drug Authority. While we are waiting the recommendations of the joint portfolio and select committees for the appointment of new CDA members, we are concurrently finalizing the cluster consultation on the National Drug Master Plan 2026-2030 before taking it to Cabinet. Consistent with the NSP, that is National Strategic Plan on Gender-Based Violence and Femicide, we are expanding access to shelters and psychosocial support services for survivors of gender-based violence. Together with the provincial departments, we provide financial support to 242 shelters across the country. Courtesy of the National Lotteries Commission, these measures will be augmented by the deployment of around 60 contract social workers and 100 GBVF ambassadors to strengthen prevention and response interventions, focusing on the 30 identified GBVF hotspot areas. We are grateful to the European Union Gender Equality and Women Empowerment Program. With their support, we'll be able to establish 4 new shelters, 2 in the Waterberg and Vembe district in Limpopo, 1 in Kenneth Kaunda district Northwest, and 1 in John Taule Gatsiwe district in Northern Cape. We are on track to roll out the integrated digital platform for NPO registration and reporting system, which will allow real-time monitoring of compliance and early identification of NPOs at risk of money laundering and terror financing. During this financial year, we intend to finalize the following legislative and policy priority matters: the Sexual and Reproductive Justice Strategy for South Africa, table the National Drug Master Plan 2026-2030 to the Cabinet, finalize consultation with NEDLAC on the Children's Amendment Bill in preparation for its introduction to the Cabinet and Parliament, finalize the regulations to bring the Older Persons Amendment Act into effect. On a related matter, we intend to finalize the National Strategy on Aging for South Africa. Honorable Chair, we are prioritizing strategic partnerships with key sectors of our society. To this end, we have begun engagements with ESCOM Foundation, Seriti Institute, among others. We're also in consultation with key sector departments on the implementation of the sector strategy for the employment of social service practitioners. Honorable Chairperson, before I conclude, allow me to reflect on some of the commitments we made to this august House and achievements. We're on track, and I'm pleased to report that the new Department of Social Development organizational structure has been approved by the Department of Public Service and Administration, and it is being implemented concurrently with the change management and transformation agenda. We have filled 5 critical posts of SASSA regional executive managers in the Free State, Limpopo, Mpumalanga, Northern Cape, and Western Cape. We're on course to fill the same posts for Gauteng and Northwest in the second quarter of this financial year. On a related matter, we have recently finalized the process for the appointment of the Executive Director, Inspectorate for Social Assistance, which will soon be tabled to Cabinet for approval. The intensified grant review process has saved the national fiscus over 1 billion rand, which has been redirected to fund other national priorities. As of September 2025, SASSA has successfully rolled out the beneficiary biometric system across all its 432 offices. At the end of the previous financial year, approximately 1 million new grant applications had been enrolled on the system. SASSA has expanded the rollout of the queue management system from 113 to 378 SASSA offices. The system has helped us to reduce long queues at SASSA pay points nationwide. Honorable Chairperson, numbers do not lie. The impact we have had to speak for itself. When it comes to social grants, our return on investment is particularly visible. For instance, on the impact of child support grant, we need look no further than the educational journey and achievements of its beneficiaries. Of the 927,143 matric learners who wrote their National Senior Certificate examination in 2025, 68.5% were social grant beneficiaries. The results showed that 71% of social grant beneficiaries who wrote grade 12 and passes that enable access to further education and training. Many of them have gone on to become the first in their families to access colleges and universities through NSFAS, precisely because SASSA beneficiaries who are admitted to universities and colleges automatically qualify for fully subsidized higher education and training through NSFAS. Honorable Chair, I wish to end by expressing my most sincere gratitude to the Honorable Chair and Honorable members of the Select Committee for your anticipated cooperation and guidance. I look forward to working with Select Committee in the coming weeks and months to achieve the annual performance plans outlined in this budget. Special thanks to the Deputy Minister, Honorable Hanif Hendricks, MECs across 9 provinces and their staff, the Acting Director General Advocate Gugulethu Timane and the entire DSD team, the CEO of SASSA, Mr. Themba Matlo and SASSA team, the Acting CEO of NDA, Ms. Ramhupa and the NDA team, and all our stakeholders for their warm welcome I received to the DSD portfolio. Honorable House Chairperson and members, it is my singular honor to table budget vote 19 of the Department of Social Development for your support. I thank you very much.
Thank you very much, Honorable Chikunga. You've done very well in this short time that you've been with the department. Thank you very much for your presentation of your budget. Honorable delegates, we now move on to the chairperson of the Select Committee on Social Services, Honorable Finis, for 15 minutes.
Honorable Deputy Chair, members of the National Council of Provinces, distinguished guests, comrades, ladies and gentlemen, I stand before you today as the chairperson of the Select Committee on Social Services to support the budget vote for the Department of Social Development. This is not merely a bureaucratic exercise. This is about the soul of the nation. As we stand at the majestic crossroads of 30 years since the adoption of our revolutionary constitution, let there be no doubt the foundational principles of human dignity, equality, and socio-economic rights are not just words on a page. They are the very fire in our belly, the unwavering bedrock of our developmental ambitions. These ambitions are woven into the very fabric of the national democratic society we are so passionately building. Today, as we deliberate on this crucial budget, it is imperative that we cast our minds back, not just 30 years, but further, into the dark times of the apartheid system. For too long, our people suffered under a social system meticulously designed for oppression, segregation, and the systematic denial of human dignity. Let us be clear. The social system of apartheid was not merely flawed. It was a construct of injustice, a deliberate weaponization of social services to entrench racial hierarchy and subjugation. Under apartheid, social services were fragmented, discriminatory, and very unequal. Black South Africans, particularly African people, were deliberately excluded from mainstream social welfare provisions. Their needs were relegated to underfunded, poorly administrated Bantu departments or entirely ignored. Where services existed, they were vastly inferior, inadequate housing, non-existing healthcare in many areas, education designed to prepare one for servitude and welfare grants that were a pittance compared to what was begrudgingly offered to white citizens. The very concept of social security for the majority was a cruel joke, replaced by forced removals, influx control laws, and the deliberate destruction of family units and community bonds. The injustices were legion: racial segregation and disparity. Social grants, pensions, and disability benefits were determined by race, with white citizens receiving significantly higher amounts than their black counterparts. This was not just disparity, it was a blatant assertion of racial superiority and economic subjugation. Geographic disenfranchisement, the creation of Bantustans and townships meant that the majority of people were deliberately placed in areas starved of infrastructure, health facilities, schools, and any semblance of social support. Access to social workers, clinics, or even clean water was a privilege, not a right. Deliberate underdevelopment. Education of black children was deliberately inferior, designed to limit their potential and perpetuate a cycle of poverty and dependence. That was not an oversight. It was a policy of grand-scale social engineering to maintain a cheap labor force. Family disintegration. Laws like the Group Areas Act and past laws tore families apart, forcibly removing people from their homes and communities, eroding the very fabric of social cohesion and support networks. Exclusion from economic opportunity. The entire economic system was structured to deny Black people meaningful economic participation, leading to widespread poverty, malnutrition, and a dire lack of opportunities, which such social services were then conveniently absent to address. Contrast to this, honorable members, with the social system we are building today, our constitution born from the ashes of apartheid is the antithesis of the brutal past. It enshrines human dignity, equality, and the right to social security for all. The Department of Social Development, under the guidance of the ANC, is mandated to dismantle the vestiges of the oppression system and build a new, inclusive, and caring society. Our current social system is founded on the principle of universal access and non-discrimination. We have a comprehensive social grant system providing a lifeline to millions of our vulnerable citizens, the elderly, people with disabilities, and children. Through grants like the old age pension, disability grant, and the child support grant. These grants, while facing budgetary constraints, are a testament to our commitment to poverty alleviation and social protection, reaching individuals previously denied any meaningful support. Integrated community development. Our focus on community participation, scaling up NPOs and funding CSOs is a direct response to the apartheid strategy of disempowering communities. We empower local structures to identify and address these own needs, fostering self-reliance and local ownership. Child protection services, the very idea of extracting children from the streets and providing foster care and care dependency grants is a radical departure from apartheid's neglect and dehumanization of Black children. We are building systems to ensure every child has a safe, nurturing environment. Addressing social ills with Ubuntu. Our commitment to rooting our social ills and building safer communities is steeped in Ubuntu. This is a rejection of the apartheid state's use of violence and division, replaced by the vision of mutual respect, healing, and collective well-being. People-centered social security. We are striving for a social security system that is not just a safety net, but a trampoline providing dignity and pathways to economic inclusion for all. This directly counters apartheid's designed to exclude and marginalize. Yes, honorable members, we still face immense challenges. The structural inequalities forged by the apartheid run deep and persist, like I have just experienced outside after my health budget speech by Honorable Badenhorst. For calling his name in my speech, I have to do it again. According to him, I cannot write my own speech because I'm not white. That is how our people were bullied and humiliated during apartheid, and others are still doing it today, like Honorable Badenhorst. Poverty, unemployment, and inequality are not easily undone. But the fundamental difference is our intent, our mandate, and our constitutional commitment. We are building brick by painful brick, a social system rooted in justice, compassion, and the unwavering belief in the inherent worth of every South African, regardless of race, creed, or background. We are actively reversing the legacy of apartheid, not through vengeance, but through justice and development. This budget is not just numbers. It's our commitment to continue this yet noble journey. It is our promise to those who suffered under apartheid that the struggle was not in vain, and that we are building the society they dreamed of. I urge all members of this August House, with the weight of our history and the hope of our future, to support this budget vote with conviction and pride. I thank you, Deputy Chair.
Thank you very much, Honorable Finis. The next person to participate is the Honorable Du Plessis for 7 minutes.
Honourable Chair, Acting Minister, members and fellow South Africans, South Africa is at a crossroads. We can continue on the current path of stagnation and squandered potential, or embrace this new beginning within the department brought about by the firing of ex-Minister Tulashe, who has held this department back. And we can choose a course that restores dignity, expands opportunities, and protects the most vulnerable. Today's social development budget and the implementation thereof should be the instrument of that choice. And it should move from barely patching poverty to building pathways out of poverty. There is no doubt that social protection is a constitutional imperative and a moral duty. The child support grant, the old age pension, and the disability grant keep millions from destitution. But this duty has often been misused as a license to obfuscate fraud, corruption, and plain complacency. When this happens, this House must insist on reform and not political rhetoric. 3 principles should guide the budget. The first is dignity through reliability. Pay the correct grant to the correct person on time, every time. The second is value for money. Every rand must reach a person in need, not a middleman, not a corrupt official, not a politician, and not a loan shark. The third is mobility. Social protection must be a springboard into education, work, and enterprise. It must not perpetuate state dependency. Further, on reliability, the DA welcomes steps towards end-to-end digitization at SASSA, but targets must be binding. We propose on value for money that we cannot tolerate any leakage while children are stunted and mothers skip meals. We urge zero-based budgeting for SASSA administration over 2 years to strip out legal inefficiencies. Aggressive recovery of irregular expenditure on personal consequence management with personal consequence managements. It means if you signed for it unlawfully, you pay back the money. On mobility, Our grants should be paired with services that unlock human potential. Indexing the child support grant to at least the food poverty line over the MTEF and coupling this with universal early childhood development vouchers redeemable at accredited centres, because a child's prospects should not depend on a parent's proximity to an official or a politician. Converting the social relief of distress grant into a work-seeking support instrument where recipients who opt in receive job matching, transport stipends for interviews like My City Bus does, access to short skills training and recognition of prior learning. Poverty relief must be a bridge into a real livelihood. Also, streamline application processes by establishing an initial screening process that can identify those who do not qualify for disability, specific grants to reduce the burden on the main assessment. The other two issues, food security. Food security remains a national emergency. Instead of politically connected food parcels that arrive late and a little light, we support scaling community kitchens and food hubs through transparent grants to NGOs with proven delivery and audited quarterly. Removing VAT from more nutritious staples identified by an independent panel is of the utmost importance. Closing wasteful programs is important because we need to fund by this and not by increasing the tax burden on working families. Another crisis is gender-based violence. And it is not just a department crisis, it is a criminal crisis. But within this department, we need to expand the network of social workers and auxiliary workers with performance contracts focused on the case resolution and survivor support. In addition to that, we need to ensure that the National Register for Sex Offenders is integrated into hiring for all child-centered services, public and private. To finance this agenda without reckless borrowing, we propose reprioritization. Every inefficiency is a meal stolen from a child, a shelter bed denied to a survivor. Good policy is not partisan, it is practical. Where the department meets measurable standards, we will support it. Where it falls short, we will hold it to account. An example of this is the funds that the department misappropriated in the last budget cycle from the Central Drug Agency, or that it is almost impossible to get hold of a social worker to assist the vulnerable in Gauteng. I have tried many times. In the Western Cape, we have shown that transparent procurement, community partnership, and relentless data tracking improve outcomes. South Africans do not want ideology. They want systems that work. The DA stands ready to support a social development budget that protects dignity today and expands possibilities tomorrow. One that turns sense into results and compassion into capability. Let us choose the course that restores dignity together and measure ourselves not by our speeches, but by the lives we have made better, the lives of the most vulnerable in South Africa. I thank you.
Thank you, Honourable du Plessis. The next to participate in this debate is the Honourable MEC from the Eastern Cape, Honourable Fanta, who is on the virtual platform. You have 10 minutes.
Thank you, Chair, and good evening. Can
Good
I
evening.
switch off my... I have a problem of network. Can I switch off my video?
Yes, you can switch off. Thank you. Continue.
Thank you. Honorable Chairperson of NSOP and Deputy Chairperson of NSOP, Honorable Acting Minister for Social Development, Deputy Minister of Social Development, honorable members, distinguished guests, ladies and gentlemen, nabo bonke ababukele kumakhasi onxibelelwano. I want to greet you all in the wonderful name of Jesus. Today, we stand at the intersection of history, hope, and responsibility. We gather in this house not merely to debate a budget, but to reaffirm our collective commitment to ideals that have shaped our nation and continue to inspire our future. We gather at a time when South Africa is called upon to remember where we come from, celebrate how far we have traveled, and recommit ourselves in the work that still lies ahead. This year, our nation commemorates a defining milestone in our democratic journey, the 72 years of the Women's Charter, the 70 years anniversary of the historic Women's March of 1956, the 50th anniversary of the Soweto Uprising of 1976, 30 years of our democratic constitution. These are not merely dates on a calendar. They are powerful reminders of the resilience of our people, the courage of ordinary South Africans, and enduring triumph of hope over adversity. They carried a vision of a society where every woman would be valued, respected, and empowered. Their footsteps continue to echo across the decades, reminding us that social progress is born from courage and sustained through collective action. 30 years into our constitutional democracy, we continue to draw strength from one of the most progressive constitutions in the world. Our constitution is more than a legal document. It is a promise. It is a promise that every person matters, a promise that human dignity is not negotiable, a promise that government must work tirelessly to protect the vulnerable, advance equality, and create opportunities for all. For those of us entrusted with the responsibility of social development, that constitutional promise is our daily mandate. It compels us to stand with the poor, the unemployed, the vulnerable, the elderly, persons with disabilities, women facing violence, children requiring protection, and young people searching for opportunities. Honorable Chairperson, as we gather today, Youth Month, we are also marketing the 50th anniversary for the Soweto Uprising. The youth of 1976 changed the course of our nation history. Their struggle was untimely about opportunity. It was about demanding future where young people can learn, grow, lead, and realize their full potential. Today, as we honor their sacrifice, we must ask ourselves whether we're doing enough to ensure that the youth for 2026 inherit the future for which the youth of 1976 fought for. The challenges confronting many young people today are different, but not less urgent. Unemployment, substance abuse, mental health care challenges, gender-based violence, and poverty continue to threaten the aspiration of millions of young South Africans and women. The responsibility of social development is therefore not only to respond to social challenges, but to ignite hope, unlock potential, and create pathways towards opportunities. The allocation of 12.6 million towards women, youth, and youth development is a bold investment in architects of our future, a commitment to empower young minds, uplift women, break cycles of poverty and inclusion, and build Eastern Cape where opportunity is not privilege for few, but a reality for all. Honorable members, this debate also takes place during Child Protection Month, a period that reminds us that the future of our nation is written in the lives of our children. The Eastern Cape is honored to serve as a national host province for the official closure of the Child Protection Month. We accept this responsibility and we are humbled. The measure of our democracy is reflected in how we treat our children. A society that protects its children, protects its future. A society that invests in its children, invests in its own prosperity. 149.4 million has been budgeted for by the Department of Eastern Cape to provide quality protection and family services. Honorable Chairperson, the priorities outlined by Acting Minister in the Budget Vote 19 resonate strongly with the developmental vision of the Eastern Cape Social Development. The DSD budget vote for 2026-27 financial year tabled within a significant year of reflection as we honor 3 decades of constitutional democracy. Section 27, 28 of Constitution remain binding commitments that must realize through action, policy, and budget choices. A budget of 3.2 million 2.2 billion was allocated for Department of Social Development for 2020 financial year. Our provincial policy priorities recognize that social development remains central in transformation of society. We remain committed to strengthening social welfare services, children and families, development, protecting vulnerable groups, combating gender-based violence and femicide, empowering youth, supporting people with disabilities, and building stronger families and communities. We are humbled and we're happy when the president pronounced that it has been declared as a disaster. You know, Eastern Cape, it's a province that has got high rate of gender-based violence. We understand that economic growth and social development are not competing priorities. They are mutually reinforcing pillars of capable, caring, and inclusive state. It is this reason that Eastern Cape Social Development has been allocated 50 million towards the employment of social workers and provision of essential tools of trade. This investment is declaring of intent. It is a recognition that social workers remain among the most important nation builders in our society. They are the professionals who work alongside families in crisis, protectors of vulnerable children, advocates of the voiceless, and the bridge between despair and hope. At the time when communities are facing complex social challenges, this investment strengthens our ability to intervene early, protect the vulnerable, and restore dignity where it has been eroded. The allocation of 50 million is therefore not merely a budgetary provision, it is an investment in the people. In addition, the 14.6 million has been set aside to give effect to the professionalization enhancement of technical skills for social service practitioners. It is an investment in the stronger families. It is an investment in safer communities. It is an investment in more caring society. Honourable members, we are committed to promoting access to safe and hygienic sanitary dignity to indigent young girls in the province. 204 to 157,000 young girls will benefit from this program in quintile 1 to 3 to a tune of 46 million. Gender-based violence and femicide remains one of the greatest challenges facing our nation, leaving a trail of trauma, lost and broken communities. It is a nation disaster that demands a decisive and compassionate response from all sectors of society. In the Eastern Cape, the Department of Social Development has allocated 36.1 million to strengthen GBV response services, ensuring that survivors receive the care, support, protection, and healing they need. This investment reaffirms our commitment to restoring dignity, survivors, supporting their recovery, and creating a safer communities where women, children, and vulnerable persons can live free from violence and fear. As Eastern Cape, we remain committed to this noble mission and to working alongside the National Department of Social Development to build a society in which every person is valued, included, and empowered. It is therefore with this conviction, confidence, and optimism that Eastern Cape pledges the full support of this budget vote 19. We support Minister for bringing us this wonderful budget, and we're hoping to work hard to change the lives of our people. I thank you, Chairperson.
Thank you very much, Honorable MEC. We now move on to the next MEC, also on the virtual platform from Gauteng, who has 10 minutes.
Thank you, Honorable Chair. Chair, with your permission, if you allow me that I switch off my camera because I have connectivity problems where I'm sitting.
Can you switch it on just for a few seconds so that we see who it is?
Yes, Chair, I'm here, Chair. Thank you.
All right, thank you very much. Thank you.
Chair. Thanks, Chair. Chair, let me start by greeting yourself, then greet the honorable members of the House and
Honorable MEC, I think you have muted yourself. We can't hear you now. Honorable MEC, can you hear me? I think we have.
for the Chair. I'm with you, Chair. Sorry, yeah.
Oh, okay, we can hear you now.
Let
Please
me
go
greet
ahead.
you, Chair. Great Honorable Acting Minister of Social Development, Ms. Chikunga, Deputy Minister, Chairperson of the Select Committee, Honorable Members, fellow MECs, distinguished guests. The Gauteng Provincial Government fully supports the budget vote as presented by the Honorable Acting Minister for Social Development. We do so because this is people's budget. It is a budget for social transformation, sustainability, and empowerment. It is a budget that seeks to restore dignity to the vulnerable, strengthen the social fabric of our communities, and advance the constitutional promise of a caring and developmental state. It provides government with the necessary instrument to intensify the fight against gender-based violence and femicide, strengthen child protection, combat human trafficking, and build resilient communities that are capable of overcoming poverty, inequality, and social exclusion. It is as we debate this budget, we do so during the Child Protection Week, a period that reminds us of a collective responsibility to safeguard the rights, dignity, and future of every child in our country. We do so while continuing to commemorate the 30th anniversary of our democratic constitution, a document that enshrined social justice as a cornerstone of our democracy. We also enter Youth Month as we prepare to commemorate the 50th anniversary of the June 16 uprising, honoring a generation of young people who sacrificed for freedom and whose legacy compels us to ensure that today's youth enjoy meaningful opportunities for development, empowerment, and participation in society. The great revolutionary thinker Amina Kalbar once reminded us that, I'll open quote, people are not fighting for ideas in anyone's head. They are fighting to win the material benefits, to live better and in peace, to see their lives go forward, and to guarantee the future of their children. Close quote. It is precisely because of this understanding that we support this budget. Social development is not an abstract concept. It is about changing the material conditions. It is about ensuring that children are protected, that women are safe, that young people are empowered, that older persons live with dignity, and that vulnerable households receive the support they need to improve their lives. Budgets are therefore not merely financial statements, they are instruments of social justice and vehicles for the realization of the constitutional rights. In Gauteng, we are pleased to report that our commitment to build a capable and a caring developmental state is beginning to yield measurable results. We're happy to announce that in this house that we have surpassed 80% of our first quarter target for service level agreement payments to non-profit organizations. This achievement reflects our determination to strengthen partnership with all civil society and ensure that organizations delivering critical services to communities receive funding timeously. We understand that social transformation cannot be achieved by government alone, and that the NPO sector remains one of our most important partners in delivering services to the people of Gauteng. The Gauteng Department of Social Development enters into 2026-27 financial year with a budget allocation of 5.6 billion. While this represents a modest increase, it reflects government's commitment to protecting social services even under difficult fiscal conditions. Importantly, the budget continues to prioritize frontline services that directly impact communities, particularly programs supporting children, families, victims of violence, older persons, persons with disabilities, and vulnerable households. Significant portion of the budget continues to be directed towards social welfare services, child protection interventions, and family strengthening programs. The Child and Families Program remains the largest component of our budget, accounting for more than 37% of total departmental expenditure. This demonstrates our unwavering commitment to protect children and ensure that every child has the opportunity to grow in a safe and nurturing environment. The budget further strengthens intervention that are aimed at addressing social ills that continue to affect many of our communities. Throughout the restoration service programs, resources have been directed towards substance abuse prevention, rehabilitation services, crime prevention, initiatives and support for victims of violence. These interventions are critical as we confront the complex social challenges associated with the rapid urbanization, unemployment, poverty, and inequality. Honorable members, one of the most indicators of a developmental state is its ability to work effectively with community-based organizations. In this regard, Gauteng intends to increase funding allocated to non-profit institutions. Nearly 2 billion has been allocated towards supporting NPOs across the province. These organizations serve as the backbone of social service, delivering and enabling government to reach communities where the need is the greatest. Through these partnerships, we continue to extend services to children, older persons, persons with disabilities, victims of abuse, and vulnerable families. We are particularly encouraged by the continued support for the expanded Public Works Program integrated grant, which has increased to 13.7 million in our province. This investment will create over 400 job opportunities while simultaneously strengthening the capacity of practitioners operating within social development sector. In a province facing high levels of unemployment, particularly among young people and women, even employment opportunity created contributes towards building stronger and more resilient communities. We are not just speaking about job creation, we are implementing it. We are also pleased that the His Excellency President Cyril Ramaphosa, in his State of the Nation address, he announced that the South African Police Service will also employ social workers to ensure integrated service delivery to our people. Chairperson, we are advancing a national democratic revolution. Our commitment to dignity restoration remains visible throughout the programs that directly address the lived realities of vulnerable households. Significant resources continue to be invested in school uniform, dignity packs, and food support programs. These interventions are not acts of charity. They are investment in human dignity. They ensure that children can attend to school with confidence, that young women can participate fully in society, and that vulnerable families receive support during periods of hardship. We also recognize that social development requires infrastructure that is responsive, accessible, and fit for purpose. Gauteng continue to invest in upgrading, rehabilitating, and maintaining social development facilities. This includes investment in rehabilitation centers, integrated social facilities, child and youth care centers, homeless shelters, and secure care facilities. This investment will strengthen the capacity of the state to provide quality services while protecting public assets for future generations. The infrastructure program demonstrates a deliberate shift towards maintaining and improving existing facilities while strategically expanding access where necessary. This approach reflects prudent governance and responsible stewardship of public resources. It ensures that facilities serving vulnerable communities remain functional, remain safe and compliant with established norms and standards. Honorable Chair, the social challenges facing our nation require a united response. Gender-based violence and femicide continue to threaten the safety and dignity of women and children. Substance abuse continue to destroy families and communities. Human trafficking remains a serious threat for vulnerable persons. Child neglect and abuse continue to undermine many young South Africans. The budget before us then strengthened government's ability to confront these challenges through prevention, protection, and empowerment programs. As Gauteng, we remain committed to support the national social development agenda. We recognize that our province carries unique responsibilities due to its position as the economic hub of the country and a
Thank you very
destination for
much.
many seeking
Thank you, Honorable
opportunities.
MEC. Your
Thank
time
you.
has expired.
Thank you, Honorable Chair.
Thank you. Honorable delegates, we now move on to the next presenter in this debate, and that's the Honorable Nomayo, also on the virtual platform for 8 minutes. Honorable Nomayo, are you on the virtual platform?
Yes, Chairperson.
Thank you. You have 8 minutes. Please go ahead.
Honorable Chairperson, Honorable Deputy Acting Minister, Honorable Minister, Honorable members of the NCOP, fellow South Africans. Today we rise on behalf of millions of poor, unemployed, vulnerable and forgotten South Africans who depend on the Department of Social Development for survival, dignity and hope. As Umkhonto Wesizwe, we reject budget vote 19. We reject this budget not because our people do not deserve social support, but because this budget fails to respond decisively to the social collapse taking place in our communities. It is a budget for statistics without transformation, promises without agency, and allocations without meaningful impact on the ground. Honorable Chairperson, South Africa is facing a deepening social crisis. Poverty is expanding, hunger is growing, youth unemployment continues to destroy families and communities. Gender-based violence and femicide are rising. Drug and alcohol abuse are consuming our young people. Child-headed households continue to suffer in silence. Elderly citizens are neglected. Persons living with disabilities remain excluded from meaningful opportunities. Yet, government continues to present budgets that merely maintain suffering instead of ending it. Honorable Chairperson, we acknowledge the importance of social grants in keeping millions of households alive. However, grants alone cannot become the permanent economic policy of government. Social relief without economic empowerment becomes a cycle of dependency. Our people do not want to survive forever on grants. They want jobs, they want land, they want skills, they want opportunities, they want dignity. But this budget does not present a radical plan to move beneficiaries from dependency into sustainable economic participation. Honorable Chairperson, one of the biggest failures of this department is the handling of the social relief of distress grant. Millions of unemployed young people continue to experience delays, unfair rejections, system failures, and uncertainty. Young people stand in long queues with no answers. Appeals take months, corruption and allegations continue to emerge. Fraud syndicates continue to steal from the poor while government systems remain weak. How do we speak of caring for the poor while corruption continues to eat resources meant for the hungry families? As the Umkhonto Wesizwe, we demand stronger accountability mechanisms with SASSA and the entire Department of Social Development. We are equally concerned about the collapse of community-based social services. Across all provinces, non-profit organizations and community care centers are underfunded and neglected despite carrying the burden of social support in poor communities. Government continues to praise social workers in speeches while failing to provide the resources they need. This budget does not adequately strengthen the front line of social development. Honorable Chairperson and honorable members, the crisis of gender-based violence and femicide requires a national emergency response. Women and children continue to live under fear in their own homes and communities. Yet, year after year, we receive speeches of concern without visible improvement in protection systems, shelters, counseling services, and prevention programs. You ask yourself, how many more women must die before government moves beyond slogans and launches decisive interventions? A caring state cannot exist while disabled citizens remain invisible in development planning. Honorable Chairperson, we must also speak honestly about substance abuse and mental health. Drugs are destroying communities in both rural and urban areas. Young people are losing direction, families are collapsing, and crime is increasing. But rehabilitation centers are insufficient. Prevention programs are weak, community awareness programs are inconsistent, mental health services remain neglected despite rising depression, trauma, and hopelessness among citizens. We need a department that works closely with agriculture, education, health, youth development, and local government to build a sustaining communities. We need community food production programs. We need youth cooperatives. We need rehabilitation linked to skills development. We need support for ex-convict integration. We need investment in early childhood development. We need stronger rural development programs. We need social protection that restores dignity and independence. This budget fails to inspire confidence that the Department of Social Development is ready to lead a social recovery program for our nation. Therefore, as Umkhonto Wesizwe Party in this House, we reject the budget vote 19. We reject it because it fails the unemployed youth in Bushbuck Ridge. We reject it because it fails vulnerable women and children eLikwa, eMalahleni. We reject it because it fails community organization Nkomazi, Kamhlushwa. We reject it because it fails social workers, Mbombela, Msholozi, Matsafeni. We reject it because it fails rural communities, Etabatweu, Graskop, Esabi. We also reject it because it fails the poor, Mkondo, Piet Retief, and many other areas in our province. And above all, we reject it because it does not offer hope for real social and economic transformation. South Africa deserves a developmental state that places people before bureaucracy, dignity before statistics, and justice before political convenience.
Thank you very much, Honourable Ngulamayo. And we move on with the debate, ladies and gentlemen. The next speaker is Mpumalanga's MEC for Social Development. That's the Honourable Hlophe, with 10 minutes. Honourable Hlophe.
Thank you very much, House Chair. I request to mute my video.
Yes, you can turn it off. Thank you, Honourable Member.
Thank you very much, House Chair. Let me greet the acting minister, the deputy minister, the MECs present here, honourable members, SALGA representative, and all our distinguished guests. House Chair, it is an honor to participate in this policy debate on budget vote 19 on behalf of people of Mpumalanga. As we debate this budget, House Chair, we do so during the period of significant economic pressure facing many South African households, rising living costs, unemployment, and inequality continue to place immense strain on families. It is precisely during such periods that the work of social development becomes even more important. Social development is not merely a welfare function, it is an instrument of social justice, human dignity, and inclusive development. We therefore welcome budget vote 19 and allocation of 302 billion towards strengthening South Africa's social protection system. This allocation demonstrates government unwavering commitment to protect the most vulnerable members of society while creating pathways towards sustainable livelihoods. House Chair, this year marks an important milestone as South Africa celebrates 20 years of South African social security agents. For 2 decades, SASSA has stood as one of the most successful instruments of social protection, as alluded by the acting minister, on the African continent. Millions of older persons with disability, contrary to what Honorable Ngumai was saying, children in vulnerable households have experienced dignity through the social grant system. We therefore welcome the continued support for social assistance program, including the extension of the social relief of distress grant. For millions of unemployed South Africans, this intervention remains a critical lifeline while government continues to pursue long-term economic solutions. House Chair, as in Mpumalanga, we also welcome national efforts aimed at modernizing SASSA system and improving service delivery. The rollout of biometric system, queue management system, and enhanced cyber security measures will improve efficiency, strengthen integrity, and ensure that beneficiaries receive services in a dignified manner. This intervention further demonstrates government commitment to building a capable, ethical, and a developmental state. The priorities outlined in this budget are priorities that resonates strongly with a work currently underway in Mpumalanga. During the 25-26 financial year, despite fiscal constraints, the Mpumalanga Department of Social Development continued to expand and strengthen services aimed at building resilient communities and improving living standards of our people through our community development program for self-sustainability. Our Community Nutrition and Development Center continue to provide food security support while also empowering beneficiaries through livelihoods initiative. These centers remain important platforms for combating hunger, malnutrition, and poverty within communities. Our youth development programs continue to create opportunities for skills development, entrepreneurship, and economic participation through facilities such as Vuguzake Youth Development Center and other community-based initiatives. Young people are receiving support that enables them to become active participants in the economy. Chairperson, we are particularly proud of our efforts aimed at empowering women and supporting vulnerable households. Through partnership with funded organizations and community programs, more than 2,400 women have participated in empowerment initiatives that seek to promote self-reliance and economic independence. This intervention contributes directly to the fight against poverty while advancing gender equity and women's economic participation. House Chair, in terms of gender-based violence and femicide, we continue to be one of the greatest threats, which is continue to be one of the greatest threats facing our society. We further welcome the continued strengthening of the GPV Center and support governance efforts to ensure that no district remain without access to shelter services. We support the national efforts to expand shelter services, psychosocial support, and victim empowerment programs in Mpumalanga. We continue to strengthen partnership with civil society organizations, victim support centers, and community structures to ensure that survivors receive the assistance they require. Chairperson, the Minister correctly emphasized the importance of linking social protection beneficiaries to sustainable livelihood. In Mpumalanga, we fully support this approach. Social protection must provide relief through various community development programs, skills development intervention, and support to income generating projects. We continue to build pathways out of poverty. We particularly welcome support provided through the National Development Agency. Community organizations remain essential partners in service delivery and development through community-owned enterprises, youth employment initiative, and support to civil society organizations. Communities are being empowered to become active participants in their own development. Honorable Chair, good governance remains fundamentally to effective service delivery. During the past financial year, the Mpumalanga Department of Social Development made significant progress in strengthening governance, accountability, and financial management. We further acknowledge the contribution made by the social workers, community development practitioners, child and youth care workers, caregivers, and all frontline officials who continue to serve our communities under challenging circumstances. These officials remain a backbone of social services delivery every day. They enter communities, support vulnerable families, protect children, respond to cases of abuse, and provide hope to those facing difficulties. Their work often goes unseen, yet it remains essential to the well-being of our society. As we commence the 26-27 financial year, we remain committed to drawing from the wisdom of oversight structures, strengthening partnership with communities, and ensuring that every program contributes towards building resilient communities and improving quality of life. The people of Mpumalanga House Chair support Budget Vote 19 because it speaks directly to the aspiration of our people for dignity, opportunity, and social justice. As the sign rises in Mpumalanga, siyavuka sibereke. Ngiyathokoza mhlali ngaphambili.
Thank you very much, Honorable Klope. The next speaker, once again on the virtual platform, we have the Deputy Minister for Social Services, is the Honorable Deputy Minister Social Development, I presume that should say, is the Honorable Hendricks. Honorable Hendricks.
Thank you very much, House Chair. With your permission, House Chair, I'd like to switch off my video. House Chairperson, Honorable Acting Minister of Social Development, Chairperson and members of the Select Committee on Social
Deputy Minister. Deputy Minister, sorry, I beg your pardon. If you can show us your face first, please, and we can see you, and then we can move on, and you will then be welcome to turn your video off for once you've done that. Thank you.
I hope my face is clear, House Chair.
It seems you need to speak to Minister Ramakgopa for some assistance there, but thank you, DM. You can continue.
Thank you very much, House Chair. I'm so grateful. House Chairperson, Honorable Acting Minister of Social Development, Chairperson and members of the Select Committee on Social Services, MECs responsible for social development here present, distinguished guests, ladies and gentlemen, I would like to thank the Deputy Chairperson of the NCOP for recognizing that the Acting Minister of Social Development hit the road running. In fact, 12 hours after her appointment, she was in Vrygrond near Muizenberg to lead a program to create pathways for young people who are presently on social grants, a pathway to jobs and dividends. Also like to thank the MECs for their support of the newly appointed acting minister. Just imagine, House Chair, after hitting the road running, what our acting minister can do with 302 billion rand. And I hope that this House will support the budget. I spent the day in a place called Sesego village in the Raymond Mhlaba municipality. He was the first premier of the Eastern Cape, and all of government was present in a village that no one knew even existed. All of the private sector was there. All the seaters were there. Even the provincial commissioner of police was there. We had all those who count in South Africa present to join the traditional leaders under the leadership of Chief Zulu to start the process so that there is full employment in that village. And as you know, House Chair, most of the learners, nearly 400 of them that were present, the hall was overflowing. Most of them are in receipt of social grants. So we had a career expo, we had the universities there, we had nearly everyone there. So these learners in grade 11 and 10, we're making an early start to make sure that that particular village with this crop of learners that they will have full employment in that village and won't have to rely further on social grant assistance. House Chair, it's a privilege to participate in this important debate on Budget Vote 19 of the Department of Social Development. We do so at a time when millions of South Africans continue to depend on the social wage as a source of dignity, stability, and hope. This budget vote, therefore, speaks directly to the lived realities of our people in villages. And I'm so happy to be in a village delivering my budget contribution. In villages, townships, informal settlements, farms, and cities across all 9 provinces. As a National Council of Provinces, we are uniquely positioned to assess not only what policies are adopted nationally, but how they impact communities on the ground. We heard the MECs talking. We are called upon to ensure that national priorities translate into tangible improvements. The Government of National Unity has identified poverty reduction and addressing the high cost of living as a key priority. These priorities are particularly relevant in provinces where unemployment, inequality, and vulnerability remain deeply entrenched. The Department of Social Development continues to play a central role in advancing these priorities through a combination of social assistance and development social services, the kind of work that we were doing in Sesego village today. This year is particularly significant as we celebrate 20 years of South African Social Security Agency, SASSA. For 2 decades, SASSA has been a critical pillar of our social protection system, ensuring that millions of beneficiaries receive the support they need to survive and participate meaningfully in society. The department's allocation of more than 302 billion demonstrates government's continued commitment to protecting vulnerable citizens during difficult economic times. I remember one of the first speeches His Excellency Cyril Ramaphosa made is that steps will be taken to ensure that every South African has a warm plate of food. The overwhelming share of this budget is directed towards social assistance, recognizing that grants remain one of the most effective tools for reducing poverty, improving household food security, and supporting local economies. House Chair, if people apply for the grants, there is no need to have malnutrition, and there's no need for people to die of starvation. The grants are available from the cradle to the grave. Across our provinces, social grants are often the difference between hunger and survival. Official social assistance reporting shows that the largest concentration of beneficiaries is in KZN, the Eastern Cape, and Limpopo. Gauteng also carries a substantial caseload because of the large population and high levels of urban vulnerability. These grants enable grandparents to care for grandchildren. As we celebrate 20 years of SASSA, we reaffirm our commitment to ensuring that the right grant reaches the right person at the right time. And as SASSA, with its turnaround strategy, SASSA is now capturing the imagination of the nation of the difficult last few years. The National Development Agency remains an important partner in strengthening community-based organizations and supporting initiatives that promote food security, livelihood opportunities, and local economic development. In addition, I have been assigned to 5 critical delegations that I would like to share with you, House Chair. I'm responsible for combating substance abuse, and you've heard that we are now ready to submit the next 5-year drug master plan. We are ready to appoint a new central drug authority, and we are looking forward to implementation because we need to address the skirts of drugs. I joined the Premier of Gauteng in Tembisa in a sports stadium, and a result of the MEC and the Premier and also members of my department, we from the stadium sent 500 young children to beds in drug rehab centers. And that was an amazing achievement and was appreciated by the residents of Tembisa that we managed to find 500 beds. And we could send them straight from the stadium to these beds. I'm also responsible for older persons. I'm looking forward to the publishing of the regulations, which will soon be presented to Cabinet, because just too many of our older persons are being abused by young people. And I'm going all over the country to ask young people to stop this. It's not fair that our older persons should be abused. And we are going to use the provisions of the Older Persons Act, which the President signed, I think, in December, to make sure that they enjoy the rights of that particular Act of Parliament and that we stop the abuse of older persons. At the same time, the development of the National Strategy on Aging for South Africa will provide a comprehensive framework. I invite you, Honourable House Chair, to join the Olympics that we're going to have for elder persons to show that they're doing their best to keep fit. I'm also responsible for HIV/AIDS and community development. As you know, Honourable Chair, I'm the patron of the Men's Parliament, but I've also started a Boys' Parliament, and they met at Stellenbosch University, and they will be meeting in Piketberg next month so that we can hear the voices of our boys. And I would like to reiterate the call. What about our boys? If we can get our boys to play, to understand the challenges we have, we won't have gender-based violence going forward. Working with the men is fine, but we have decided that let us start with the boys. What about the boys? So that they grow up to be exemplary fathers and brothers and men. I'm also responsible for persons with disabilities. I'd like to apologize to the nation that we're still struggling to get the bill approved by Cabinet. It has been sent back. We are redrafting it because Cabinet ministers had other ideas. And we also feel that it's important for persons with disabilities to have their own Act of Parliament, and so that they can play their rightful role in society. However, policy is not enough. Our success will be measured by whether persons with disabilities in every province are able to access services, opportunities, and support without barriers. My personal call is that there should be full employment for people with disabilities and not the present 7 or 8 or 9%. There should be full employment, and the country should be bold enough to put steps in place so there is full employment for people with disabilities. We will continue working with provincial departments and stakeholders. We're having a MINMAC very soon. There was a meet and greet online, but we like to meet with them because our acting minister feels that they are the hub of the department, and we really want to benefit from their expertise. Working together across provinces, the success of Budget Vote 19 ultimately depends on effective implementation across all spheres of government. The National Council of Provinces has an important role to play in strengthening accountability, oversight, and cooperation between national, provincial, and local government. We cannot work in silos, House Chair. As we implement this budget, we must continue sharing best practices across provinces, strengthening institutional capacity. The challenges facing our people may vary from province to province, but our commitment to social justice, human dignity must prevail. In conclusion, budget vote 19 is fundamentally about investing in people. We have an acting minister that is going to make good use of that 302 billion rand that we hope you will approve, House Chair. It is about protecting the vulnerable, strengthening families, empowering communities, and ensuring that no South African is left behind. Together, let us continue working towards a South Africa where dignity is key and is socially, legally protected. I also want to say that we have launched a family strengthening program. When I attended the last cabinet cluster meeting, the Minister of Planning and Monitoring highlighted all the woes that we have with substance abuse, with violence, and we asked her what is the solutions, and they said we must strengthen families. I have pleasure to say that we've launched a family strengthening program developed by UNICEF of the United Nations. It has been launched, and many families are participating in this because we feel by strengthening families, we will be able to reduce the social ills that we have. I thank you very much, Honourable House Chair, and I hope, Honourable House Chair, that all honourable members will support vote 19. Thank you very much.
Thank you very much, Deputy Minister. Honourable delegates taking the debate forward. Still online, though, we have the Economic Freedom Fighters, Honourable Mampuru, with 14 minutes.
Thank you, Chair. Hope I'm visible enough.
Yeah, you're visible on my screen, but not on the main monitor. So if you can just try that again, and then you're welcome to start with your speech, Honourable Member. If you can unmute and go ahead, Honourable Mampuru.
Thank you, Chair. Chairperson, a seasoned Ethiopian author, Ephraim Bin-Hattach, said that the most fundamental duty of any government is to ensure the survival of its citizens. When the state not only abdicates this duty, but actively turns the necessity of life into instruments of control, it shatters the social contract beyond repair. This is exactly what the GNU government is doing. But Chair, firstly, let me indicate that Honorable Mukwili will not understand what I'm talking about because these issues are way beyond his capacity. Unlike when he was presiding over Mogalakwena, which while he was there, Mogalakwena was looted to death like the ANC have been doing everywhere where it's governing. Chairperson, the Department of Social Development is tasked with protecting a country's most vulnerable. It sits at the center of South African constitutional promise of social security, as it is responsible for drafting policy and setting norms, funding non-profit organizations, running child and youth care center, and managing victims empowerment program such as shelters for abused women and children, and addressing issues of substance abuse. Yet, this department struggles to fulfill its constitutional mandate. From administrative crisis and corruption in Gauteng and the Northwest to the lack of planning and capacity in the Eastern Cape, Limpopo and KwaZulu-Natal, this sector is failing to provide a comprehensive safety net which the country desperately required. Honorable Chair, the Department of Social Development is supposed to be a lifeline for our people, but right now it is completely failing the system. The department has been allocated 302 billion, up from the 294 billion in the previous financial year. And on the surface, the allocation reflects a state committed to protecting its poorest citizens. However, a closer look in the budget reveals a deep structural flaws. The department has allocated an overwhelming majority of its budget towards social grants and income support,
providing a critical safety net that shields millions of extreme destitute. However, Chairperson, while social grants keep people from starving, they do not eliminate poverty because 370 grant is simply not enough for our people to live on. This overwhelmingly large portion of the budget also leaves less than 4% of the department resources to fund critical support infrastructure such as child protection, gender-based violence, response centers, substance abuse treatment, and community development project. This is concerning, Chair, for us, as despite being awarded a massive provincial budget in the province of Gauteng, where I'm from, the province of Gauteng Department of Social Development continuously fails to deliver funding to NPO on time, crippling a vital community service. And as a result, the province faces absolute chaos with massive backlog, with organization being left to run essential services without any contract or financial support from the government. And the drug rehabilitation centers, soup kitchens, and orphanage are often left stranded. The administrative crisis is further worsened by a severe underspending of allocated funds, as Gauteng Department often leaves tens of millions of rand unspent across its children and restorative service program. This unspent capital directly translates to thousands of children being denied trauma counseling access to drop-in centers and proper foster care support. And in the city of Tshwane, Chair, where the department is primarily tasked with running the indigent program management section and registering 516,000 households for indigent support, this directive is hindered by an outdated application-based model that sees residents having to travel to municipal offices in time just to prove that they are poor. On top of that, the administration behind the program is a mess, as there is a lack of technology which leads to massive backlog, leaving people waiting for months for approval. There is also not enough workers, and the staff there does not get the right training. The worst part is that while people are stuck waiting for this administrative backlog, the city of Tshwane still continue cutting off their water and electricity instead of acting as a safety net. The whole system has become a bureaucratic roadblock that punishes the poor. And in the Eastern Cape, Chair, the social services are falling apart because the severe rural poverty and red tape. The province continuously struggles to implement the basic food security project, which means the critical feeding programs just aren't working. It's tragic, Chairperson, because so many of our people are going hungry with no proper nutrition intervention plan. The province is also plagued by the chronic shortage of social workers, leading to massive delays in the finalization of child abuse cases. And in many parts of that province, there are no social support system at all. And this department has not been able to open functional gender-based violence centers, which shows a lack of political administrative will. The department offices are also dealing with severe service delivery failures, particularly in Motherwell Sasa branch in Nelson Mandela Bay. Chairperson, at their Motherwell branch in Gqeberha, vulnerable people are forced to queue outside a harsh weather all day without help. This operational breakdown is caused by bad informal management, where staff regularly show up 1 or 2 hours late, delaying opening until 11 o'clock, and taking prolonged breaks throughout the day, with nothing being done to enforce punctuality, cut down long breaks, or make sure that the offices actually open on time. Added to this said state of affairs are the reports of fraud, corruption, irregular expenditure within the provincial department supply chain management across all provinces. The road runs deep that the former minister Sisisi Tolashe was removed from the cabinet last month following irregular appointments and poor performance. The dismissal of Minister Tolashe highlights how public resources are diverted for personal luxury by the very same officials assigned to fight poverty. Chairperson, the EFF rejects this budget of the department that refuses to employ thousands of qualified unemployed social worker graduates for years and thousands of young professionals who studied on state-funded bursaries have been left sitting at home while frontline social worker teams remain completely overwhelmed. The shortage of social workers has led to case backlog for foster care application, leaving orphaned children without legal guardians or financial support. Community shelters for abused women are also collapsing due to the lack of professional staff, and substance abuse rehabilitation centers are practically non-existent in our township. The EFF again demands the immediate permanent employment of all qualified social graduates into a permanent, well-paid public sector position, absorb graduate directly and permanently, eliminate reliance on underfunded NPO, and run social work into an attractive, well-paid career pathway. Leaving qualified professionals unemployed while communities lack basic care is a sign of poor governance. Back up all your digital platform with fully operational, decentralized physical services center and mobile units that provide immediate, dignified assistance in our local language. Provide automated cross-departmental data sharing where anyone registered with SASSA grant is automatically enrolled for free municipal water and electricity. Deal decisively with corruption. For when your officials steal money from social welfare budget, they are taking food directly out of the mouth of the hungry children. Do away with culture of nepotism and outsourcing. And lastly, Chair, insource all departmental service and blacklisted corrupt service providers and criminally prosecute any official who mismanage welfare funds. Until that is done, the EFF will reject this budget. And as I said, Chair, Mr. Honorable Mukwele must know that the EFF is not here to massage his ego. We are neither here as proxies of the ANC, and never will we be told by him or his GNU partners of the DA on how we must run our issues. Ntate Mukwele, tsamaya o lokishe mathata a o a dirilego kwa mogala kwena a metsi le batho ba o hiriwa go se molaong a o le wena o tsebang gore e beele diphoso mme o tlogele EFF e rie dilo tša yona ka tsela ya yona o lebagane le mathata a lena le president ya go uta tšhalete ka fase ga materase. Ke a leboga, Chair. I thank you.
Thank you, Honorable Mampuru. You will note that Honorable Mukwele, I think, is wearing your tie today. Honorable delegates, we move on with the debate, and I'm quite relieved to say that the next speaker is in the chamber. They have the correct bandwidth, and it's the Honorable Sibande for the African National Congress.
Thank you. Honorable Chairperson, Honorable Acting Minister and Deputy, Honorable members, compatriots and fellow South Africans. The African National Congress
rises in support of budget policy debate vote 19 because it speaks direct to the soul of our democratic mission. Building a caring society rooted in human dignity, solidarity, and social justice. This budget is not merely a financial instrument. It is an expression of the values that have guided our liberation movement for more than a century. The values of Ubuntu, compassion, equality, and collective advancement. Chairperson, allow me, I wanted to dedicate my debate to the youth of the 70s and 80s, in particular in Mpumalanga. Comrade Nef Manana, the late Nef Manana, unfortunately he's no more. May his soul rest in peace. And the comrade Johannes Kashabang, who stayed long time in death row, waiting to be hanged, like Solomon Mahlang. Because of the impact which was played by the ANC internal the country and outside the country, it made them to be survive, and their conviction was changed to life sentence in the Robben Island. Chairperson, my debate is grounded on the theme of advancing the social system enriched in Ubuntu, epistemology, and sustainable pathway for beneficiaries. This must be served as the reminder to us that the government must never become detached from the lives, the realities of the people. Ubuntu teaches us that umuntu ngumuntu ngabantu, which is loosely translated as, open quote, I am because of others, close quote. This philosophy remains a central pillar of to the African National Congress vision of the developmental state that leaves no family abandoned to hunger, poverty, violence, or hopeless. Honorable Chairperson, in the 2026 State of the Nation address, President Cyril Ramaphosa reaffirmed the government commitment to strengthening the social wage, protecting vulnerable households, and ensuring that economic recovery reaches the poor and working class. These commitments are reflected in the 2026 and to 2027 budget in the Department of Social Development, which continue to allocate the largest share of expenditure towards social assistance and welfare protection. Over the medium-term expenditure framework, the government has maintained significant allocation towards social grant, child protection services, gender-based violence interventions, substance abuse program, and community development initiatives. This demonstrates a government that understands the social development is not separate from economic development. It is, in fact, a foundation. Honorable members, this year marks 2 decades since the establishment of the South African Security Agency. For 20 years, SASA has stood as a most important pillars of the democratic transformation, ensuring that millions of elderly citizens, children, persons with disabilities, and vulnerable households receive support with dignity and consistency. When the African National Congress inherited this country in 1994, millions of Black South Africans were systematically excluded from the meaningful social protection. The apartheid regime used welfare system selectively and discriminately, leaving Black communities trapped in cycles of deprivation. Today, through democratic governments, social grants have become a lifetime for millions and one of the most effective poverty alleviation instruments in the development world. The renewed social theorist Piri Bourdieu argued that social institutions must actively confront structural inequality and social exclusion. The African National Congress, therefore, views social protection not as a charity, but as an instrument for restoring dignity, social participation, and social cohesion. The African National Congress proudly celebrated the work done by the SASSA over the past 20 years across villages, townships, informal settlement, and urban centers. Grant beneficiaries continue to rely on these services for survival and stability. In provinces such as Mpumalanga, where unemployment and rural poverty remain severe, in many districts, social grants continue to sustain vulnerable households and child-headed families. Equally in Gauteng, rapid urbanization and growing economic pressures have increased the number of working classes families dependent on social assistance. Chairperson, allow me to take this one to say, I am so grateful to debate with people who are predictable. It is well known that they are unable to bring new ideas and solutions, but for them, it is to reject everything. That means these people, they don't reject the budget, but they reject what's supposed to go to the people. That means they are rejecting people. Ngavele ngasho ngathi kuzoduma upotiyana kwabanye abantu. Lokho okwenza ukuba ikati ligibele esihlahleni kuzonifikela nani. Nizolithesa nenkume. Okukanye injobo izolingana nomsinsila ngoNovember. Sicela ukuthi abantu bonke baregister. Sicela ukuthi abantu bayozicheck bazokwazi ukuvotela inhlangano abayifunayo. Hayi amadlwana. Fellow South Africans, while most South Africans, their mindset thinks clockwise, it is unfortunately that some people from the opposition parties use their mindset anti-clockwise. What distinguishes the African National Congress with the opposition parties is that we do not approach social development through wish list and selective outreach. We believe in integration approach and transformation. We understand that building caring society requires institutions, resources, planning, and sustained implementation. Others are comfortable reducing social pain into political theater while offering no practice program for long-term social transformation. The ANC, by contrast, has consistently expanded a social wage, broadening grant access, strengthened child protection system, and institutionalized social assistance within the democratic state. Honorable members, I would like to borrow a quote from some wise people. Open quote. People may destroy your image, stain your personality, but they can't take away your good deeds, because no matter how they describe you, you will still be admired by those who really know you. Chairperson, I wanted you to come up with something as well. You know, some people, they are well known from the opposition party, in particular, the key one. They don't debate, they don't bring ideas, but they are just laptops of the lang gelede. They forget that they were hanging. They forget that there was Mr. Passon, Dr. Passon. They forget of all those things. And they forget that it is 374 years they were in power, but we only took 30 years. When a child gave birth, you must allow the child to grow. Angeke umntwana mana vele manje sekakwazi ukukhuluma, sekakwazi ukudla, sekakwazi ukudlala. Ngeke. Honorable members, as I'm here, it is unfortunately some of them, they will come after me. I know I can predict on what Mr. Honorable Mukai is going to say. I can predict what Honorable Duplessis said. I can predict them all, what they're going to say.
Nzimande, won't you take your seat, please? Honorable Nzimande, on what are you rising?
No, thanks, Chair. I wanted to ask him a question whether he's still debating what is supposed to be debated here in the House. Or now I want to ask a question, whether he will take a question.
Ah, you want to ask if he'll take a question?
Yeah.
Honorable Nzimande, will you take a question?
Okay. I agree, I will take your question, not now, but in the past when we travel home. So
I think you have your answer, Honorable Nzimande. You can continue. Thank you.
as I indicated that I can predict what they are going to say. They will say as if ANC have done nothing for the past 13 years. And some of the people...
We are traveling with different buses.
Members online, order, please. That's inappropriate in the extreme to unmute when you've not been recognized. Honorable Nzimande, please continue.
Most of the time when they talk about corruption and other things, they forgot one thing. To them, when new companies which belong to the black people, that is corruption. They believe in legacy companies, those companies who were there before, like Patton and others, I don't want to name them, that they must keep on getting those same benefits. So, Honorable Chairperson, allow me to say thank you very much and to thanks all these laptops to come and give their lang stories. Thank you.
Thank you very much, Honorable Nzimande. The next participant in the debate is the Honorable Breert from the Freedom Front Plus. Honorable Breert.
Thank you, House Chairperson. Maybe let me start out and answer Honorable Nzimande. It's very easy to predict what the Honorable Duplessis has said because she has already spoken. My name is the Honorable Breert. Also, this is exactly what is wrong with social development, is the cheap politicking that you are using to actually go at all of us here when we are trying to solve South Africa and trying to stand up for our citizens who are the most vulnerable. But let me continue, Chairperson. The Department of Social Development carries one of the most important responsibilities in government. It serves the elderly who cannot travel long distances and have no places to go. It serves the people with disabilities who struggle to get access to services. It serves the child living in poverty and a family that faces daily hardships. And this is why this debate cannot only be about budgets and programs, it is about human dignity. The department's budget has increased from 290 odd billion to 300 and something billion for this financial year. But yet, despite this increase, in real terms, with the inflation rate taking into account, this is not a win for social development. And then the question remains, are South Africans receiving services for this money? And too often the answer is they aren't. Ons hoor gereeld van mense wat in rye vir ure lank by SASSA kantore staan. Ouer persone en persone met gestremdhede moet dikwels ver afstande af lê net om diens te kry en dan sit hulle daar en hulle kom voor en dan word daar vir hulle gesê, oh sorry, we are offline. En dit is die probleem. Vir baie van hulle is die reis na daai SASSA kantoor toe hulle laaste sente wat hulle gebruik om hulp te kry en by etlike kantore is dit nie die laaste keer wat hulle dit moet doen nie. Die departement en sy entiteite gaan moet fokus op groter toeganklikheid. Vat byvoorbeeld SASSA. Hoekom het ons nie huisbesoeke vir daardie bedlende ou mense en daardie bedlende persone met gestremthede nie? Dit is mos waansinnig. Government cannot claim with success that we have greater access to services because we do not. The reality is that these vulnerable South Africans are often met with frustration and delays and poor services. And no budget, no matter the amount, can actually account for the lack of accountability, the lack of professionalism, and the lack of compassion at those points of service where it is delivered to our people. Voorsitter, die departement stem saam dat meer as 42% van Suid-Afrikaners, wat neerkom op meer as 50% van Suid-Afrikaanse huishoudings, is afhanklik van maatskaplike toelaas. This includes children and more than 4 million older people. And yes, social grants remain necessary because they provide a lifeline to millions of families and households. But social assistance was never intended to become a permanent substitute for real economic empowerment of these people. The department's own mandate speaks of empowering individuals and families and communities and building a self-reliant society. En dit is presies wat die VF+ wil sien. Ons moet mense ondersteun wanneer hulle hulp nodig het, maar ons moet hulle ook nie afhanklik maak nie. Success cannot be measured by the number of people who get SASSA grants every month. Success should lie in the number of people we get out of hardship and away from SASSA grants. Government should be creating conditions to allow for this to happen. But Chairperson, political instability, poor leadership and misplaced priorities have a real human cost. It is the poor, it is the elderly, it is the people with disabilities, and it is our vulnerable people that are at risk. Voorsitter, dit is ons tyd om beter dienslewering te eis. Dit is ons tyd om mense te bemagtig eerder as om hulle afhanklik van ons te maak. Dit is tyd om waardigheid terug te plaas by die mees swakste. It is our time. I thank you.
Thank you very much, Honourable Brett. Honourable delegates, we are going back online now to the representative from local government. That's Councillor Mahlangu, who has 10 minutes. Councillor.
Honourable Chairperson and the Deputy Chairperson of the NCOP, Honourable Acting Ministers and the Deputy Minister Social Development, Honourable Chief Whip, Honourable MEC present, special delegates, honourable members, good afternoon. SALGA appreciate the opportunity to present the perspective of local government on budget vote 19 for the year 2026-2027 financial year. Social development is experienced most directly in communities, and municipalities are whereby the reality of poverty, unemployment, hunger, vulnerability, gender-based violence, substance abuse, child neglect, and social exclusion are most visible. While local government is not the primary budget holder for social assistance and welfare services, municipalities remain critical partners in ensuring that social development intervention reach communities effectively. SALGA notes the positive commitment contained in the budget vote, including the extension of the social relief of distress grant to March 2027, efforts of strengthening social protection, support for vulnerable groups, continued focus on gender-based violence and femicide, and the modelization of SASSA systems. These priorities have significant implications for local planning, service delivery, and intergovernmental coordination. The first issue is that poverty is territorially contracted and locally expressed. Municipalities are where communities experience the practical effect of unemployment, food insecurity, informal settlement, vulnerability, inadequate access to care services, family distress, and violence. This means the impact of budget vote 19 will ultimately be measured not only by national outputs, but by whether people in villages, small towns, townships, informal settlement, and secondary cities experience real improvement in dignity, access, and well-being. SALGA therefore welcomes the broad direction of the budget, but stresses that implementation must be spatial, responsive, and intentionally localized. The second issue is the need for stronger intergovernmental alignment. There is still no alignment between national and provincial planning and priorities, and that is concerning. SALGA submit that municipal planning must be brought into this conservation more deliberately. Social development priorities should be reflected in district and metropolitan planning platforms. Integrated development plans, ward-based planning processes, and local intergovernmental forums. Municipalities plays a vital role in identifying vulnerable communities, supporting access for facilities, coordinating local stakeholders, and enabling community outreach. We therefore call for a structured intergovernmental implementation model that includes local government in planning, targeting, monitoring, and reporting on social development outcomes. Thirdly, SALGA supports the continued extension of the SRD grant and the department's emphasis on linking beneficiaries to livelihood opportunities. Municipalities strongly support a shift from passive income support towards developmental social protection. However, this transaction will only succeed if local economies are liberally activated through local economic and development initiatives, public employment programs, support for informal economies, food system, local markets, and social enterprises. Municipalities can help connect vulnerable households to economic opportunities. SALGA therefore calls for all formal local government role in connecting vulnerable households to sustainable livelihoods. Fourthly, service access remains a critical concern. Challenges relating to digital system, documentation, requirement, long queues, and access barriers continue to affect many beneficiaries, particularly in rural and undeserved communities. Municipalities are often the first point of contact when residents struggle to access grant and social services. Infrastructure such as tuition centers, community halls, municipal custom care facilities, and outreach programs can support improved access. But this requires strong partnership, appropriate resourcing. SALGA proposed a more integrated service delivery model in which municipalities, SASSA, and provincial social development department jointly coordinate outreach, beneficiary education, and referral system. Fifthly, SALGA wishes to emphasize the importance of addressing gender-based violence, child protection, and community safety. Municipalities confront the relief of GBVF daily through unsafe public spaces, inadequate lighting, weak support network, and the social impact of the poverty and substance abuse. Local government plays an important prevention role through safer public environment, communities awareness program, local partnership, and coordinated referral systems. SALGA support increased investment in shelters, victim support, service, and prevention programs, but stresses that this intervention must be integrated into local safety and social infrastructure planning. Municipalities must not be treated as a peripheral actors in these efforts. They are independently partners in prevention and response. Sixthly, Honorable Chair, municipalities are responsible for much of the public environment in which inclusive must be realized. Accessible building, inclusive public participation processes, equitable basic services, responsive local transport planning, and universal access to community facilities are all matters that affect the dignity of residents. We therefore support the department's policy and programs commitments in this regards, while stressing that municipal capacity and infrastructure support must be strengthened in inclusion is to be meaningful at community level. SALGA wishes to highlight the role of community-based organization and non-profit organization. Municipalities work closely with this organization in communities and know their values in delivery, food relief, self support, psychosocial care, youth program, disability support, and community mobilization. A well-functioning social development system depends on a strong local ecosystem of civil society partners. SALGA therefore supports measures to improve NPOs, registration, compliance, and funding efficiently, and encourages stronger collaboration between municipalities, provincial department, and community organization in identifying local priorities and co-producing solutions. SALGA welcomes the modernization of SASSA and broader dignitization of efforts, but caution that digitally transformation must not depend exclusion. In many municipalities, especially rural poor communities, the digital divides remain real. Connectivity constraints, device poverty, low digitally, literally, and documentation gaps means that a digitally first approach can indivisibly push the poor further to the margin if not carefully balanced with face-to-face service options. Municipalities can help bridge this gap through local access points and community support systems, but nationally and provincial entities.
Councillor, thank you. Your time has unfortunately expired.
Thank you very much. I submit.
Thank you, Councillor, and I'd like to also congratulate you on your correct background, a strong internet connection, a working camera. Thank you for respecting the House. You could teach many of our colleagues who presented today. Let's move on with the debate, honourable delegates. Back in the House for the Democratic Alliance, it's the Honourable Adriaan, sir.
I think you're all tired by now. Honourable House Chairperson, Honourable Acting Minister, Honourable Members, fellow South Africans, good day. The true measure of a nation is not found in cheap populist political rhetoric, policies or budget allocations. It is found in whether the poorest child, the unemployed youth, the elderly pensioner, and the vulnerable family are given a genuine opportunity not merely to survive, but to succeed. Social development should not be about managing poverty. It should be about defeating poverty. I was hoping Honorable Sibandi would be in the house because I want to take him down memory lane on our trip, our study tour. Because one lesson that stood out above all others was that successful social development is not measured by how much money a government spends, but by the outcomes achieved for its people. That lesson is particularly relevant as we debate this budget. The department's allocation increases from 295.2 billion to 302.4 billion. But when inflation is taken into consideration, yet again, this important department loses 2.8 billion in real purchasing power. So even more concerning is that the programs carrying the greatest burden of protecting the vulnerable South Africans are declining in real terms. The child support grant declines by 3.7%, more or less. The foster care grant declines by almost 10%. The SRD grant declines by almost 5%. Let's remember, this is not just numbers in a budget. We are talking about people, meals that are not bought, children not adequately supported, families pushed closer to desperation. In a country, as mentioned, where 42% of our population relies on social grants, these decisions matter. Honourable members, Switzerland places enormous emphasis on wellness, prevention, and early intervention. South Africa, by contrast, continues to spend billions dealing with the consequences of poverty, substance abuse, family breakdown, and malnutrition, rather than preventing them. Following on from the health debate, prevention is better than cure. The department itself acknowledges the growing challenge of child stunting due to malnutrition. Every child who suffers from malnutrition today carries that burden into adulthood. Every stunted child represents lost potential, lost opportunity, and a diminished future for our nation. That is why we continue to advocate for expanding the basket of VAT-exempted food items to include protein sources, peanut butter, baby food to help vulnerable families to combat hunger and the rising cost of living. It is also why the DA proposes increasing the child support grant to the same level as the official food poverty line. Chairperson, another lesson from Switzerland was the importance of personal responsibility and self-reliance. Social protection should provide support to those who need it most, but it should also create pathways to opportunity. The future of the SRD grant remains uncertain. Government intends replacing it from 2027 to 2028, yet millions of South Africans still don't know what the future holds. Parliament cannot allow vulnerable households to face income shocks because of poor planning. The DA therefore supports transforming the SRD grant into a job seekers grant linked to active job seeking, skills development, and pathways into gainful employment. Because social protection should be a bridge to opportunity, not a destination. South Africa is filled with talent, resilience, and potential. Yet too often, we manage poverty instead of confronting the real causes. A grant can help someone survive for a day, or today, or tomorrow. A job helps them build a future. A skill gives them independence. An opportunity restores dignity. We can do better. We must do better. We must build a system that empowers rather than entraps, develop rather than delays, and creates hope rather than dependency. Our most vulnerable citizens deserve nothing less. I thank you.
Thank you, Honorable Andrianse, for your input. The next speaker on the podium inside the House is the Western Cape MEC for Social Services, Honorable J.J. Lund, the former member of the NCOP.
Let's try again. Good afternoon, Honourable Chairperson, Honourable Acting Minister Chikunga, Deputy Minister, online, Honourable members in the House. Today I rise on behalf of the people of the Western Cape to contribute to this debate on Budget Vote 19. At the outset, let me welcome the increases in the Department of Social Development's budget. These increases are important. Across South Africa, millions of people continue to face unemployment, poverty, hunger, and rising living costs. Social grants remain one of the most important tools available to government to protect vulnerable people and provide dignity where it's needed most. The figures presented by the acting minister also remind us of the important role that social development plays in changing lives. These are not just statistics. These are young people whose lives are being changed through the support they receive. But while we welcome the additional funding, we must also ensure that every rand spent delivers real value to residents. For us in the Western Cape, the focus must always be on outcomes, accountability, and service delivery. Honourable members, the greatest challenge facing social development is not whether we have enough plans. It is whether we can work together effectively to implement them. Too often, residents do not care whether a service falls under national, provincial, or local government. They simply want help when they need it. That is why I want to use this opportunity to call for closer cooperation between the National Department of Social Development and provincial departments. We share the same goal. We serve the same people. And we should be working together to achieve the best outcome for our residents. The Western Cape stands ready to partner with the National Department wherever possible. But partnerships require open communication, mutual respect, and a shared commitment to service delivery. It cannot be driven by politics. Honourable Chairperson, one area where we urgently need improvement is SASSA service delivery in the Western Cape. We do acknowledge the progress made nationally through biometric verification, queue management systems, and efforts to modernize the agency. However, the experience of many residents in the Western Cape tells us that there is still much work to be done. For far too long, SASSA leadership in the Western Cape has remained in acting positions, while residents have struggled with delays, poor communication, and unresolved service delivery issues. We do welcome the permanent appointment now, and as we committed at the meet and greet, we need to re-establish that positive relationship that was at the beginning of this term was there, that faltered over the last year. For whatever reason, We need to get that working relationship back, Honourable Acting Minister, for the residents of this province, because our residents deserve better. The elderly standing in the queues, they deserve better. People with disabilities, they do deserve better. Caregivers and vulnerable families, they deserve better. We therefore welcome that appointment of the new leadership and look forward to building a constructive and productive relationship with them. The Western Cape Department of Social Development is ready and willing to support SASSA wherever possible, but that support must be matched by a willingness to work collaboratively and respond to the challenges facing residents. Partnership cannot be a one-way street. We must focus on delivering services quickly, efficiently, and with dignity. If we are serious about strengthening social services, then we must also invest in innovation. And yes, Honourable Sibandi, that means by using laptops and technology. Every day, social workers carry enormous responsibilities. They support vulnerable children, families in crisis, victims of abuse, older persons, and people living with disabilities. Yet too much of their time is spent on administration instead of helping people. This is why I want to encourage the National Department to invest in technologies that strengthen social work services. Here in the Western Cape, we developed the Social Work Integrated Management System application, which is a mouthful, which we just call it the SWIMS app. Today, more than 1,300 social workers across the Western Cape government departments use this system. That's Department of Social Development, Health, Department of Education, and we're looking to roll it out further to other departments. We've already rolled it out to NGOs, Stelcare, Valley Development, and RCFF. And just this morning, we trained Child Welfare, Helderberg, and Kraaifontein. More than 100,000 cases have already been captured on the platform. SWIMS help social workers spend less time on paperwork and more time helping people. It improves record keeping, support better decision making, and helps ensure that vulnerable residents do not fall through the cracks. Most importantly, it allows social workers to focus on people rather than paperwork. I believe there is an opportunity for government to explore how technology such as SWIMS can strengthen social services across the country. I was encouraged by the department's commitment to linking beneficiaries to sustainable livelihood opportunities. Social assistance must always provide protection, but it should also create pathways towards independence. This is why I would want to encourage the National Department to look closely at the independent living model that we are piloting in the Western Cape. Earlier this year, our department launched a partnership with 5 experienced non-profit organizations to support young people leaving alternative care. For many young people, turning 18 is exciting, but for those leaving foster care or child and youth care centers, it can be frightening and uncertain. Many do not have family support. Many do not have a place called home. Many face the risk of homelessness, unemployment, and exploitation. Our independent living program provides safe accommodation, mentorship, life skills development, psychosocial support, and assistance with education and employment readiness. Most importantly, it provides a sense of belonging. I would welcome discussions on how this model can be expanded to other provinces so that young people leaving care are given the support they need to build independent, successful lives. Honourable members, gender-based violence remains one of the greatest crises our country face. And while we welcome the continued support for shelters and psychosocial services, we must acknowledge that the scale of the crisis demands even greater investment. Every day, women and children continue to experience abuse and violence. Every day, social workers, shelters, and community organizations work tirelessly to support survivors. We welcome the continued funding of shelters and the commitment to expand services. But prevention programs, early intervention services, and victim support programs require sustained and increased funding if we are serious about ending the crisis. Classifying GBV a national disaster is not enough. It must now be declared a disaster so that the money can follow through to departments and NGOs that have proven they spent the money well. Honourable Chairperson, allow me to conclude by recognizing the incredible work done by child and youth care centres across the Western Cape. These centres provide far more than a bed and a roof over a child's head. They provide safety, they provide stability, they provide care, and they provide hope. This year alone, the Western Cape Department of Social Development opened the new Spitskop Child and Youth Care Centre in Maritzburg, bringing much-needed services to vulnerable children in the Karoo. We also launched the House of Grace Child and Youth Care Centre in Grabouw, a specialized facility that provides care and support to children with intellectual disabilities. These investments recognize that every child matters. Every child deserves protection. Every child deserves the opportunity to grow up in a safe and a supportive environment. The work done by our child and youth care workers, our social workers, therapists, and importantly, our non-profit partners is nothing short of extraordinary. They are often the difference between despair and hope. Honourable Chair, the Western Cape supports efforts to strengthen social protection and improve the lives of vulnerable South Africans. We welcome the budget increases announced by the Acting Minister, but we must now ensure that these investments are matched by stronger accountability, better cooperation between spheres of government, and improved service delivery. Our residents are not interested in political battles. They want services that work. They want government to work together, and they want dignity, opportunity, and hope. Let us place the residents first, and let us ensure that every decision we take is guided by the needs of the people we serve. On behalf of the Western Cape, I thank you, and I look forward to working with you.
Thank you, Honorable Land, for your input and the work which is being done in the Western Cape. And then the next speaker on the podium is Honorable PJ Farmer from the Western Cape too.
Thank you, Chairperson. It's refreshing to listen to a MEC from the Western Cape that doesn't mention his party's name in his speech. Honorable Chairperson, honorable members, I greet you in the name of Jesus Christ, our Lord and Savior. Chairperson, social development is not only about grants. It is about dignity, it's about protection. It's about whether an elderly person can buy food, whether a child can go to school with something in their stomach, whether a person with a disability is not forgotten, whether a mother escaping abuse can find a safe place to sleep. This is one of the most humane departments in government because it deals directly with pain, poverty, vulnerability, and survival. Chairperson, for 26-27, the department has tabled a budget with social grants remaining at the center of South Africa's social protection service system. We note the increases to the old age grant, disability grant, care dependency grant, foster care grant, and child support grant. These increases do matter, but let us be honest, they are still swallowed quickly by the cost of food, electricity, transport, school needs, and basic household survival. For many families, a grant is not only supporting one person, it is supporting an entire household. So when we debate this vote, we must remember that behind every number is a grandma, a child, a caregiver, a disabled person, an unemployed parent, or a family trying to survive one more month. Honourable members, the Patriotic Alliance believes that social grants are necessary. They are a lifeline. They keep millions from falling into complete destitution. But we must also say this clearly, grants must be a safety net, not a poverty cage. Social development cannot only manage poverty, it must help people move out of poverty where possible. That means stronger links between social protection, skills programs, community development, food security projects, substance abuse recovery, family support, and local economic opportunities. A mother receiving a child support grant must also be able to access skills training. A young person in a poor household must be connected to opportunity. A community dependent on relief must be supported to rebuild themselves. Chairperson, this year also marks 20 years of SASSA. We acknowledge that SASSA has played a major role in delivering social assistance to millions of people across the country. But we must also speak honestly about the problems. Too many beneficiaries still face long queues. Many elderly people struggle with systems they do not understand. Too many people battle with appeals, declined applications, and poor communication. Too many vulnerable people are sent from one office to another without answers. SASSA must become a doorway to dignity, not a queue of frustration. The Patriotic Alliance calls for a more efficient, accessible, and compassionate SASSA system. Digital systems are important, but they must not exclude the poor, the elderly, rural communities, and people without data or smartphones. Modernization must serve the vulnerable, not push them further away. Honorable members, we must also act firmly against social grant fraud. When someone steals from the grass system, they are not stealing from government. They are stealing from the poor. When official syndicates or dishonest applicants abuse the system, they take food from children, medicine from pensioners, and dignity from people with disabilities. Chairperson, social development is also responsible for much more than grants. We must speak about gender-based violence. Too many women and children are still trapped in violent homes because shelters are full, social workers are overwhelmed, and our community support systems are weak. Chairperson, NPOs and faith-based organizations are often the hands and feet of this department. They intervene where government is slow, but too many NPOs face late payments, underfunding, and administrative burdens. Support them properly, monitor them fairly, and hold them accountable when necessary. In closing, Honourable Chairperson, the Patriotic Alliance support this budget vote because we cannot oppose money meant to protect the elderly, children, persons with disabilities, foster families, victims of abuse, and communities facing deep hardship. Salute.
Thank you, Honorable Farmer, for your input. The next speaker is on the visual platform. It is the Honorable F.F. Rathilane, the MEC for Social Development in Limpopo. Over to you, ma'am.
Thank you, Honorable House Chair. The Acting Minister of Social Development, Honorable Cindy Kunga, Deputy Minister of Social Development, my colleagues, MECs, members of the Portfolio Committee on Social Development, distinguished guests, fellow South Africans, a very blessed evening to you all. Honorable Chair, it is with profound humility and gratitude that I stand before this august House today to debate Vote 19 of the Department of Social Development. It is a great honor to address this chamber, which plays a pivotal role in shaping the future of social protection and development in our beloved country. Honorable Chair, it is also worthy for me representing the province of Limpopo, which possesses high and rich history and heritage that contributed in the nation building of democratic South Africa. I am deliberately saying this because we represent this budget debate at the time our country and government is marking and celebrating notable milestones which took place pre and post democratic South Africa. We will, as we do now, together with the entire nation, continue to celebrate and cherish the 30th anniversary of the Constitution of our country, the 70th anniversary of People's Leaflet emanating from the corridors of Kliptown, the Freedom Charter, which remain the guiding bedrock to the supreme law of our country, commemoration of 50 years since the Soweto uprising, led by the younger generation who their effort and resilience has served as the catalyst to the realization of the 1994 democratic dispensation, not forgetting the courageous and brave effort of heroines who marched to the citadels of apartheid to demand abolition of hatred-passed laws against women. These are some of the remarkable moments which cannot go untold if we talk of the trajectory we traversed since 1994. I stand firm and upright in this august house that the establishment of the Department of Social Development and its entities are the offshoot of articulations, principles, and values set out in the Freedom Charter, the Constitution of our country, which at the center of them are the provision of equal rights, promotion of social security, and establishment of democratic governance based on universal suffrage and equal participation. Honorable House Chair, these are some of the motivating factors that led to the adoption of the Charter, the massive protest of more than 200,000 women to union building, and the generation of 1976 Soweto uprising. All happened in the name of equality, which this government continue to uphold, and which Department of Social Development is equally no exception, as I have already alluded to. This department bears the solemn responsibility of safeguarding the dignity, rights, and well-being of our most vulnerable populations, of our children, the elderly, persons with disabilities, the poor, and survivors of social ills, amongst others. We are entrusted with the noble task of building a caring society where no one is left behind and where every individual is afforded the opportunity to live with dignity and hope. As we debate Budget Vote 19, I want to acknowledge the significance of this occasion, especially as we conclude Child Protection Week, a week dedicated to raising awareness on the rights and safety of our children, as enshrined in our legal frameworks. Yet it is with a heavy heart that we began the Child Protection Month of May in Limpopo on a sober note with the disappearance of little 2-year-old Umpile Sithole. She is yet to be found. This incident, Honorable Chair, cast a shadow over our collective efforts to protect our children and serve as a stark reminder of the work that remains. We remain unwavering in our conviction that through strengthened collaboration among all stakeholders, community members, law enforcement agencies, non-profit organizations, civil society, and government, we can create an environment where children are safe from harm, abuse, and trafficking. Our commitment is resolute to ensure that every child in this country is protected, cared for, and treated with the dignity they deserve. Honorable Chair, poverty continues to ravage our communities, and Limpopo bears a disproportionate burden in this regard. It is a harsh reality that exacerbates vulnerabilities and perpetuates cycles of hardship. That is why we welcome the extension of the Social Relief of Distress grant until March 2027, a vital intervention that provides much needed relief to our people who rely on this support for their basic survival. Furthermore, House Chair, we are pleased to learn, as announced by the Acting Minister, on the progress made by the department since the tabling of the draft basic income support policy to Cabinet, particularly the costing model. This policy represents a transformative step towards addressing poverty and inequality, offering a sustainable safety net for our most vulnerable citizens. We believe that this intervention, once implemented, will significantly alleviate the hardship faced by many families and contribute to the broader social cohesion we all strive to achieve. In our ongoing efforts to combat hunger and improve food security, we have intensified our food parcels program. While the demand in Limpopo continues to outstrip supply, having moved from 4,500 to over 7,200 families, this increase, though modest, is a testament to our unwavering commitment to reach more families in need. We recognize that food security is fundamental to social stability, and we are determined to expand these efforts further. Our social fabric is also challenged by pervasive social ills such as gender-based violence and femicide. The acting minister in a recent address highlighted that 142 shelters funded by the department continue to provide refuge to victims of abuse. Since the classification of gender-based violence and femicide as an emergency by the president, we have doubled our efforts to support victims, hold perpetrators accountable, and raise awareness to prevent further violence. Limpopo, unfortunately, remains one of the most affected provinces, but we are committed to intensifying our response, supporting victims, ensuring justice, and fostering communities free from violence. Honorable House Chair, the Department of Social Development remains the last line of defense for the vulnerable, and we take this mandate seriously. Working in partnership with our agencies and stakeholders, we will continue to mobilize the resources, implement impactful programs, and uphold our commitment to social justice. I want to reaffirm our unwavering dedication to building a caring society, one where every individual, regardless of their circumstances, can access the support they need to live with dignity. And as Limpopo Province House Chair, we call upon this esteemed House to support the budget of Social Development Vote 19, which is a reflection of our collective resolve to serve the vulnerable and uphold the rights of all citizens. Let us work together in unity and purpose to create a future where social justice prevails and no one is left behind. Thank you, House Chair.
Thank you, Honorable Rasilane, for your input and indicating what is happening in Limpopo. The next speaker is inside the House. It is Honorable Peter from the Home of the Legends.
Sihlalo walendlu namalungu alendlu ahloniphekile nakumphathiswa osa-ektayo nakube mbongi boMzantsi Afrika manicele untingele ngilane. Honorable Chair, the mandate of the Department of Social Development is far greater than just providing grants. It has a duty to develop and implement programs aiming at eradicating poverty, ensuring social protection and social development among the poor, the most vulnerable and marginalized. Given such a pivotal role, the department has been failing to design an integrated poverty eradication strategy that will provide direct benefits to those in great need, particularly women, youth, and children in rural areas and informal settlements. There is a severe implementation and delays policies, failing systems, and increasing dependence on social grants instead of sustainable economic opportunities. Millions of South Africans still rely on social assistance simply to survive while unemployment remains critically high. At the same time, communities continue to suffer from gender-based violence, and welfare services are very scarce. Many people in rural areas still do not know where to go when they have been raped or assaulted. The Tutuzela care centers that are meant to help victims are no more to be found in rural areas. Amongst many departments' failures is the lack of awareness campaign to promote social protection of children and older persons. Recently, we have seen a high number of children abuse. Elderly people are also financially abused with the SASSA grants and neglected. Yet the department has not conducted any awareness campaign on elderly abuse and reporting methods. in the Eastern Cape rural areas. There are many elderly people staying alone. They are often robbed of their SASSA money. We must be honest. The number of social workers in this country are not even 50 enough to respond to the social needs of our people. The department must employ more social workers on the ground to respond to the challenges faced by the communities. The UDM has been calling for the department to hire more social workers to help the troubled kids in social, because without help, these kids will grow up to the end. Emphathiswa omhle, abantwana bethu bajika babe ngamaphara. Sicela social development ayi-expande le ndlela asebenza ngayo, aze nee-new models ukuze kunciphiswe la maphara ahlala ezilokishini. Mhlali ngaphambili, social development unoxanduva lokwenza ii-NPOs nee-NGOs. Ingxaki abantu abayazi ukuba yintoni indima amabayidlale kwa-social development. Sele bezenzile ezo NPOs, abafumani nkxaso kwalapha ku-social developments. Kwakho iprogram eyayikho kwa-social developments, uvula i-NPO apha kuye kodwa angakwazi ukunika inkxaso, ungayazi ukuvulisela ntoni na. Siyacela ke social development, si-UDM siyakuxhasa, nebudget yakho siyayixhasa, masenzeni ii-new models, abantu bethu babenefit. Enkosi.
Thank you, Honorable Peter, for your input. The next speaker is on the visual platform, the MEC for Social Development from the Northern Cape, Honorable N. Manopule. Over to you, ma'am.
Thank you very much, Honorable House Chair. Good evening, Acting Minister of Social Development, Honorable Sintiswa Chikunga, Deputy Minister of Social Development, Honorable Hendricks, Chief Whip, Honorable Kenny Muimang, Honorable MECs, Honorable members, ladies and gentlemen. It is an honor to rise in this House in support of Budget Vote 19. As we debate this budget, we must acknowledge that many of social challenges facing our country today is poverty, violence, substance abuse, food insecurity, and child vulnerability, as rooted in the legacy of the apartheid, which has weakened families, disrupted communities, and entrenched inequality. While democratic government has expanded social protection and restored dignity to millions, much work remains to rebuild families and create stronger, safer communities. That is why Budget Vote 19 remains so important. Honorable Chairperson, in the Northern Cape, social protection continues to play a critical role in supporting vulnerable households. As at 31 March 2026, more than 541,000 social grants were in payment in our province, with grants value at over 7.2 billion, disbursed during 2025-2026 financial year. This demonstrates government is continually committed in protecting vulnerable households and restoring dignity of our people. Gender-based violence and femicide. Honorable Chairperson and honorable members, gender-based violence and femicide remain one of the greatest social challenges facing our country. Women and children continue to experience violence and abuse in spaces that would provide safety and protection. In response, Northern Cape Department of Social Development continue to strengthen support services to victims and survivors. Through our partnership with SAPS, 75 gender-based violence and femicide volunteers has been placed in 41 police stations across the province to provide immediate support and referrals through victim-friendly facilities. This program will be expanded during the current financial year. The province is also working with National Department of Social Development and the Department of Public Works to establish Kusela One-Stop Center, which will provide integrated support service and empowerment opportunities for survivors. We recognize that economic dependency often traps women in abusive relationships. For these reasons, empowerment and skills development remain central in our response for gender-based violence and femicide. And the House Chairperson, substance abuse continues to destroy families.
Honorable Nonkonyane, please don't disturb. Switch off your video. To you, MEC.
Okay. Fuel crime and let substance abuse continue to destroy families and fuel crime and undermines future many young people. In the Northern Cape, we continue to strengthen community-based prevention and intervention programs, particularly in areas mostly affected by alcohol and drug abuse. The department is partnering with organizations in the sector to train NGOs and volunteers to review the Kimoja program, which has been implemented in schools to help learners make informed choices, improve educational outcomes, and avoid substance dependency. We remain committed in building safer, healthier communities free from the destructive impact of alcohol and drug abuse. Children and protection, House Chairperson, protecting children remains one of the government's most important responsibilities. To address teenage pregnancy and other social challenges affecting learners, the department has partnered with the Department of Education to place 48 child and youth care workers in priority schools across our province. In addition, 50 intense social workers will be deployed to provide psychosocial support and implement social behavior change program. The province has also continued to support initiatives such as Ezikweleni program and the MEC Back to School program, which provide school uniform, dignity packs, stationery, sanitary towels to vulnerable learners. During the previous financial year, about 2.2 million spent to 906 learners who benefited from this intervention. These programs are investment in the dignity and safety in the future of our children. Youth development and employment creation, or House Chairperson, the future of the Northern Cape depends on the opportunities we create for young people today. During 2025-26 financial year, the department trained about 158 young people through an accredited skills development program in partnership with the Northern Cape Eben Tibet College and other stakeholders. We also continue to provide workplace-based learning opportunities through partnership with municipalities and private sector, enabling young people to gain valuable experience and access to employment and opportunities. During 2026-27 financial year, the department will provide additional skills development opportunities to further expand the program to young people across the province and operationalize youth skills development hub with a particular focus to artisan and technical skills. This initiative forms part of our commitment to equip young people with competency required to access employment and entrepreneurship and other economic opportunities. Our analysis of SRT 370 grant beneficiary profile indicates that approximately 60% of approved beneficiaries are youth, many of whom have educational qualification above grade 10. The Youth Skills Development Hub will therefore serve as a critical pathways to transition beneficiary from social assistance to economic participation. In this way, by linking beneficiary to such opportunities, this projected 785 million allocated to SRD beneficiary will not only provide immediate relief, but also contribute to developing the skills, employability, economic potential, and young people across the Northern Cape. In addition, through expanded public works, we will provide 1,678 work opportunities, providing much needed income and pathways into labor market. This intervention demonstrates our commitment to ensuring that young people become active participants in economy and drives of development, I beg your pardon. Food security, Honorable House Chairperson, poverty, hunger continues to affect how many households across our province, particularly in rural communities. Northern Cape continues to implement an integrated food nutrition security programs in partnership with different government departments, municipality, and private sector. Through this intervention, the department currently funds 232 service aimed at addressing food insecurity and providing nutrition meals for approximately 49,000 vulnerable beneficiaries across our province. While food relief remain important, we are increasingly focusing on sustainable resolution through community-based food garden and livelihood programs that promote self-reliance and long-term food security. These initiatives are helping communities produce food and create work opportunities and improve household resilience. In conclusion, Honorable House Chairperson, this budget is about restoring dignity. It's about protecting women and children. It's about fighting poverty, hunger, and substance abuse. And it's about strengthening families and communities. Together, through partnership and collaborative effort, we can continue building society where person has dignity, hope, and opportunities. As Northern Cape government and the Northern Cape Department of Social Development, budget allocation of 2026-27 and about 1.1 billion is in support of the work that is done by a national department towards protecting women, children, older persons with disability. Therefore, I rise to support this budget vote in 19 Chairperson. I thank you. Thank you.
Thank you, Honorable MEC, for really indicating to us what is happening in the Northern Cape. The next person to come on the podium is Honorable O.J. Mukaye, another note taker.
Honorable House Chairperson, Honorable Acting Minister, Honorable Deputy Minister on the online platform, Honorable members and fellow South Africans, good evening. This department has a total allocation of just over 300 billion rands, making one of the top 3 funded departments. This is largely due to its social assistance program. It is thus imperative that oversight on the budget and operations of the department is heightened. It needs to be heightened, as Parliament heard yesterday. The road within this department does not stop with the fight Minister Tolashe, but implicates even the Deputy Minister Hendricks as well. The leadership of this department, both political and administrative, must act above reproach. This is important as social development is mandated to be the vanguard of the most vulnerable amongst us. It is mandated to assist the poor and marginalized. However, we have noted with much horror and dismay how this department was led by individuals with questionable moral and ethical standards in the recent times. We have seen with embarrassment how they have squandered public resources for personal gain, giving senior jobs to unqualified individuals. This is the hallmark of abuse of power and corrupt activities. The critical work carried out by this department daily for marginalized communities was completely overshadowed by bad headlines. Honorable House Chairperson and members, while we welcome the axing of the former Minister Tolashe and the departure of Director General Nechipale, leadership squabbles and instability is something we least expect from this department because it plays such a crucial role for the vulnerable and we cannot fail them. You see, this is not an isolated situation, but rather a clear demonstration of the systematic failure of the ANC government over the years. Journalist and author Tara Ross captured the ANC well in her latest book, and I quote, Years of factionalism, corruption, and bureaucratic inertia had hollowed the party from within, stripping it of moral authority and leaving its capacity to inspire almost extinguished. Close quote, Honorable Sibande. How can we forget the words of the former minister of this very department, Mebatabile Dlamini, when she said, and I quote as well, all of us in the NEC have our smallanyana skeletons, and we don't want to take all of these skeletons because hell will break loose, close quote. These are not my words, but the horror stories that are well detailed in the public domain. We know too well what transpired under her watch. What has happened in the top echelons of this department should serve as an important lesson that the days of stealing from the poor are over, that corruption and malfeasance will never go unabated and treated with impunity. The stabilization of the political and administrative leadership of this department is crucial, because this department now has an acting minister and an acting director general. We hope that permanent appointments will be fast-tracked as a matter of urgency. What happened here must never be repeated, because we know too well that corruption and greed rob the ordinary men and women in the streets. The Democratic Alliance believes that state resources that you will adopt in this budget vote must be used to uplift the vulnerable groups in society, as this department is mandated to do. Acting Minister, we must never again hear that employees' salaries are halved and redirected somewhere else. We don't want to hear of beneficiaries struggling to get their grants due to inefficiencies in the system. And that is very important. And I think a lot of the honorable members, they raised the issue of the allocation and administration of grant system. Honorable Chair, the less said about the EFF and MKP, the better. They continue to demand and tell us what must happen, but they don't support the very budget that must deliver those services. Honorable Chairperson and members, as I conclude, let us do right by the people of South Africa. They do not ask much. Just as the slogan of SASSA says, paying the right social grant to the right person at the right time and place in Jalo. Indeed, let these words be the reality of those who depend on the state. I thank you. Ke a leboga, baie dankie.
On that note of Bayadanki, thank you for telling us what is involved with the
Phuta kanjalo umkai. Danke kuphuta kwakhe.
Honorable Nonkonyana, stop doing what you're doing because you're disrupting the house. If you want to heckle, please come into the chamber. That's why you can heckle, because you're disturbing the whole system here. All right, without further ado, I'd like to call Honorable M. Feni to come and take his 13 minutes of glory.
Thank you very much, Honorable Chairperson. Let me take this opportunity to greet the honorable members of this August House, not forgetting the Honorable Minister Chikunga in our midst, also the Deputy Minister Hendricks. Salga, our councillors, as much as important in this debate as it is taking place to where they are. Indeed, inkosi zethu kuba thina singabantu bazo, led by Honorable Advocate Nonkonyana. Allow me, Chairperson, first and foremost, because it's very important that we must not forget Honorable Peter. After his elections as a provincial chairperson, he has taken a milestone in terms of his leadership. I won't say anything to you, my colleague, Honorable Billy. You know, I'm sympathizing with you. I won't say what happened, but next time you will make it. Honorable Chairperson, in supporting this budget, I think it's important that Honorable Minister Chikunga to appreciate the support that is going to be getting, because the speakers have confirmed that they are behind you. They are giving you all the necessary support to shape up and shake up things in the department. Also with your deputy minister. The question of acting position, I think it's important to highlight it that you do have all the necessary authority with your acting DG to make things to happen, to follow the budget that you are adopting today, so that you do not come here and lament. I think that's what the honorable members said here. They are giving you all the necessary support to move forward with the budget. It is important also to raise this issue that is disturbing, that was taking place in this house, the undermining of the chairperson of the select committee by one of the honorable members here. I want to say to you, Honorable Chairperson, Finis, do not be deterred. Slowly but surely, we're going to deal with the question of white supremacy. Whenever it shows its head, we will deal with it, especially they used, especially by mail that have been used to do that. The abuse that smaller that we're talking about here in the adoption of this budget, we laugh at it. But when things get worse, that's when we begin. That cannot be under our name as males. Black or white, we can't allow that to happen in this country. This is the journey that we are undertaking. So this bullyism that the president of this country, the only CIC of this country have alluded unto, the bullyism, we must totally reject it, no matter where it is coming from, no matter what color it is showing. We must just deal with it as it is show it is. We will never be deterred to transform this country. The country still needs to be transformed, both socially and economically. The fact that you still see the signs of segregations, see communities are being divided by leaders. Unfortunately, the leader from the MEC of Western Cape is here. I mean, it's no longer, he have left. I was going to lobby him to assist in terms of dealing with this question of having two cities. I mean, two cities in one province. You have a Western Cape that is on the other side. That has not been yet addressed politically. It needs, because its partial planning is clear. It still serves those interests. It still continues to perpetuate the poor and the working class on the other side. And you have the gloomy side. And what is worse, they want to build a wall that is going to be continuing with the segregation. This is what is happening in Israel. It tells you that the agenda that you are supporting, Honorable Mokai and Honorable Billy, have nothing to do with you, but it have anything to do with what has been happening. So I'm saying that these things I know are not easy to be addressed, but in terms of what we want, in terms of building one nation and one country, we have still a long way to go. The unfortunate
Please,
the unfortunate part is that
hold the horses. They've started it. I was looking at you. Please hold your horses. You have been given a chance to articulate whatever you articulated. So respect the speaker on the podium so that you can hear what you want to say. Over to you.
Don't worry, Chair. We will hit the dog and the owner is going to come out. nothing that is going to stop us to say things because everyone have been given an opportunity to speak here. No one was intimidated. We will say things as they are. If the shoes fits you, wear it. It is not our responsibility. Chair, I want to also to indeed appreciate the inputs from both Honorable Du Plessis and Honorable Adrianse. I think I cannot be silent on their reaffirmation of what is in front of us. Indeed, they want what the Honorable Minister here have been presented in terms of what kind of a budget must be how the budget must be constituted in order to address the question of your social cohesion, not to make the social grant as a destination. I think one of them have raised that. I think we must appreciate it that at least there is a direction that we are taking. We are going to leave alone those who do not want to be part of this nation. So we must appreciate that. I think the Honorable Minister have had that very well. It's so unfortunate that those who are making a lot of noise, they are not here. We are hearing that the MKP is on the left, but they cannot comprehend with what left is. They made an embarrassment of themselves. They made the embarrassment of themselves. They were pleaded. They were pleaded in terms of understanding what the conference of the left was all about. So it's clear even here, when they are rejecting the budget, they don't know what they are saying because the instruction that they were given, it's not clear. I'm encouraging them to go back and get, they are going to be where we are. So we are available just to assist them so that they can be acquainted with the left politics. You can't run away from socialism if you are claiming to be a left. No, you can't. It's totally counter-revolution. It's clear, in fact, that what they are talking about, what they are standing for, they are not sure. Even those that are here, they are not sure when they are going to be recalled because it is their daily bread. I can see they are not relaxing. We go with the EFF. It's unfortunate. They continue to spread lies. They are used to mislead the society. And they think that society is still appreciating their lies. They are not. They were corrected here in I think it's here in Western Cape, where there was a murder, a criminal conduct. They began to politicize it with misinformation. In fact, the community exposed them that, look, go and look for something else because you ran out of your ideas. There is nothing new to offer to the society. That is why you have nothing else to say. You are used to be shouted at. When you are amongst us, there is nothing to shout at. Even the misinformation of corruption. If you are not reporting corruption, in terms of the law, you are an accomplice to that corruption. You must be arrested. You can't make noise of a corruption without giving specific to say this one stole money of SASSA. It directed the money. You are not doing any favor, but you are just opposing. You are still not voting for the budget. But you continue to enjoy the benefits of the budget that other members are voting. And the communities that you are going to lie to, they are watching you today, that you are not part of what we are saying. You are here for your own convenience, not for the service of the working class and the poor that you are claiming to be representing. That was unfortunate. Chairperson, all further in supporting the budget, I think I must just borrow from the teaching of the former Deputy Chief Justice, Dikgang Moseneke, to those who are claiming to be Africanists. I think they must listen properly in terms of how do you build a nation on what the African National Congress is currently doing. He is saying we are entitled to try and recreate a society and move from the dark space into a better lit up space. And surely improve the lives of the people. This budget is talking exactly to that. Come closer, all the Pan-Africanists, to where the Pan-Africanists, the socialists, even the communists understand exactly that you can't address the question of your social cohesion if you always run away from where the majority of the people are. So we must continue to learn as to how do we change the conditions of our people, how do we shape this country. That is why this intervention by the government of the African National Congress have been giving a relief to our people. The question of a social grant, that we are making noise, we do not even understand. We are confusing it. You must learn. You must learn as to how.
Let honorable delegates, let us give the speaker on the podium a chance to articulate, as you have been given your chance to. Over to you. I'll start throwing people out now. Over to you on everything.
Thank you very much, Honorable Speaker, for your protection. In doing so, our approach must be grounded on the philosophy of Ubuntu. Ubuntu, one might not understand it, but it's a simple philosophy that has been followed for many decades by our forerunners. Umntu ngumntu ngabantu. Even those who are trying to run away from where we are at the center, we are saying we are going to be patient with you. We are not going to throw you away. You are going to be a sharp object because we'll continue to sharpen you to where we want you to be. We will never do that. We never even gave up during the apartheid time, where the people who wanted to cause this country, to drive this country into chaos. We never ran away from that. It's what we are currently doing. Chairperson, what is important with this budget, when we're adopting this budget, we must not lose hope. We must try by all means. Let's make sure that our people are not given up, are not allowed to be confused by people who are taking advantage of them. I won't quote what what the former president of this country warned us about those people. He called them imigodoi. I won't go further than that, but I want to say we can't allow people to continue undermining us in building the nation. Thank you very much, Chairperson.
The note of imigodoi. Your time is it. Thank you, Honorable Fanny. Thank you, Honorable Fanny. And now, Honorable Acting Minister, the people of the Republic have spoken through their representatives. Please respond to them. Over to you.
Thank you very much, Honorable House Chair. Let me begin by thanking all honorable members for their contributions to this debate. We have listened carefully to the issues raised, the concerns expressed, and the proposals made. I do look forward to working with honorable members and engaging further. I thank all MECs and the Deputy Minister for participating in this debate and for outlining the work they are doing in provinces and their areas. You are correct, Honorable Finis. Social development is not charity. It is part of the democratic state's obligation to confront poverty, hunger, and exclusion. The exclusion that was legislated when social grants were determined by race. Thanks to the ANC government, all South Africans who qualify are now receiving equal grants from the state. Honorable Du Plessis and Mukaye, all that you see is corruption and nothing positive. Honorable Du Plessis, Honorable Mukaye, SAYA pays grants at least to more than 25 million beneficiaries every month. I mean 12 times a year without fail. Can you not appreciate that? This is the largest scheme managed by the state, and it does that successfully every month. There may be glitches here and there, but these are addressed as beneficiaries visit SASSA offices. And of course, we are dealing with any possibility of corruption, hence the lifestyle audit that I spoke about and the establishment of the independent inspectorate. It is also not true that food parcels are distributed to politically connected. The Department of Social Development distributed food parcels, even here in the Western Cape, to many flood victims, together with hot food, not to victims or those connected. Also, Honorable du Plessis, here in the Western Cape, let transparent procurement of work is being done. We have actually submitted an action plan to Cabinet, and it was approved by Cabinet while implementing that. The state runs the following support programs for victims support in Tutuzela care centers, white doors and green doors, in shelters, in victims-friendly rooms, and in police stations. We are also strengthening the capacity of the Central Drug Authority, and we are agreeing that indeed it is a problem. Honorable Mapuru, most SASSA offices are operating together with service points that are nearby to reduce the pressure of long queues. In some offices, of course, like Motherwell, this is actually happening. But of course, we also get affected by criminal activities that affect our operations. Honorable members, some honorable members drafted their speeches about 2 weeks ago. They looked forward to the former minister being here. Disappointed as they were, they still felt that they must deliver the outdated speeches. And that is why they still say, Minister Tolashe this, Minister Tolashe that. She's not here. We have the budget vote that we have presented, that we are asking you to support so that our vulnerable, the most vulnerable, can then get their grants at the end of the month. And I say this, and I say the ANC lives, the ANC leads. Thank you very much.
Honorable delegates, I would like to thank the acting minister, the deputy minister, permanent delegates, and the 6 MECs and all the special delegates and SALGA representatives for availing themselves for the sitting. Honorable delegates, that concludes the business of the day. The House is adjourned.